Hi everyone, good evening all of you, good evening everyone. Yes, Dr. Miraj, Dr. Vadhi, Dr. Shweta, Dr. Aniket, Dr. Sapna, all of you. Yes, yes everyone, good evening. Dr. Rituraj, I'm glad, chalo everyone, yes, Dr. Vikash, Dr. Zishan, yes. Yes, good evening everyone, good evening. Salam, namaste to all of you, yes. Dr. Atharv, Dr. Neeraj, Dr. China. Chalo, fine, theek hai. Chalo, yes, we can start. Yes, everyone. Yes, salam, namaste to all of you. Chalo, I'm glad to see you people. Theek hai, we are going to start learning about forensic science today, right? See here, like so many, like so many updates are there. All BNSs, right? See here, all BNS, we are going to sound कम है एक बार जरा साउंड चेक करेंगे yeah Dr. Aryan yeah it should be enough okay volume is very low okay चलो इसको थोड़ा तेज कर लेंगे now is it fine with you people okay जरा एक बार चेक कर लो if voice is clear then we can continue yes एक बार चेक कर लेंगे okay voice clear अब देख लो जरा voice is clear now yes now it is clear okay chalo fine so we are starting with the new updates in IPC CRPC Indian Evidence Act right see here first of all see the new name of IPC is what this is see Bharatiya Nyay Samhita see Nyay means actually justice okay Bharatiya Nyay Samhita and see a CRPC which is now called as Bharatiya Nagrik Suraksha Samhita. Nagrik means citizen and Suraksha means protection, right? And Indian Evidence Act, now the new name is Bharatiya Sakshay Adhiniyam or Bharatiya Sakshay Bill. Remember here, when I talk about IPC or BNS, basically this defines the law and offenses, right? And when I talk about CRPC or BNSS, right, this defines the, see, how to proceed with a case, right? Okay. Center your thing. Video lagging, sound is coming low. Okay, is this fine now? Sound is clear now? Okay, chalo fine. Now it's fine, I think so. Theek hai, chalo, all right. See, yes, what I'm saying is that BNS, video lagging. Okay, chalo fine. Now it's fine, right? Okay. See here. So one more time I'm going to explain. See here, BNS means what? IPC, right? IPC, right? It was what? Indian Penal Code. Now it is what? BNS, Bharatiya Nyay Samhita. This defines the law and offenses. Okay. And CRPC or Bharatiya Nyay Suraksha Samhita. See how to proceed with the case, right? Okay, fine. So basically this is about the procedure. And Bharatiya Sakshay Bill, see, this is about how to collect the evidences, right? Okay, fine. Now see here, so we are going to discuss the most anticipated BNS. Okay, most anticipated. First of all, see here, favorite question for FMG exam is what? McNaughton's rule, right? McNaughton's rule. If an insane person, unsound-minded, see here, if an insane person, unsound-minded person, if he commits any crime, there will be no punishment. There will be no punishment, right? Like earlier it was IPC 84. Earlier it was IPC 4, very, very common, hai na? 84. But now it is BNS, see, 22. Very, very important, right? Now, few IPCs you should never be forgetting. So one is what? Like McNaughton's rule, after the dowry, death, murder case, rape cases, right? Medical Negligence Act. Easy to understand? Right. Chalo. Yes. Very good. Yes. Very good evening. Very good evening, Dr. Sinan, Dr. Rohit. Yes. Dr. Shivani, all of you. Yes. See here. So McNaughton's rule is now BNS number 22. After that, see, whenever there will be emergency, right? In an emergency condition, we don't need to take the consent. Okay. BNS number 30. BNS number 30. Right. In emergency condition, राइट? वो था ना मूवी आई थी मुन्ना भाई में कि भाई अगर कोई मरेला तो पर्चा कटाना जरूरी है क्या? नहीं है. Okay, as per BNS 30, right? Now see here, BNS number 106. Earlier, see, for Doctors Medical Negligent Act, right? Now, Medical Negligent Act, earlier it was actually what? Earlier it was IPC number 304A, old. But remember, now it is 106. Now it is 106. This defines the Criminal Negligent Act, rash and negligent act. Remember here, see here, for this actually, how much is the fine? See, 5 years. 5 years of jail. But for doctors, yes, this is up to 2 years, right? Up to 2 years as per 106. And remember here, see, earlier IPC number 320 was grievous hurt. Earlier, old, right? Very commonly asked. So what is the meaning of simple hurt and grievous hurt? When I talk about grievous hurt means what? Janleva hamla, life-threatening condition, right? No, life-threatening condition, right? So like emasculation, after they fight if a person is blind or deaf or fracture of bone, right? No? So see, remember here, all these are what? Grievous hurt. Now it is 116, BNS 116. Related to abortion, please keep in mind 88 to 92. 88 to 92. Now, related to murder, earlier it was IPC number 300 and 302, right? Earlier. But now it is 100. See, 100, 101, 103 and 105. See, definition of culpable homicide means like 100% a person wanted to kill someone and he killed that person. So like which is 100% punishable, right? Definition of the culpable homicide, 101, right? But see here, so 100. 101, culpable homicide not amounting to murder. Not amounting to murder. Now, 103 is this. See, this is actually the punishment for murder. But 105, so remember here 100. Okay. Now, 101, 105. See, the punishment for culpable homicide not amounting to murder. Next, related to rape and sexual offenses, right? Okay, fine. See, remember here, earlier it was actually 375 and 376 old. But see, why I'm writing old also now? Because you are supposed to forget it. Okay, fine. And now we are working with BNS. Now 63, 64. See, definition of rape: without consent and will of female. If a man is going to attempt for sexual intercourse, okay, so that is called as a rape, right? And so this is 63 number. But for the punishment for rape, 64. And 64 BNS. Remember, gang rape, 70. 63, 64 and 70, very, very important. But apart from that, remember here, sexual, sexual harassments and, like any kind of offenses related to sex part, right? So that will also be punishable offense. Remember here, sexual harassment. 75 and 76 you cannot forget. 75, remember here, like sexual harassment. What is sexual harassment here? Unwanted physical contact, right? Showing porn videos or photos against the will of a female. Say you're requesting for or demanding for sexual favor, obviously punishable offense. Making sexually colored remarks, euphemism and all, as per 75. Disrobing. After using their power, if a person is going to disrobe a female, to remove their cloth, right? That is 76, punishable offense. Voyeurism, peeping Tom, right? Or like if a person is watching someone, like suppose if there is a couple, they are having sexual intercourse, and if a person is watching them secretly for sexual gratification, or if a female is undressing and if a person is watching her secretly, right? That is called as voyeurism. And he's peeping into the privacy of someone, that is called as peeping Tom, scotophilia. This is a punishable offense. 77. Stalking without the knowledge of a female, if a man is going to follow her, online, offline, both, okay? So stalking, 78. See here, by any gesture or by any word, if a man is going to outrage the modesty of any female, this is also a punishable offense. 79, right? So remember here, 75, 76, 77, 78, 79. Remember here 75 to 79 BNS I have mentioned here for sexual offenses. For rape, you should be knowing 63, 64, 63, 64. Earlier it was actually 375 and 376. Right now, see here, earlier this was for rape and this was for the punishment of rape. But now 63 and 64. Okay, very, very important. Now, see the perjury. Suppose if a person is lying in the court after taking oath, if a person is lying in the court, शपथ लेके झूठ बोलना, that is called as a perjury. This is a punishable offense. So, see, earlier it was 191 and 193. Right now, earlier it was 191, 192, 193. But now it is, say, 227. This defines perjury. And say 229. See, this is for the punishment for perjury, right now up to 7 years. And 228, fabricating the false evidences, issuing false certificate and using false certificate, right? Both are punishable offense. This is as per 234 BNS, right? 7 years of punishment. Embalming. What is the meaning of embalming? Can you tell me what is the meaning of embalming? See, embalming means artificial preservation of dead body, right? Artificial preservation of dead body. See, in anatomy lab, the dead body, what you see, that is after embalming, right? What is the other name of embalming? Can you tell me? One more name of embalming is what? This is thanatopraxia. This is called as, see, thanatopraxia. Right now, thanatopraxia. Yes, PDF is also given. I think you can check the link below. I think PDF is shared. All right. Chalo, theek hai. See, thanatopraxia, artificial preservation of dead body, right? Embalming. Now, when it will be considered as a punishable offense? Okay. Now you tell me, suppose if I have to do post-mortem examination, suppose if I have to do autopsy, suppose if I have to do autopsy, okay, autopsy, right? Autopsy is actually post-mortem examination. My question to you is that autopsy should be done before or embalming should be done before? Can you tell me? Okay, Dr. Rahul, the topic will come, don't worry. Ye batao. PDF is different. How PDF can be different? देखिए वो check करिए एक बार. Same PDF I've shared, right? Okay, I think yeah, okay, chalo fine. So this will be shared again, don't worry. Right? This will be shared again, don't worry. Okay, see the thanatopraxia. Okay, we have learned. So, okay, now you tell me, autopsy should be done before or embalming should be done before? Can you answer me? Yes, please remember here, first of all, we have to do post-mortem examination. At the last, we have to do embalming. Before, like, see, why we need to understand this? Because, see, before embalming, see, before autopsy, we are going to do embalming. No. Before autopsy, if we do embalming, so there will be what? Destruction of the evidences, right? All evidences will be destroyed, right? Now, all evidences will be destroyed, right? Now, so remember here, autopsy should be done before embalming. Simple logic. Embalming should be done at last. If you do embalming before autopsy, this will be punishable offense. Now, see here, see, we have to understand here two BNS. BNS number 238, BNS number 238 and see 301. Without a death certificate, suppose if a 60-year-old man died in my hospital, okay, after that I was supposed to do post-mortem examination, but one of my relatives, he called me ki please wait for some time, like, because like our families, they are in, you know, like they are in London, so like they will be coming here only after 2 days, so can we preserve the dead body for 2 days? ठीक है, चलो, out of relation, out of all these, right? Okay, fine. तो क्या हुआ यहाँ पे कि after that, see, yes, so without certificate, I did embalming, but after that I got to know that, okay, that person was the main criminal person. He was the main person behind death. Okay, so this will be, so basically, so this will be the punishable offense. Without consent, if I am going to do the embalming, obviously this will be what, actually what, see, indignity to what, dead bodies, right? So remember, related to embalming 238 and 301. Now dowry, earlier, see, dowry death was, earlier it was 304A and 490, earlier it was 304B, right? B dowry death, and 498A. Now see, the dowry death is, the dowry death is BNS number 80. BNS number 80. See, what is the meaning of dowry death? Within 7 years of marriage, like if a newly married female is, like suppose if you get the dead body of a female, like who got married within 7 years, right? Within 7 years. Okay, no. So remember here, so BNS number 80, but see the dowry harassment 85, husband or any in-laws. All right. Now see here, Bharatiya Nagrik Suraksha Samhita, CRPC. Now most important CRPC we used to learn about what? See, most important क्या था बताओ? वो क्या था? CRPC for Police Inquest and Magistrate Inquest. Earlier it was CRPC 174, 176. But now it is what? CRPC or BNSS 194 for the police inquiry. Say here, so 194 for the police inquiry. Okay, for the police inquiry. And magistrate inquiry, see 196. 194 and 196, very, very important. Yes. No, see here, you are not supposed to memorize older one. See, old IPCs and CRPCs are gone. See, because so many of you already have learned those things. So that's why I'm revising it. Earlier it was like that. But remember, now you have to follow only new laws. Okay. So now, see, police inquiry 194. Magistrate inquiry 196. So can you tell me, related to McNaughton's rule, which IPC I have taught you just now, bolo? Related to McNaughton's rule, can you answer me? BNS number 22. BNS number 22. Very good. Okay, now you tell me, say dowry death. Which one? Dowry death. BSN number. Bolo, dowry death. 80. Abhi padha hai na? 80. 80, right? 80, and for the dowry harassment 85, right? See, dowry is important, right? Dowry death is important. Very easy to understand. Now, remember here, earlier it was CRPC 39 for, like if there was the case of any case of the poisoning, right? No? So we were supposed to inform the police. Now BNSS 33. Whenever there will be any homicidal case, right? Whenever there will be this kind of case, homicidal case or death, like a suspicious death in hospital. So basically we are supposed to inform the police, right? And so not informing the police is a punishable offense, right? No? So this is 33. After that, say yes, suppose if the police officer is bringing like a person after arresting him, right? Now if police is requesting, sir, please do medical examination. Yes, you should do as per 51. As per 51. Okay. Yes, Dr. Khushbu, it is being provided. Yes, it is being provided. Yes. Now, see here, suppose if a female criminal is there and she was given death sentence. Now, just before hanging, she was found to be pregnant. After that, what to be done now? And I see a movie was there, so Jawan movie, right? And so as per section 456 now, BNSSS, right? Now, so remember here, suppose if a woman sentenced to death is found to be pregnant, okay? Now it should be converted to lifetime jail, okay? Lifetime jail by the High Court. All right. Now, see here. Now see, CRPC, which is now BNSS. As per 397, there should be free treatment for the rape victim. And even for the acid attack survivors. Rape victim and acid attack. And we are supposed to inform the police, right? So like say yes, so not informing the police will be the punishable offense. In the same manner, my question is that whenever there will be, see here, so whenever there will be any kind of the trial, whenever there will be any kind of trial, right, like that will be in the open court. But remember, whenever there will be sensitive cases, no, like rape cases are sensitive cases, right? So like this should be done in a closed court proceeding, and see here, this should be conducted in a camera, okay, as per section number 366. Okay, so we have discussed most important IPCs and CRPCs, Bharatiya Nyay Samhita and Bharatiya Nagrik Suraksha Samhita. Now let's start with the basics of forensic science now. Okay, now see this question and try to answer. See this question and try to answer. Now see, we are going to start with basics of forensic. Okay. Which of the following is not an early sign of death? Which of the following is not an early sign of death? Okay, fine. Chalo, all right. See, first word, what is the meaning of this word? There was a movie Avengers. Name of villain was Thanos, god of death, right? See, a study of death is called as, see, a study of death is called as the thanatology, right? Thanatology. And fear of death is called as the thanatophobia, right? There is one more word that is called as, see here, see, there is one more word that is called as the taphonomy, right? Taphonomy means what? See, the process of decomposition of dead body. See, the process of decomposition of dead body, okay? Fine, that is called as the taphonomy. Why I am teaching you this? Because 1 year before they have asked one-liner question. The study of death is called as. Okay, so remember here, this is called as thanatology. Now, after death, yes, there can be what? Immediate signs, early signs, and late signs. Okay, so here, हिंदी में पढ़ाओ नहीं, एक्चुअली देखो, दिस इज अ मिक्स्ड क्राउड. ओके, दिस इज अ मिक्स्ड क्राउड, तो मैं थोड़ा मिक्स करके बात करूंगा, ठीक है ना? चलो फाइन, आई एम यूजिंग वेरी मच लाइक वेरी बेसिक इंग्लिश. ऑलराइट, ठीक है. अब देखो यहाँ पे विच ऑफ द फॉलोइंग इज नॉट एन अर्ली साइन. ओके, वी विल गेट बैक टू क्वेश्चन अगेन. देखो यहाँ पे, सी देखो, जस्ट आफ्टर डेथ, सी जस्ट आफ्टर डेथ, सी हियर, लाइक व्हेनेवर देयर विल बी सडन and irreversible stoppage of heart, brain and lungs. Okay, sudden and irreversible stoppage of heart, brain and lungs. This is called as somatic death, which is also called as the clinical death. Okay, somatic death or clinical death. So stoppage of heart, brain and lungs, this is called as Bishop's tripod of life. This is called as Bishop's, see here, this is called as Bishop's tripod of life. Okay, fine. See, what is the significance of this? Remember, see here, this is, see, these are actually what? Immediate signs. The stoppage of heart, brain and lungs, these are what? Immediate signs. The signs which you can see within seconds to minutes. Seconds to minutes, okay? All immediate signs we can see within seconds to minutes. Okay, fine. So remember, what is the significance here? See, in this phase, during somatic death, remember here, this time say only aerobic processes are gone. Aerobic processes are gone. Means all organs, all tissues which were able to survive only in the presence of oxygen will be shut down. But remember here, what about anaerobic? What about anaerobic processes? Means all the tissues which can survive even in the absence of like oxygen for some time. These are actually anaerobic processes will be alive. Okay, this will be there. Easy to understand. So what does it mean? If I ask you one question, during somatic death, if I ask you entire body is dead? No. If I ask you heart is completely dead just after somatic death? No. See, liver is dead? No. See, what about the kidney? So kidney is dead? No. So what does it mean? Some organs are still alive. Some organs are still alive. Okay, fine. So remember here, during somatic death, if I am going to administer any meiotic drug or mydriatic drug in eyes, eyes will respond. Yes, it will respond. Yes, this will respond. Okay. And if I'm going to shift like to ventilator part here, right? So even the muscles will be reacting, right? The muscles will be reacting. Very easy to understand. But remember here, after a few hours, or after a few minutes, now each and every cell of the body will be dead. Now each and every cell of the body will be dead. Now it will be called as what? Molecular death or cellular death. ठीक है? अब क्या है यहाँ पे molecular death में? Molecular death में each and every cell of the body is dead. Now we can say entire body is completely dead. So here there can be early sign. Here there can be late sign, right? So when I'm saying each and every cell of the body is dead, right? So remember here aerobic processes is already gone. This is also gone. Anaerobic processes, these are also gone. These are also gone. Now my question to you is that if you administer any miotic drug, if you administer any mydriatic drug in the eyes, do you think pupil will respond? Do you think eyes will respond? No. Now eyes will not respond. Now eyes will not respond here, right? Even muscles will not respond. Very easy to understand, right? Very easy to understand. इसका मतलब क्या हुआ कि पूरी तरह से body expire हो चुका है अब, right? So now what are the early signs? What are the early signs we are going to learn here? All we are going to learn one by one. देखो यहाँ पे each and everything I have mentioned here. I hope you are able to recall that after death, see, if you see the body will be like this. So body will be rigid like this. So this is called the tightening of dead body, which is called as rigor mortis. And rigor mortis, body will become tight. If you touch the body will become cold. Algor mortis. Why there is cooling of dead body? Because after death, heat regulating center in the brain will be switched off, right? Now will be shut down. So that's why, see, yes, a body will start losing the temperature. I'm talking about body core temperature. ठीक है ना? So remember here, every 1 hour there will be loss of 0.5 degree centigrade. 0.5 degree centigrade per hour. Okay? Fine. So that's why body will become cold. And if you see, there can be discoloration of dead body also. Okay, fine. So you can see the discoloration also, that is called as a liver mortis, right? That is called as liver mortis. Okay? So all these are what? Early signs which can start in minutes to hours. Minutes to hours. Even eye changes also inside the eyes, if there will be tachynoia, sclerotica and all. So yes, these are going to take minutes to hours. Remember here, when I talk about liver mortis, algor mortis, rigor mortis, right? All these basic thing is that, remember here, they are going to get started in 30 minutes. Basic rule, and they will be completed by 6 hours, mostly 6 to 12 hours. Okay? 6 to 12 hours. Basic rule hai ye. Okay, fine. So these are early signs, but late signs which can take hours to days, which can take hours to days, to weeks, to months also. I'm talking about what? Putrefaction. So putrefaction means what? Actually, see here. So when body will start getting decomposed. So autolysis and decomposition. Autolysis means decomposition of dead body without involvement of any bacteria. But remember here, auto means actually what? Self. But when bacteria will also be involved in decomposition, right? Now it is a decomposition. So can you tell me what is the most destructive bacteria? See, worthy dog, I said what? Irreversible stoppage of heart, brain and lungs, right? No? Yes, Dr. Santosh, good evening. Yes. Hana? So see, what is the most destructive bacteria? See, Clostridium welchi. See, Clostridium welchi. What is the most destructive enzyme? What is the most destructive enzyme? Lecithinase. Please write down. It is what? Lecithinase. Lecithinase. lecithinase is the most destructive enzyme. Okay, all these points are clear to everyone. So now there should be no confusion in immediate signs, early signs, and late signs. Within seconds to minutes, immediate signs, right? Immediate signs. Within minutes to hours, early signs. Hours to days, late signs. So what is the answer here? Remember here, adipocere, which I will be teaching you right now, adipocere formation and mummification. This will take many days to weeks. Okay, this I will teach you separately. So this is actually late sign. Remaining all these, option A, B, D, all these are early signs. Now, what is the significance of somatic death and molecular death? Why we need to understand all these? Please remember here, a period between somatic death and molecular death is called as a supravital period. Period between somatic death and molecular death is called as supravital period. During this period, we can harvest the organ. During this period, we can harvest the organ. Okay, supravital period. After molecular death, there is no use of, like after that, you cannot harvest any organ, because after molecular death, each and every organ will be dead. Okay, no? So remember here, for different organs, see, the supravital period and molecular death period is different. Let's see here. See here, so we are going to learn one by one. Yes. So what are the early signs? Remember here. Suppose if examiner is going to ask you, one question here, right? Okay, what is the earliest sign of death? Earliest sign of death is what? Loss of voluntary movement. Loss of voluntary movement. This is earliest sign. Loss of voluntary movement. But if examiner is asking what is the earliest eye sign? Earliest eye sign is Kevorkian sign. What is Kevorkian sign? ये बताओ, after death, yes, blood circulation will be stopped for sure. Right now, blood circulation will be stopped in the body. Okay. So because of that, when blood circulation will be stagnant, do you think there can be hemolysis? Yes, there will be hemolysis. Hemolysis means there will be the breakdown of red blood cells. Okay, fine. So even in the retinal blood vessels, you can see here, even in the retinal blood vessels, see, like there can be fragmentation of blood column. You would have seen IV fluid, dekha na? Like IV fluid, like you are going to fix like this. After that, there will be a tube here, right? There will be a tube here, right? No? So if IV fluid will be switched on, actually now fluid will be continuous flow. But if you are going to stop it, no, with the wheel, if you are going to stop it, no, so because of that, in the tube, you can see there will be what? Fragmentation, breakdown of water there. है ना? उसमें मतलब okay, there will be the breakdown of normal saline. Same thing is happening in our blood vessel also. So with the help of ophthalmoscopy, when you check a retina, no, retinal blood vessels here, you can see that there will be fragmentation of blood column like this. है ना? So this will be something like a railway track, right? This is also called as railway trucking sign. Same like the cattle are going. So this is called as what? See, the cattle trucking sign. This is called as Kevorkian sign. This can appear within seconds to minutes, and this will be persisting within 1 hour. So please keep in mind, Kevorkian sign is the earliest eye sign after death. But what about this picture? Please look at this picture. This is a repeatedly asked question, repeatedly image-based question in forensic medicine. Remember here, see, in forensic, we expect minimum 2 image-based questions, minimum 2. Okay, image-based questions are important. That's why I will be showing you so many images today. With the help of images only, we are going to memorize, we are going to learn everything. Remember, when eyes will be open after the death, you can see that, you can see here that, yes, there can be the deposition of dust and debris. In the beginning, it will be yellow, then brown. Finally, it will be turned into black color. And there will be formation of 2 triangles over the sclera and conjunctiva, right? This is called as tachynoia sclerotica. Please remember this. This is called the tachynoia sclerotica. Okay, if you can see the tachynoia sclerotica, yes, you can understand. So the time since death will be approximately 3 to 4 hours. 3 to 4 hours. Remember this, very, very important. Okay, very, very important. You should not be forgetting, I'm telling you, you should not be forgetting tachynoia sclerotica. All right. Now, after how many hours, after how many minutes, all organs will be dead. So I'm talking about molecular death. Remember here, earliest organ to die after death. See, in a case of hypoxia or ischemia, nervous tissue will not be able to tolerate, right? So within 5 minutes, yes, within 5 minutes, nervous tissue will be dead. Okay, now see after 1 hour, kidney will be dead. Liver after 15 minutes, heart after 45 minutes. See the cornea after 6 hours, after 6 hours. Means after death, see the cornea can be harvested within 6 hours, right? Now within 6 hours, like so many, like some celebrities also, they already have donated their eyes, like Aishwarya Rai Bachchan, right? No, so basically after the death, yes, see within how many hours, see the cornea can be harvested within 6 hours. Okay, fine. So this much point we have learned. So what I'm saying is that, see the kidney will completely be dead after 1 hour. Liver will completely be dead after 15 minutes and heart will completely be dead after 45 minutes. If you have understood this much, so can you solve this question? This is very easy question for you now. Yes, Dr. Shivani, I hope this should be enough because I will be teaching you the maximum part. The class will be up to 6 to 7 hours. Okay. देखो. Now it's very easy to understand. Organ harvesting team is waiting, right, for a kidney, Yeah, some of you are doing mistake here. Why? See, why you are writing after 1 hour? After 1 hour molecular death hai na, so supravital period will be less than 1 hour, no? So answer will be B here, no? Remember here I mentioned about molecular death. Molecular death means after 1 hour kidney will completely be dead. Then even if you are going to harvest it, useless. Right now, so supravital period for all the organs will be lesser than molecular death. Very easy to understand. This much point is clear to everyone. Okay, now the question is that suppose if there is a patient in the emergency department. Okay. Okay, chalo, fine. See here, suppose in the emergency department, one unconscious patient is brought. Okay, and like there was almost actually see the brain dead case. Okay, brain dead and a brain dead case, brain dead. The question is that you have to declare a person as brain dead first. You have to declare a person as brain dead first. Brain dead. After that only you can harvest. So to declare a person as brain dead, which doctor should never be invited? Means see, ideally a person should be declared as brain dead by the neurosurgeon, by the neurophysician, even the registered medical practitioner and the doctor and the clinician who was seeing the patient. The question is that which doctor should not be invited to declare a person as brain dead? See here, any doctor who belongs to organ, yes, very, very important. Organ, see here, any doctor who belongs to organ transplantation department, why he should not be invited? Because suppose if I am a neurosurgeon, and I have a patient who was waiting for one kidney donor, okay, one kidney, right now. So suppose if the, he does not have any donor. So I have given one application to my organ transplantation department that if there will be any brain dead patient, please invite me to harvest kidney, okay, so that I can get one kidney for my patient. See, remember here, if I will be invited for that patient, no, I will be selfish doctor that time. I will be biased. I will not be thinking about other people. And even if he is not brain dead, I can declare him. Why? Because I need. It means I was actually so desperately waiting for the kidney. I wanted to save my patient only, right now. So at that time I could be selfish doctor. So that's why, see, any doctor who belongs to organ transplantation department should not be invited. So can you tell me? Okay, theek hai. Now you tell me, see here, so what about brain dead? How to declare a person as brain dead? Can you tell me how to declare a person as brain dead? First of all, that person should be in coma. First of all, person should be in coma. there should be absence of brainstem reflexes. Brainstem reflexes. Absence of brainstem reflexes. Please write down. Absence of brainstem reflexes, and there should be signs of brainstem destruction. Brainstem destruction. Please write down. Signs of brainstem destruction. So can you tell me how to declare? Okay, ye batao. How to declare a person in coma? Can you tell me? Is there any test for this? Yes, there is a test. What is the name of that test? That is called as Glasgow Coma Scale. Glasgow Coma Scale. Glasgow Coma Scale. What do we check in Glasgow Coma Scale? Can you tell me what do we check here? Yes, we check what? Eye movement, verbal response and motor response. How much is the maximum score for eye movement? 4. Verbal response 5. Motor response 6. So how much is the total score of GCS? GCS is called as a Glasgow Coma Scale. So can you tell me how much is the total score? See, the total score of Glasgow Coma Scale is 30. Okay, see, this is how much? 30. Oh, sorry, this is 15. Sorry. See here. I was in MMSC. So how much is the total score of GCS? See, in total, this will be what? 15. Right? 15. Right? 15. Okay, how much is the minimum score? Minimum score will be 3. Right? Minimum score will be 3. So my next question to you is that when to declare a person and when to declare a person in coma? When to declare a person in coma? After how much GCS score? Can you tell me? Yes, remember here, when Glasgow Coma score will be in between 3 to 8. Please remember this. When a score will be in between 3 to 8. Okay, score will be in between 3 to 8. Remember, equal to or less than 8, you can declare a person in coma. Okay, in coma. After that, what are the brainstem reflexes? Can you tell me? See, what are the reflexes? See, pupillary reflex. Suppose if you project a torchlight in the eyes, yes, there can be pupillary constriction. Right? That is called as pupillary reflex. Right? That is called as pupillary reflex. Suppose if you are going to touch the white part of the eye with any foreign object, there will be blinking. Right? Now, blinking. So that is called as what? Blinking reflex. Also called as which reflex? Corneal reflex. Very good. Very good. So corneal reflex. Now you tell me. See, yeah, suppose if you are going to hold the head of someone, right? Now, after that, if you are going to turn from left to right, right to left, yeah, but eyeball will be fixed. So this is called as doll's eye reflex. Doll's eye reflex. Doll's eye reflex. Suppose if you are going to use, like one spatula or any kind of, foreign object, you are going to insert in the mouth. Right? If you are going to touch the posterior most part of the hard palate, right? So there will be neck. So after that, there will be the contraction of the neck. That is called as, yes, okay, that is called as gag reflex. Gag reflex, right? And when a person will be intubated, yes, there will be the coughing reflexes. No, so that is called as what? Yes, that is called as tracheal reflex, right? So these are brainstem reflexes. These are brainstem reflexes. Very good. What are the signs of brainstem destruction? Apnea. 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 Invariant pulse. So pulse invariant. And even if you give the injection of atropine, no response. See, when you give injection of the atropine, can you tell me? See, when you give injection of the atropine, can you tell me? Bolo. Means whenever there will be a bradycardia, heart rate slow ho raha to dete ho. So now in a case of brainstem destruction, even if you give atropine, no reaction. So there will be no reaction. Very easy to understand, right? See, heart rate will not be increasing. So remember here, how you are going to declare a person in as brain dead. First of all, you have to declare that person is in coma, absence of brainstem reflexes, and then signs of brainstem destruction. This much point is clear to everyone. Without seeing the notes, can you answer me which BNS I have taught you for McNaughton's rule? Bolo McNaughton's rule. Okay, 22. 22. Okay. Okay, ye batao ki what about police inquest? BNSS, which one? Police inquest, 194. Magistrate, 196. Okay, dowry related 80 है ना, 80 था ना dowry death, and dowry harassment क्या था 85, right? Okay, fine, very good. This much point is clear to everyone. Now can you tell me how do you define supravital period? Please write down in chat box. All of you, please write down in chat box. How do you define supravital period? Bolo. Very good, very good. I can see your chats. Yes, yes, you people are doing great job. Yes, very good. Period between somatic death and molecular death, है ना? Period between somatic death and molecular death. All right, this much point is clear to everyone. Now, see here. Now, see some rules you should be knowing. Whenever there will be new birth or a new death, we have to report to the registrar office within 21 days. Now, see, to give a person death certificate, are you going to charge any fees? 50 rupees? Huh? Are you going to charge any fees or 100 rupees? No. Obviously, no. Right now, remember here, for death certificate, this is all about humanity, right? Anna? Fine. Very good. Very good. Very good. Remember here, without any fees. After that, remember here, even if there will be any pending fees, you cannot say, I will not give your death certificate without the payment. At that time, you have to give death certificate. Okay, in this manner police will help you. Okay, now we are going to learn each and every point related to autopsy. Now see this question and try to answer. Now some rules we are going to learn related to autopsy. See, autopsy means what? Actually post-mortem examination. After death, it is called as post-mortem. And before death, it will be called as what? Ante-mortem. Ante-mortem means what? Before death. Before death. Okay, fine. So what is the need of autopsy? So that we can understand the manner of death, cause of death, see the time since death, and we have to identify the identity of a person, right? No, so cause of death, manner of death, time since death, who was that person. So these are the, yes. Dr. Shabi, no problem, you can continue. I'm teaching you with basic thing only. Okay, you will be able to understand, don't worry. Okay, fine. Now, which of the following is wrong here? Yes, please remember here. See, yeah, whenever there will be post-mortem examination, suppose if a doctor is supposed to do post-mortem examination, no, remember here, first of all, remember, there should be written order. From the police or magistrate along with FIR. Okay. And the police who was doing inquiry, right? The police who was doing inquiry will be called as what? Investigating officer. So can you tell me how much should be the ranking of investigating officer? Ideally sub-inspector. But what should be the minimal ranking of the police to do inquiry? Head constable. You should know all these. Okay, fine. Very good. All these points are important. Now, suppose if a police has reached to murder spot, murder scene, at the crime scene, right? And after that, if he's going to do inquiry there, this inquiry is called as inquest. Okay, inquiry is called as inquest, right? So this will be called as the police inquest. Now police will be asking some people, did you see anything? Did anyone see anything? Kisi ne kuch dekha kya? Now he will be doing inquiry and he will be making a report. That report will be called as panchnama. Okay, panchnama. When police is going to the crime scene and he's making report, it is panchnama, right? No, but if a person is going to police station to file a report, that will be FIR, first inquest report, right? Okay, fine. This much point is clear to everyone. Now, see here, now the police who is coming. Excuse me, phone receive kar liya. Okay, now the police who is going to see, yeah, so the police, like see, before the post-mortem examination, no, see that police constable should identify the dead body. Okay, yeah, this is the same diseased, right? A deceased body which I have brought, right? And yes, obviously no unauthorized, see here, any unauthorized person should not be present there, should not be there, okay, should not be there. Okay, why? Because see, that person can try to bribe you, and that person can try to bribe you, right? Okay. Okay, that person can try to bribe you. And remember here, this should be done only in the mortuary house. This should be done only in the mortuary house, in the government sector, right? No, government center. So like it does not mean ki bhai hai na ki, you can perform it anywhere. No, like only in the mortuary house. And remember, you would have seen that especially in all the state, in the government hospital, like it is being performed, right? And it should be done in daytime. Please remember here, it should be done in daytime. It should be done in daytime. Okay. Okay, Dr. Nishar. Okay. Okay, ठीक है. Hello to Priyan sir. चलो ठीक है. This much point is clear to everyone. ये इतनी बात सबको समझ में आ गई? Right. चलो ठीक है, ये सारे बेसिक पॉइंट्स हम लोग ने कवर कर लिया. नाउ माय क्वेश्चन टू यू इज दैट इफ यू आर मेकिंग अ पोस्टमार्टम रिपोर्ट, हाउ मेनी पोस्टमार्टम रिपोर्ट यू शुड बी मेकिंग? कैन यू टेल मी हाउ मेनी कॉपीज you should be making? Why daytime, Dr. Rituraj? Okay, why daytime? Okay, see, remember here, like you might be asking, why not after evening? Like if there is a good light, okay, fine. Even in the night time, no, if you are going to perform it, no, remember here, now there, like even if there will be a good light, for time being, switch off, and evidences can be destroyed. Right? So remember here, so whenever there will be unnatural death, suspicious death, yes, and so like obviously after the murder, after poisoning, so many people will be there, and so many people will be there behind that case, right? Very easy to understand. So that's why it should be done in, you know, like in the daylight only, in daylight only, okay? And it should be done in mortuary house. Now, how many copies we are going to make? Please remember, we have to make how many copies? Okay, 3 copies. One copy should be given to, see, one copy should be given to investigating officer, okay, police. One copy should be submitted in magistrate office or to like police superintendent, and one copy should be kept for office use, for hospital use, okay? So minimum, so you have to make how many copy? You have to make 3 copies, okay, 3 copies, remember. See here, कि minimum for how many years we have to preserve it? We have to preserve minimum for 3, maximum no time limit. This depends upon case to case. All right, this much point is clear to everyone. Now see here, see types of autopsy. First of all, you should be knowing about medico-legal autopsy and then clinical autopsy. Remember here, medico-legal autopsy means what? Any unnatural death, any suspicious death, like rape case, murder case, suicide case, okay, see the poisoning case, road traffic accident, all these are, okay, all these are what? All these are what? Unnatural, suspicious. Then see, postmortem hoke rahega, okay, autopsy will be done. There will be, see, the police authorization is mandatory, and you don't need to take any consent from the relatives. No need of taking their consent. No need of taking the consent from the family members. In medico-legal case, medico-legal autopsy without consent means it is mandatory. It is mandatory, postmortem hoke rahega. But what about the clinical autopsy? Suppose if there was a patient in my department for last 15 days. For last 15 days he was there in my department. Okay, I was treating him with so many drugs, and patient was improving. But on 16th day, patient died. And now I want to do research. I want to check like if there was any, you know, like abnormal interaction of the drugs and all. So when I want to do it for research purpose, no, then it will be called as what? Clinical autopsy or pathological autopsy. Here, yes, you have to take the consent from legal guardian. You have to take the consent from legal guardian. Okay, medical, legal and clinical, pathological. Very easy to understand. Now, in a building collapse, in a building collapse. See here, so many bones got fractured here. Opening the dead body is difficult. So here we can do virtual autopsy. We can take images, 1000 images, more than 1000 images by CT scan and MRI. This is called as vitropsy. Vitropsy, right? Now, this is being performed at AIIMS, right? Okay, vitropsy means when I take so many images with CT scan and MRI. On the basis of that, we can write on the on the report, postmortem report, that what was the root cause of death on the basis of the images. Just because of the fracture of the lower ribs, right? Last rib, there was laceration over liver, over spleen. Easy to understand, right? So this is called as a virtual autopsy, vitropsy. In a case of suicidal case, I'm going to meet the family. I'm going to ask them what kind of person he was, what kind of emotional status he had. So I'm asking some question. Yes, no. This is called as psychological autopsy. Only questions. Now, see, so far we have completed 4 types of autopsy: medical, legal, and clinical. After that, virtual autopsy, and then what? Psychological autopsy. And then see here, so basically why we are doing autopsy? To get or to understand the real cause of death. But in 2 to 5% of cases, no. Even after complete postmortem examination, we do not get complete orientation, complete information about the cause of death. It is called as a negative autopsy. Negative autopsy, right? Now, even after examination, so cause of death will be unknown. Now see this question, very easy question for you people. Okay, see, whenever there will be any postmortem examination, first of all, you have to open the head. है ना? First of all, rule क्या है? You have to open this first. You have to open the cranium. After that, you are going to open the thorax and then abdomen incision. Okay? Then abdomen incision. This is the general rule, right? Now, see, why cranium first? Because brain is the first organ to smell any kind of poison, right? Now, so brain is the first to smell any kind of poison. But remember here, newborn baby. Here we have to give incision over abdomen first. Why abdomen first? Remember here, especially to check what? Level of diaphragm. Level of diaphragm. Why level of diaphragm? Why I want to check here? Because see here, it could be possible that was the case of neonaticide. Neonaticide. Remember here, like suppose if baby has respired. Suppose if baby has respired. Okay, then see here. So now air will be there in the lungs, right? And see, lung size will be increasing, expanding. Right now, and now diaphragm level will be coming down. So this will become, suppose if respiration was there, respiration happened, then level of diaphragm, see here, level of diaphragm, okay? Level of diaphragm will be at 6th to 7th rib. But if baby has not respired, okay, then see, level will be at 4th to 5th rib. 4th to 5th rib. Very easy to understand. Please remember, this is very, very important. So that's why in newborn, first incision we have to give over the abdominal part. Okay, abdominal part. Now, can you tell me which type of incision and what is the answer here? Okay, Dr. Prashad, if neonate नहीं तो पहले first देखो simple logic, head to toe. So first skull, first cranium, then thorax, then abdomen. Simple. Okay, fine. Now, this is a case of what? See, in a case of hanging, we do this kind of incision. The question is that in a case of hanging, what is the last organ to check? Bolo, in a case of hanging, what is the last organ to check? Cervical region. Cervical. Neck is last. Why neck is last? Can you answer me? Because see, in a case of hanging, neck will be, cervical region will be the most important region now, right now. So here we have to do investigation. So by that time, it will be bloodless area, no blood here, right now. So what kind of incision is shown here? What kind of incision? All right, now we are going to learn all incision one by one. Remember here, suppose if incision is given like this, and you see here, so below the chin to pubic, this is called as eye shaped, right? And suppose see like acromion to acromion, and then if it is going down, okay, then it will be called as the T shaped, which is also called as bucket handle shaped, okay, bucket handle shaped. But from acromion to xiphoid process, substernal xiphoid process, and then if you are going down, then it will be called as Y shaped. Around the neck, if you are going to do like this, incision like this, and then you are going down, it is called as modified Y. Modified Y, okay, modified Y. But what about the custodial death? What about the custodial death? See, police will be beating over the back part, no? So you see here, all these incision we give over anterior part of the body, anterior part of the body, but police will be beating over the back part, no? So acromion to gluteal like this, okay, like this. Very easy to understand. This is called as, in a case of custodial death, X-shaped incision, X-shaped incision. Please remember here, around the neck, that is modified Y, no? So in a case of hanging or a strangulation, we have to give modified Y. Most common shape is eye-shaped incision, eye-shaped incision. Now there should be no confusion. Okay, na? Now there should be no confusion. Please remember, all these points are important to understand this. Okay. So here, this is actually what? Modified Y, hai na? Modified Y. So this is actually what? Modified Y shape, modified Y shape, right? There should be no confusion now. Okay, now you look at these pictures. See picture number 1 and this is picture number 2. So can you tell me, see here, after post-mortem examination, you have to close the body, no? You have to close, you have to suture it back, right? No? So after suturing, you are having 2 pictures. So can you tell me picture number 1, which shape? Yes, this is a Y shape. This is Y shaped. What about picture number 2? What about picture number 2? Yeah, that also looks like a Y, right? No, also looks like Y. नहीं, but Y के लिए from acromion to xiphoid होना चाहिए था, यहाँ से यहाँ. Okay, this is a Y, but it is not Y. No, देखो यहाँ पे, this is somewhat like this, no, somewhat like this only, right? Somewhat like this, right? Easy to understand, somewhat like this only. Okay. So this was actually from acromion to acromion. After suturing, skin went down. So this is a type of actually T-shaped. This is a type of T-shaped incision, right? T-shaped incision. Now there should be no confusion. Now what are the methods of autopsy? Suppose if I am removing all the organs one by one, Virchow's technique. And if I am removing all the organs all together, means after giving incision from below the chin to pubic tract, say with my right hand I'm going to hold the posterior part of tongue, with my left hand I'm going to hold the rectum, and like all together I'm going to take out and en masse. This is called as Latule's technique, rapid technique. Okay, so remember here, when I talk about organ one by one, okay, this is the liver and this is gallbladder. Okay, see here, suppose if I'm removing liver separately, gallbladder separately, bile duct separately, spleen separately, lungs separately, stomach separately, after that I have to keep all the organs inside back. So do you think anatomical relations will be preserved? No, please write down, anatomical relations will not be preserved. If you are going to keep gallbladder, that will go down in the pelvic region. Simple. So in Virchow's technique, anatomical relations are not preserved. But what about Latule's? Whole GIT together outside and inside, right? Okay, fine. So here anatomical relations will be preserved. Gon's technique, block by block, like cervical block separately, see thoracic block separately, after the see abdominal organs separately, and then urogenital separately. So block by block is called as Gon's technique. But if there will be risk of infection, like hepatitis B, hepatitis C, HIV, so there we do not do lot of incision and all, okay, just in situ dissection, right? That is called as a rocket and sky technique. If there will be a case of COVID-19 and if you are supposed to do post-mortem, yes, and risk will be there, no? So rocket and sky technique, radiation hazard, rocket and sky technique, okay? Chalo, fine. Dr. Anirudh, what you are asking about incision or about these techniques? Very easy. आएगा दोबारा भी रिवाइज होगा इसी पे ना, देखो बार बार करते रहेंगे, don't worry. Okay, so remember here, I have taught you 4 methods of autopsy. I have taught you 4 methods of autopsy, 4 methods. Remember here, Virchow's technique, Latule's technique, okay, Gon's technique, and rocket and sky technique. If I'm removing organ one by one, Virchow's. All together, Latule's. Block by block, separately. सर्वाइकल ब्लॉक सेपरेटली, अगर थोरेसिक ब्लॉक सेपरेटली, यानी कि थोरेसिक ब्लॉक में लंग्स आएगा, हार्ट आएगा, पूरा रिब केज आएगा. इजी टू अंडरस्टैंड, राइट? वेरी इजी टू अंडरस्टैंड, right? And rocket and sky mein, if there will be risk of any infection, that's why, so at that time we are not going to do so much, so much postmortem examination, only in situ dissection, thoda. That is called as a rocket and sky technique. Okay, so can you tell me, out of medico-legal autopsy and clinical autopsy, where we are supposed to take the consent from family members? Can you answer me? Bolo. Dr. China is asking, what should we do with all these organs? We have to do examination. Abhi aayega organ one by one aayega, you will understand that, right? You will understand that. Okay. Now see here. So basically in clinical examination, in clinical type of autopsy. Acha wo kya tha? Virtual image, CT scan, MRI. Vitropsy, very good. Now individual organ dissection. So the question is, why we are supposed to do the dissection, why we are supposed to, why we are doing the examination of all these organs. Remember here, brain is the first organ to smell any kind of poison. Okay, suppose, so now see here, how do we do dissection of all these? Suppose if there is a solid organ like this, liver, heart, kidney, spleen. Okay, and if there will be what? See here, hollow structure like the blood vessel, hollow structure like blood vessel, or even like a stomach and intestine, right? No, so remember, if solid organ hai, then how to do dissection here? Like we have to cut in this manner, like the slices of bread, like the loafing of bread. ठीक है? Like this is called as the parallel cuts. है ना? Like same like bread जैसा cut करोगे, loafing of breads. But if there will be hollow organ like blood vessels, aorta है, or if there will be esophagus, stomach, hollow organ, right? No? Here we have to give a straight incision like this. Okay, incision like this. है ना? This is called a what? Cut opened. Okay. Now the question is, why we are supposed to do the examination of heart? Now suppose if there was a case of 30-year-old man, young man, 30-year-old man, okay, 30-year-old man, right? Okay. Okay, now if there was actually, see the 30-year-old man, and see you have received his dead body, right? Okay, fine, I'm glad. Dr. New Invention Videos, acha, from Kyoto, Balochistan, from Pakistan. Okay, thank you so much. You are attending the session. Thank you so much. Okay, fine. Say yes. So suppose if you are getting a dead body, and family members are saying, sir, heart attack, he was having, heart disease. So it looks suspicious, very suspicious actually. Yeah, it could be possible that he might be having some kind of, like some kind of disorder, like the congenital disorder, or might be. But family members are saying heart attack. So it looks suspicious, no? It looks suspicious. Now I have to take heart out, okay? And I have to do post-mortem examination of heart. So now I have to check if there was any blockage or not, or if there was any kind of pathology or not. And if heart looked very, very much fresh, but everyone supporting like that, and everyone was saying it was actually, heart attack. Now if everything was clear, blood vessels were completely clear, right? Heart was completely clear, then suspicious death. So suspicious death, very easy to understand. Yes, so heart ke liye open karne ke liye, see if I have to dissect, then you have to dissect like the parallel cuts. But how to give incision? Please write down how to give incision. This is the right atrium, this is the right ventricle, left atrium, left ventricle. You have to give the cut over blood flow direction, in the blood flow direction, है ना? So see here, you have to give incision in right atrium to right ventricle, left atrium to left. This is called as what? Inflow outflow method. Please write down, all of you. This is called as inflow outflow method. Inflow outflow method, very, very important. Now for the brain, see, most of the time we have to do what? See here, so most of the time we have to examine the brain in fresh state. Okay, fresh state. Only in some cases we have to fix. So what is the fixative for the brain? Fixative material like formalin, है ना? Fixative material, fixative formalin, है ना? Fixative agent is what? Formalin. Now the question is that to open the brain, you are going to give incision over the frontal part, lateral part, over the back part, just behind the ear. Can you answer me? Yes. Yes, okay. 10% formalin. Okay. So you have to give incision over mastoid process. Over mastoid process. Please write down. You have to give incision behind the earlobe. Behind the earlobe. Behind the earlobe. Okay, very, very important, because see here, hard bone here. So backside at the lower part here, no? At the lower part you can give incision. So first incision to take out the brain should be given over what? Mastoid process, behind the earlobe. For see, like in a case of spinal, in a case of hanging and ligature strangulation, right, we have to do the postmortem examination of a spinal cord also. So we can do anterior, we can reach to a spinal cord from the anterior part, from the back part also. So which one is better? Please write down. See, the posterior approach is better than anterior approach. If there will be a case of the poisoning, okay, say here, if there will be a case of the poisoning, so in a case of the poisoning, you can expect that in a stomach there will be deposition of the poison, right now? Say here in the stomach, yes, there will be deposition of poison. See, the poison will be here only, poison will be here only. So in a case of the poisoning, you have to do postmortem examination. You have to do postmortem examination, right? Yes. ठीक है? तो ये बताओ, suppose if I am going to take out the stomach out, we have to take out the stomach out directly. No, it could be possible that whatever poison is here, this can be leaked from this part or from the lower part. That's why we have to ligate first at this opening, then this opening. Okay. So that whatever content is there, in the stomach, that should not be losing from the upside or lower side, right now. This is called as a double ligation method. This is called as a double ligation method. All of you, please remember, okay, for the post-mortem examination, we are using which technique? Double ligation method, double ligation method. Now, last year, 1 year before, they have asked one question in FMG. Right? In a case of heart attack, which chemical we are using to check? Which chemical we are using to check infarction? Answer is what? Infarction के लिए fixative कौन सा है? TTC. TTC is the name of chemical. TTC. That is called the triphenyl. That is called the triphenyl. All of you see the triphenyl and tetrazolium chloride. See, triphenyl tetrazolium chloride. Okay, TTC is the name of fixative. This is the chemical which we are using to detect, to check infarction, myocardial infarction or whatever. Please remember it. Okay. So to check the infarction, we are using what? TTC. What is the full form of TTC? Triphenyl tetrazolium chloride. Okay. So in this manner, we can examine all different organs separately. Now see this question, very easy now. See, in this manner only questions are being framed. So can you answer here? See, bolo. Which chemical we are using here? Can you tell me which chemical? Yes, now you can use. Okay, Dr. Anuruddh, I will explain that. Okay, answer will be here what? D. And I say D answer. The question is that suppose if I have to open the stomach, then incision should be given at, see, incision should be given at, say, lesser curvature or greater curvature. Can you answer me? Answer, see here, because when the poison will be going down, no, mostly lesser curvature will be damaged. So remember, whenever we have to open the stomach, we have to give incision over greater curvature. Please remember, we have to give incision at the greater curvature, okay? Remember it, okay? Now there should be no confusion. Now, embalming fluid. What is the meaning of embalming? Embalming means artificial preservation of dead body, right? Artificial preservation of dead body. See here, see the dead body, what you get in anatomy lab, that is after embalming. This is also called as one more name. Can you answer me? What is the one more name? Thanatopraxia. This is called as thanatopraxia. Thanatopraxia. Can you tell me what is the term we are using for a study of death? Bolo, study of death kya tha? Thanatophobia. Okay, study of the process of decomposition. Can you tell me? Taphonomy. Taphonomy. Okay, what was the most destructive bacteria for that? Most destructive bacteria for the decomposition? Clostridium welchi. Most destructive enzyme? Lecithinase. Lecithinase. Yes, very good, very good, very good. Okay. Okay, fine. Chalo, theek hai. Now see here, see in the anatomy lab, when you get the dead body, you know, you see in the dead body, did you feel foul smell? Foul smell aata hai kya? No foul smell. That is pungent smell because of formalin. That is foul. That is not the foul smell. Okay, have you seen, you know, pus collection? No, because there is no infection. Have you seen blood clotting? No. See, we are using some chemicals. We are using some chemicals. Please write down. We are using some chemicals. We are using some chemicals to preserve the dead body so that there should be no infection. If there will be infection, now decomposition will start. We can preserve the dead body for many, many years, right now. So remember here, we are using some chemicals so that we can preserve the dead body. It is called as chemical stiffening. See, this is called the chemical stiffening. And remember here, there will be permanent rigidity. There will be permanent rigidity. There will be permanent rigidity. Okay, see, body will become tight, permanent. The question is, see, where do we inject all these chemicals? All these chemicals we are mixing with water. So remember here, see, the diameter of artery will be more, no? So we are like infusing in which blood vessel are being used here. One is called the carotid artery, and at a down part, what is there? Femoral. Question is, what are the components of embalming fluid? This is important, right? Remember here, first of all, we are using formaldehyde. This is used as a preservative. And we are using methanol. Okay, we are using methanol to hold the formaldehyde in solution. So remember here, see, the alcohol which a person is consuming, what is that? Ethanol. Okay, that is ethanol. Ethanol. And methanol is the poisonous form. Methanol is the poisonous form. So remember, like this, ethanol is for living person, methanol is for dead person. Okay. Okay, to preserve the moisture, we are using glycerine. What is the name of germicidal agent? Phenol. To maintain pH, sodium bicarbonate or borate. Anti-clotting agent, anticoagulant, sodium citrate, sodium oxalate. If you are able to recall the blood sample collection tube, jo tha na, red color, purple color, gray color, right? Are you able to recall? Hello. So when I talk about the purple color or gray color, gray color for sugar we are using, right? No, sugar, right? And so remember here, so like even in those blood sample tubes also, sodium citrate will be there so that there should be no clotting of blood. So that there should be no clotting of blood, right? Very good. We are using a dye, we are using a color so that there should be natural color of the body like pink or brown. So what is the name of that dye? Eosin. We are using a perfume, wintergreen. And all these chemicals we are using in up to 10 liters of water. This is called as a vehicle. One question they have asked, please remember here, कि a person was suffering from jaundice just before death. A person was suffering from jaundice just before death. Okay, just before death. Okay, after that embalming was done. So what will be the new color? See, naturally there will be either there will be pinkish color or brown color. But if person was having jaundice just before death, then after embalming, new color will be because of eosin and bilirubin. New color of dead body will be green color. Green color. Okay, green color. Very good. This was old question. Please highlight it. Highlight it. Remember, we are using methanol, not the ethanol. Okay, what is the best method of injection? See, one-time injection is not enough. No, you have to do discontinuous injection. You have to do discontinuous injection and drainage. Injection should be done at high pressure and low flow. Please keep in mind, autopsy must be done before embalming. Otherwise, this will be considered as a crime. Now, see this question, very, very easy for you. See this question and try to answer. Legally permitted in India. Okay, first of all, option number 4. I'm talking option number 4. MTP means medical termination of pregnancy or abortion. See, irrespective of marriage, now it is yes, it is legally permitted. Organ transplantation was earlier, it was done only at the government hospital. But after the Transplantation of Human Organ Act, THOA, 2014. See, this is actually was the Transplantation of Human Organ Act, right? After 2014, remember here, even organ transplantation can be done even at the private hospital also. But there should be ICU facility. Okay. Swap donation means what? Suppose if there are two patients, A and B. A was having his own donor, B was having his own donor. So obviously before organ transplantation, yes, we have to do the compatibility testing. We have to do HLA matching. All matching should be done. But remember, A was not matched. A was not compatible to his donor. Yeah, okay, fine. We can continue now. There was a technical glitch in between. Okay, chalo, fine. So as per the, see here, after 2014, as per the Transplantation Human Organ Act, now it is even, see here, so this is also allowed at the private hospital. Okay, chalo fine. See, there was a technical glitch now. Okay, now I think it's fine now. Okay, chalo, all right. See, देखो यहाँ पे. So suppose if A was having his own donor, C, B was having his own donor. Okay, but remember here, both were actually like incompatible with their donors. Okay, so now on the examination, A was found to be compatible with D, and B was compatible to be C. This swap donation is legally allowed. This is legally allowed. Okay. This is legally allowed. All right, fine. Now, what about the passive euthanasia? If I ask you what is the meaning of euthanasia, see, देखो, euthanasia means what? Mercy killing. Mercy killing. So in India, euthanasia is legally legally allowed or not? Remember here in India, euthanasia is not allowed. Euthanasia is not allowed. Okay. Euthanasia is not legally allowed. So you can ask me, sir, we have right to live. Yes. Okay. Why don't we have right to die? You are Indian property. You cannot destroy the Indian properties. Basically, you don't have right to die. Simple. Okay. So euthanasia means what? Mercy killing, painless death. Suppose if a person who was having severe cancer or like severe excruciating pain because of some pathologies, and he was not willing to survive, right? No. So he was requesting you, okay, doctor, please kill me, doctor, please kill me. But so after that, if you are going to give any injection like pentobarbital, after that there will be peaceful death. This is called as active euthanasia, which is not allowed. Suppose even if patient has given you the consent, with the consent also, okay, voluntarily, this is also illegal. Okay, see here, suppose the patient did not give you the consent. Suppose the patient said, no, doctor, I don't want to die. I don't want to die. After that, if you have given, like you were saying, I'm giving you glucose, but you have given pentobarbital, involuntary, equal to murder. If a person was not in the situation to give any consent, right now, so that is called a non-voluntary. Okay, like if patient was in coma, or if patient was, like psychiatric case or minor. Remember here, all these are illegal. But if a patient was on a ventilator for last 7 days, and as per the experience, as per the vitals, as per, all parameters, you can understand that without a ventilator, your patient is not able to survive. So first of all, you have to counsel the family members. Because in government hospital, less ventilators and so many patients, and even in the private, like it is very, very expensive, right? You have to counsel the family member, like this is waste of time, like he is already gone, right? His heart is beating just because of ventilator, otherwise he cannot survive. So here you can withdraw the life supporting device. You can withdraw it. Okay, you can withdraw. Okay, so this is called the passive euthanasia. This is called as passive euthanasia. Only this is legally allowed. Only this is legally allowed. Okay, fine. Now see this question and try to answer. See, in India, only passive is legally allowed. That's it. Only passive. Okay. Now, signs of life are reduced to the minimum that it cannot be detected by routine clinical methods. In this situation, a person appears to be dead. And he can get back to life on resuscitation. Means he was appearing to be dead. So this is called as a case of what? Apparent death. This is called as apparent death. For time being, see here, for time being, life got suspended. That is called as suspended animation. Suspended animation. You would have seen that movie, Nawazuddin Siddiqui, that movie was there, no? Kick. है ना कि मैं 8 मिनट तक सांस रोक करके आ सकता हूं, मौत को टक से छू के वापस आ सकता हूं, right? What was that? Like, see, this can be, so like entire body part, see, each and every organ will be dead for time being, right? Will be stopped for time being, right? Which you cannot detect with the clinical examination. So this can be produced voluntarily also, like yoga people can do, है ना? Yoga people, right? And and after that, even so voluntarily, like even during the surgery, like if we have to operate in the thoracic cavity, And for time being, we have to deflate the lungs. For time being, like we have to stop heart also sometimes, right? After anesthesia, the person is almost apparent dead, right? No, so like even anesthesia is also type of what, suspended animation. But after resuscitation, you can bring the person to life. Easy to understand, Hannah? Okay, fine. So even in electric injury, morphine overdose, yoga practitioner, see the cholera, hanging. Why judge has to say hang till death? Because fatal period of hanging is approximately 3 to 5 minutes. Means a person will be dead only after 3 to 5 minutes. If judge will say no, hang. So after 1 minute, person can be removed also. After that, he will be resuscitated back. He can get back to normal life, right? So remember here, so judge has to say hang till death. So remember here, so hanging is also an example of what? Yes, this is also an example of what? Suspended animation. Suspended animation can be seen in hanging, even after hypothermia. Hypothermia, when body temperature will be less than 35 degrees centigrade. Heat stroke also. Even in the drowning, and when so much water will be accumulated in the lungs, when person will not be able to breathe in and out. After that, when you do CPR, when water will be coming out of the lungs, after that person can, start breathing. So drowning can also cause suspended animation, even, you know, like in the typhoid. But most common cause, newborn baby, okay, newborn baby, okay, very easy to understand. So see here, suspended animation, like this movie, I think everyone has seen, okay, the movie name is actually Three Idiots, right? Now see, like in the last of the movie, all engineers will be doing online delivery, right? Okay, fine. So when they took the baby out, after that they started celebrating, but suddenly nurse said कि what? कि why baby does not cry? बच्चा रो क्यों नहीं रहा है? फिर सब लोग सदमे में आ गए, है ना? After that, what happened? No? So after that, this Amir Khan, this Ranchor Chanchar Das, जो भी था, लंबा नाम था इसका, Ranchor. Okay. So when, like, he was holding the baby, like over the back, after that he started doing like this, hey champ, get up champ, hey champ, get up champ, like all is well, all is well, all is well, all is well. So basically he was giving a type of what? Resuscitation. So all is well, all is well, all is well. Suddenly that baby hit him, right? So he said, ke lat mara, right? No, lat mara. Right? After that, everyone started saying what? And after that, everyone started saying, hey, all is well, all is well, all is well. After that, baby started crying, right? So basically, if there will be suspended animation, right now, okay, when there will be suspended animation in a newborn, what is the treatment of choice? All is well, all is well, all is well. It's not the treatment of choice, okay? Fine. Remember, yes, so suspended animation. For time being, life can be suspended. For time being, life can be suspended, which is called as suspended animation. So what is the medico-legal importance of suspended animation? Do you think a doctor can also get confused here? Yes, there was a case in New Delhi after delivery of our twins. After delivery of our twins, okay? After delivery of our twins, see the twins, actually both babies, like they were not responding, right? No? So they did CPR for 5 to 6 minutes. After that, they declared them dead. So both babies got packed in a bag, and when the parents were taking out the babies out of the hospital, when they came out of the hospital, they felt some movement in the bag, and after that again they rushed back to hospital. See, one baby was alive. Now when they started doing resuscitation, they could not revive them. So this was actually premature declaration of death. Premature, remember, this is a punishable offense. So issuing false certificate, 7 years in jail. Using false certificate, 7 years in jail. Yes, Dr. Shinan, in the beginning, yes. In the beginning, I have taught you, वह उसी में पूरा है सारे, right? So very easy to understand. Remember here, so you should be very much careful about. You should be very much careful. Means you have to think about suspended animation in some cases, right? Suspended animation. So now you can ask, sir, how tissues were alive? How tissues were alive, like when heart was not working? Remember here, all tissues were viable. All tissues were viable because of dissolved oxygen in the body fluids. Okay, in the body fluid. So suspended animation is an important topic for your exam. Okay, now algor mortis. Algor mortis means what? Remember here, see, yes, body will become cold, because heat regulating center will be shut down. My question, see here, so remember here, so what is the importance of this algor mortis? Iska importance kya batao? Algor mortis ka importance? Remember here, we can understand, we can calculate the time since death. We can calculate the time since death, because in the beginning I have taught you that. See here, every 1 hour there will be loss of 0.5 degrees centigrade per hour. So we can calculate time since death. How? Normal body temperature minus rectal temperature divided by rate of fall of temperature. Okay, rate of fall of temperature. The question is that what is the meaning of rectal temperature? We are using one apparatus like this. We are using one apparatus like this. And we are using like a tube, like apparatus like this. This is called as, this apparatus is called as the, see, this is known as the thanatometer. This is known as the thanatometer. This is also called as chemical thermometer. This is also known as the chemical thermometer. But be careful, this checks what? Body core temperature. See, what is the meaning of body core temperature? When I say the normal thermometer, which you keep like in the axilla or in the mouth, so that will be giving what? Body surface temperature. I'm talking about what? Body core temperature. I'm talking about body core temperature. So that apparatus that you have to infuse inside the body, okay, that you have to insert inside the body. So can you tell me what is the most common place to insert this? Most common place to insert this tube is what? Rectum. Rectum. But this will not be suitable in a case of sodomy, anal sex, right? So most ideal place to keep this apparatus, most ideal place, subhepatic. Okay, subhepatic. Subhepatic means we're under the liver bed. See, apart from that, this apparatus you can insert in the nose also, ear also, esophagus also. This much point is clear to everyone? Right. Chalo, fine. 0.5 degrees centigrade per hour. My question is that after death, suppose if you are going to throw a dead body in water, or you are going to bury that, or if you are going to keep in the air, fastest loss of temperature will be seen in which medium? Can you answer me? Air, water, soil. Fastest loss of body temperature, batao. Fastest loss of temperature. Yes, it is in water. Mnemonic was water, air, then soil. Okay, water, air, and then soil. Okay, fastest in water, then air, then soil. See, remember here, ideally there should be a loss of temperature after death, but there are some special condition where there will be gain of temperature. If you touch the body, body will be hot actually. And so what does it mean? Oh my God, ideally there should be cooling of dead body, no, but there are some special condition where, see, yes, so body will gain the heat, gain the calorie. It is called as post-mortem caloricity. Okay. Usually, normally, there should be loss of temperature from the body, but in some special cases, there will be a gain of temperature. That is called as post-mortem caloricity. So why it is happening? It means there is some kind of endogenous heat production, like in a case of pontine hemorrhage, in a case of heat stroke or sunstroke. And because see, heat regulation system will be disturbed, no. So that's why in a case of sunstroke, even sweating will also be absent. Sweating will be absent in a case of heat stroke. Sweating will be absent. See, even like suppose if there is severe muscle convulsion, and see, all muscles are having this kind of convulsion, right? No convulsion. So because of this kind of movement of the muscles, heat production will be there, no? Like in tetanus. There is a poison, plant poison, which has the similar symptoms like tetanus, strychnine poisoning. So can you tell me what is the name of a strychnine poison? Nux vomica. Nux vomica. Nux vomica plant hai. Nux vomica plant. Okay, strychnine is what? Active ingredient. And loganin also, brucine also. So okay, here only please mention strychnine is spinal poison. It is spinal poison. Spinal poison, strychnine. Okay, see, one seed is enough to kill a person. Okay, so there'll be severe spasm in the body, severe, severe convulsion in the muscles of the body, right? Okay, same symptoms like tetanus, but tetanus is bacterial and strychnine is what? Plant poison. Even in excessive bacterial activity like septicemia, pneumonia, cholera, typhoid. See, remember here, so all these are the examples of post-mortem caloricity. Now, liver mortis. Question is that what? See here, liver mortis means what? After death. Remember here now when dead body will be kept in supine position. Obviously, in all blood vessels there will be blood, no? So blood circulation will already be stopped now. Blood circulation to ruk gaya hai na. Now there will be a stopped blood circulation. Okay, fine. But remember here, arteries, veins, these are major blood vessels. What about a small blood vessel like arterioles, capillaries, venules, right? No, venules, right? These are very, very small and thin blood vessels. But from the down part, see, there will be the gravitational force also, na? यहाँ से तो gravitational force भी आएगा ना, right? No, gravitational force, right? So do you think all blood vessels will be able to tackle the gravitational force? No. Major blood vessels can, but what about small blood vessels? They will not be able to hold the blood for longer time and they will get ruptured, and because of that, now blood will get accumulated in the lower part, in the dependent part. Blood will start getting accumulating in the lower dependent and loose part here like this, and the blood will start getting accumulated under the dermis here, under the dermis. Because of that, yes, obviously there will be deoxyhemoglobin, right? There will be what? Deoxyhemoglobin. See, oxyhemoglobin will be actually what? A red color, bright red. But deoxyhemoglobin, which color? Can you answer me? Which color? Okay, purple color or bluish color. Purple color or bluish color, right now? So see here, so liver mortis is because of what? Nature of hemoglobin. This much point is clear to everyone. And see the blood accumulation over the dependent part, you can see that is called as liver mortis. Different color, so staining or low, यहाँ पे क्या है? Hypostasis. देखो, lividity, staining, hypostasis, darkening of Daisy, like all these are synonyms of liver mortis. But what about vibices? Linear pattern. If there will be linear pattern of liver mortis, vibices. If there will be the patchy discoloration, sugillation. These words you are supposed to memorize, because one time they have asked, sugillation is a synonym of which of the following condition? Algar mortis, liver mortis, rigor mortis. Answer is what? Liver mortis. Simple. Okay. Now you see this picture. First of all, you see this picture. See this picture. Now you tell me, during the time of recovery, dead body was in supine position or prone position? Supine or prone position? Can you answer me? Supine or prone? Bolo. Supine or prone position? See, supine means what? When you are facing towards the roof. And what is the meaning of the prone? When you are facing towards the pillow. Right now? So what I have taught you just now, there will be accumulation of blood under the lower part, under the dependent part, loose dependent part. So here you can see discoloration over anterior part of the body, anterior part of chest, abdomen and shoulder and all, right? Okay, fine. So dead body was in the prone position. But what about this one? Here you can see that there is, so no purple color. Can you tell me what is this? What is this? Bolo. So why there is no discoloration? Why there is no accumulation of blood? Maybe hand was there, hai na? Hand was there, right? Very good. So what does it mean? If there will be any kind of pressure, there will be no accumulation of blood. है ना? Shoulder blade है या जहां पे भी bony prominence होगा, no accumulation of blood. Very heavy pressure over the back part. If you can see there is no discoloration, it means that was in the direct contact and hard contact. Because of the pressure, there was no accumulation of blood. All right. Now, okay, one question to you. Suppose if I have recovered a dead body, I can see discoloration, I can see accumulation of blood over anterior part of chest, anterior part of abdomen, anterior part of thigh. So dead body was recovered in which position? Supine or prone? Answer karo jaldi se. Anterior part mein hai to prone. Okay. Now, suppose if I have recovered a dead body and blood circulation, say here, blood accumulation was there over the back part, over the posterior part of the body, posterior part of thigh. Then what was the position? Supine or prone? supine, right? Very good, supine. Supine and prone to samajh mein aa gaya sabko. But now if I have recovered a dead body where discoloration, where accumulation of blood was there only in the hands and feet and genital organ, then body was suspended in vertical position. Which position? Hanging. So you can see here bluish color here, like in a glove and a stocking manner, है ना? Glove and a stocking manner. Very easy to understand. Even if you are going to throw a person in the water, if dead body will be in the stagnant position, so body will be in the prone position. But remember here, in which condition there is no discoloration, no lividity, no staining. Remember, when in a case of the drowning, when dead body keeps on, when dead body keeps on tossing like this, right? So drowning in a running water, no livor mortis. And hemorrhage, when there will be loss of more than 65% of blood from the body, severe hemorrhage, no livor mortis. Okay, now see, from this table I anticipate one question. From this table, what will be the different colors in different poisoning? Normally there will be what? Blue color or purple color. But in CO poisoning there will be the, see here, in CO poisoning there will be, okay, cherry red color, cyanide bright red, hypothermia bright pink. In these three you can see redness is there. Redness is there. So it means oxygen is there, right? Oxygen is there. And otherwise no oxygen, no redness. Question is that, what is the cause of death in CO poisoning, cyanide poisoning? See, remember here, when a person is alive, there will be oxyhemoglobin. There will be oxyhemoglobin. Okay. But in a case of burns, when CO is going to enter your body, remember, oxygen and hemoglobin, these are like married couple. But CO, see the carbon monoxide is what? Is like ex-boyfriend who was extremely bad person. Okay, but he was having lot of attraction. When CO is going to enter the body, no, now anyhow it will take hemoglobin away from the husband. Okay, now oxygen will be there. Same like handicapped Thakur. Okay, useless. So remember here, so now this will be making what? See the carboxyhemoglobin, right? No, carboxyhemoglobin. Remember here, carbon monoxide is having much higher affinity for hemoglobin than oxygen, 200 times more than oxygen. So can you tell me what is the cause of death in CO poisoning? I hope you are able to recall about 4 types of hypoxia. बताओ क्या क्या था? एक था hypoxic hypoxia. Second was anemic hypoxia. Third was stagnant hypoxia. Stagnant or hypoperfusion. Okay. And fourth was histotoxic hypoxia. Okay. So in, see here, in hypoxic hypoxia, lack of oxygen here. Anemic hypoxia, lack of hemoglobin. Stagnant में lack of blood flow. Okay, so remember in CO poisoning, see here, hemoglobin will be decreased. So please write down, in carbon monoxide poisoning, cause of death is what? Cause of death is anemic hypoxia. Anemic hypoxia. Okay, what about cyanide? Cyanide blocks which pathway? ETC pathway, electron transport chain. Which complex? Complex number 4. Which enzyme? Cytochrome oxidase enzyme. This enzyme is very important for, for the tissues to utilize the available oxygen, right? But if cyanide is going to block this, right? Block this. Now oxygen will be available, but tissues will not be able to utilize it. So please write down, in cyanide poisoning, see the cause of death is what? Histotoxic hypoxia. In hypothermia, see there will be entrapment of oxygen in subcutaneous tissue. That's why it appears like bright pink. Now see potassium chlorate, aniline, nitrate, nitrite, sodium chloride, they are going to release methane. So they will be forming methemoglobinemia, brown color, chocolate brown. Hydrogen sulfide, hydrogen sulfide is getting mixed with hemoglobin, and this is making what? See, this is making sulf-hemoglobin. Sulf-hemoglobin, which is bluish green color. In aniline, sometimes a deep blue, septic abortion, bronze color, and opium, black color. This table is extremely important. Please memorize it. Okay? Even one day before the exam, if you are having 1 minute, no, please revise this. One question most of the time. See here, which color we see in CO poisoning? Okay, cherry red color. Cyanide mein brick red, bright red. Hypothermia, okay, see a bright pink. Easy? Right. Now see this question and try to answer. If you can solve this question, it means yes, you are completely ready now. Bolo. Dr. Athav, you are saying C answer? Okay. Okay, Dr. Shinan, बोलिए. Chalo, some of you are saying C, some of you are saying D. Okay. Chalo, fine. All right. Let's learn this topic first. See, first of all, there is something called as fixation of liver mortis. Fixation of liver mortis will occur in 6 to 12 hours. 6 to 12 hours. Okay. Now, see, like if you see this photo, when you apply a pressure here, when you apply a pressure over the nail bed, right? A nail bed, when you apply a pressure, you can see there is shifting of blood. No, it is called as a blanching. It is called as a blanching. Blanching. Shifting of blood is called as a blanching. And a blanching. Remember, after that, when you release the pressure, there is a refilling of blood. There is refilling of blood. Remember here, when there is no fixation, when there is no fixation, even suppose like if this was the dead body and here you could see the purple color. And if there was no fixation, if you apply a pressure, you can see shifting of blood, you can see blanching, and you can see refilling also, baad mein refilling also. But once it got fixed, even if you apply a pressure, no change in color, no shifting of blood from here to there, no shifting of blood. Very easy to understand. After fixation, no shifting of blood. Okay, no shifting of blood. This one point is clear to everyone? Okay, fine. Now you understand this. See, dekho yahan pe, see in this question, see, first of all, you understand the topic, you understand the concept. Suppose like there was a dead body. Suppose if there was the dead body, I have recovered from somewhere. Okay. So during the time of recovery, see, so see the purple discoloration was like this, and over the anterior part of the body. When dead body got turned like this, right, in this supine position, after the see blood started shifting from abdomen to back part, ठीक है, ये बताओ कि fixation has happened or not? So far, fixation happened or not? बताओ. Means when blood was shifting from the anterior to posterior part, right? So it means what? Fixation has not happened, right? Very good. Fixation has not happened yet, right? Fixation has not happened yet. Okay, fine. Now you tell me. Suppose like same dead body, if you have recovered, same dead body, same, where you could see the purple color over the anterior part of the body. When you turn the body, now there was no shifting of blood. जो ये बिल्कुल fix है, जैसे ये बिल्कुल fix है ना, same like this, ऐसे fixed है. So what does it mean? Fixation happened or not? Where there was no, no fixation, when there was no shifting of blood, तभी से पता है fixation happened or not? Yes. ठीक है? So what I am saying here कि fixation of liver mortis can be seen only after 6 to 12 hours. 6 to 12 hours में body में पूरा fix हो जाएगा. But now you get back to question here. Like how we are working like CID, how we are going to help our legal system. Okay, see here, now suppose see here, so this dead body was recovered from a car in a silent road. So dead body was in the sitting position during the time of recovery, right? Now, so that time, see, there was the discoloration over a back, lower back, over the posterior part of thigh and lower leg, right? Okay, after that, when dead body was recovered from the car and that was kept on the floor, now see, now dead body was in supine position, है ना, supine position. Now blood started shifting, है ना. Now see, the blood started shifting to the higher part of back also, over the shoulder also, over the nape of the neck also. अब ये बताओ, fixation हुआ या नहीं हुआ? Fixation has happened or not? Fixation has not happened. Fixation has not happened. है ना? So how many hours before he got murdered? 6 hours before. Okay, 6 hours before. You can ask the police to see CCTV camera of last 6 hours. Okay, and he can understand who came there in last 6 hours. Who dropped that car there. Very easy to understand. Now there should be no confusion. Very easy to understand. Remember here, in forensic medicine, I expect 2 to 3 one-liner questions, but most of the questions will be somewhat like this. Like, you know, like story-based, clinical-based, situation-based. Okay, fine. So remember, fixation of liver mortis happen in 6 to 12 hours. देखो यहाँ पे, in this phase, like butterfly shape, here there is no discoloration. So what does it mean? Because of the pressure. This is called as pressure pallor. Here you do not see any discoloration. Right? So this is because of what? Hard contact or pressure pallor. यहाँ पे देख के बताओ कि do you think he was wearing a belt here? Linear Vibices, है ना? So this is called as what? Vibices, right? Vibices. Now, rigor mortis. See, rigor mortis, what we are going to learn here. See, remember here. Why rigor mortis is happening? First of all, understand here. Remember, see here. So just after death, what is the first sign? Overall, what is the first sign? See, entire body will be loose now. And there will be what? Loosening of all the muscles. Right? No? So that is called as the primary relaxation. That is called as primary relaxation. All body, see here, so like entire body part will become loose. That is called as what? See, that is called as the primary relaxation. Okay, can you tell me what is the first eye sign after death? First eye sign bolo. Eye sign. Eye sign is the Kevorkian sign. But what was that term where we have learned about the formation of 2 triangles in the eyes? Okay, that was called as, bolo, naam bolo jaldi se. Yes, that was called as the tachynoia sclerotica. Tachynoia sclerotica. Okay, tachynoia sclerotica. Okay, so just after death, there will be primary relaxation. Hai na? When there was the primary relaxation, oh, at that time, see here, at that time, ATP was 100%. 100% ATP. That time, even the muscle proteins like actin and myosin, they were at their own place. Easy, hai na? Own place. Okay, fine. But after 30 minutes to, few hours, now see here, now ATP will start falling. Hai na? Now it will be less than 80% to 30%. When ATP will start falling, no, then what will happen? Then actin, myosin, these 2 muscle proteins, no, these 2 muscle proteins will become what? Unstable, and they will come together like this, and they will make one component. This is called a what? Actinomyosin component, and this is going to cause what? Spasm in the body. So spasm in the body, this is making actinomyosin component. This is called as a rigor mortis. After a few more hours, ATP will be 0. Even muscle proteins will be dissolved completely. So muscle proteins will also be 0. Now there will be secondary relaxation. So what is the cause of rigor mortis here? Depletion of ATP. See, in which organ of the body? Okay. Yes. Chalo. See, in which organ of the body you will see rigor mortis at first. Okay. First is seen in heart. Myocardium. है ना? Okay, Dr. Rizaur Rahman. Yes, I'm glad. एकदम गजबे पढ़ाते हैं. बहुत बढ़िया. चलो ठीक है ना? चलो, I'm glad. I'm also from Bihar. Okay, fine. चलो, so first is what? Heart, myocardium. And first external muscle. First, see here, first, देखो ये क्या था? Heart was involuntary. Heart was involuntary muscle, no? But what about eye? Eye is voluntary. So first external is what? Eye. First external is eye. Orbicularis, ocular. This much point is clear? Very good, very good. चलो, इतनी बात तो सबको समझ में आ गई सबको? Right. Now the question is that डॉक्टर शिवानी, यस इट शुड बी इनफ. बीच बीच में भोजपुरी यूज कर सकते हो. अच्छा चलो, अच्छा है ना? हिंदी थोड़ी आ जाए अच्छे से, वही काफी है ना? चलो ठीक है. अच्छा, जलालाबाद यूनिवर्सिटी कब आ रहा हूं मैं? होपफुली इन मार्च और अप्रैल. लेट्स सी, होपफुली. ओके, चलो फाइन. नाउ वी हैव अंडरस्टूड हियर व्हाट राइगर मॉर्टिस मींस व्हाट? टाइटनिंग ऑफ डेड बॉडी. टाइटनिंग व्हिच इज आल्सो कॉल्ड द कैडावरिक रिजिडिटी और डेथ स्टिफनिंग, है ना? डेथ स्टिफनिंग, राइट? ओके फाइन. नाउ the question is, see here, see it will be, see what I have taught you about embalming. See, embalming will be permanent, है ना? Permanent rigidity. But remember here, what is happening here? It takes approximately 12 hours to appear. It takes approximately 12 hours to persist, and it takes approximately 12 hours to disappear. See, 12 hours to disappear. This is called as a rule of 12. Rule of 12. And so what does it mean? It takes 12 hours to appear, but 12 hours to persist and disappear. Okay, so it means in 1.5 day, rigor mortis will go away. So rigor mortis, post-mortem rigor mortis, that is what? That is only for time being. That is only for time being. Temporary है वो. But वो क्या था? Embalming was permanent. So rule of 12 we have learned. But some other rules are there. Shapiro's said that there is no sequence in rigidity of muscle. See, small muscles will go into rigidity first, then big muscles. But Niston said no. There is a sequence. There is a proximo-distal descending pattern at top, head to toe. So Niston rule is mostly accepted. Niston's rule is mostly accepted, which we are supposed to memorize. This is important for exam. देखो, सबसे पहले ऐसे याद रखो. First, overall heart muscles will go into rigidity. Overall, first heart. But externally जो दिखेगा, first eyelid, after that neck. After neck, jaw muscles and face muscle. ये rule याद रखो. First eyelid, then neck. After neck, jaw muscles and then face muscles. ठीक है? But sequence में, like in very simple manner, फर्स्ट मतलब क्या है कि देखो, नेक के साथ में जॉ, ये सब आ, नेक के साथ में ये सब आ जाएगा. अलोंग विद नेक, जॉ मसल, फेस मसल्स विल कम, राइट? नो, सो फर्स्ट हियर, फर्स्ट eyelid, second neck, third see the chest, fourth upper limb, fifth abdomen, sixth lower limb. Head to toe जा रहा हूं मैं. First eyelid, second neck, third chest, fourth upper limb, fifth abdomen, sixth lower limb. At last, fingers and toes. These 7 sequences you are not going to forget. This is called as Niston's rule. So remember, with the rigor mortis we have learned about rule of 12, Shapiro's rule and Niston's rule. Most accepted is Niston's, and sequencing they are asking. Niston's rule में sequencing they are asking, है ना? Sequencing they are asking. Very, very important, I am telling you. Niston's rule, very, very important. Okay? Niston's rule. चलो फाइन, दिस मच पॉइंट इज क्लियर. अब ये देख के जरा बताओ पिक्चर नंबर 1. दिस इज सुसाइड केस और होमिसाइड. सुसाइड मीन्स सेल्फ, होमिसाइड मीन्स मर्डर, व्हेन अदर पर्सन इज गोइंग टू किल, दैट इज कॉल्ड एज होमिसाइड. सो कैन यू आंसर मी? दिस इज सुसाइड और होमिसाइड. Okay, so some of you are saying that this is a case of suicide or homicide. Okay, it could be possible. Now let's learn here. There is one more type here. See, remember here that there is a condition which mimics like a rigor mortis. There is a condition which mimics like a rigor mortis. But what is that? Understand it. Like suppose if a person was about to kill himself, right? Suppose if a person was about to kill himself. Okay, and see, remember here, so just before death, only a group of muscles which were at maximum activity. So in this case, see the group of muscles will be hand muscles only. So only hand muscles will be at the strenuous work, at the maximum work. So what I'm saying here, that just before death, if a person was about to kill himself, so only a group of muscles which were at maximum activity, okay, just before that suddenly goes into a spasm, and it will be continued even after death. Okay, this is called as cadaveric spasm. Please write down, extremely important topic. This is called as cadaveric spasm. Very, very important topic. This is called as cadaveric spasm. Cadaveric spasm means what? Only a group of muscles which were at strenuous activity just before death suddenly going into a spasm. And see, without going into primary relaxation. Rigor mortis mein ideally there should be a primary relaxation, then rigor mortis, then secondary relaxation. Pehle loose, fir tight, fir loose. Simple. Loose, tight, loose. Simple. Easy to understand. But what is happening in the cadaveric spasm? No primary relaxation. Only a group of muscles which were at maximum activity suddenly going into a spasm, and this will be in the spasm even after death. And remember, after that hand will be like this, no? Remember, this cannot be produced artificially. You cannot open it easily. This cannot be produced. This cannot be produced artificially. This is because, this is because of neurogenic block. है ना? So अब ये बताओ कि this will be considered as antemortem or postmortem. Answer करो. This will be considered as antemortem or postmortem. बोलो. See, rigor mortis is 100%. Rigor mortis is 100% post-mortem. But just before death, suddenly a group of muscles went into a spasm. So cadaveric spasm is antemortem. Very, very important. Rigor mortis mein, did we see the primary relaxation? Obviously, yes. But cadaveric spasm mein, did we see primary relaxation? No. Rigor mortis muscles involved were voluntary also, involuntary also, but cadaveric spasm mein only voluntary. This question they are asking. Okay, this table is extremely important. So instantly there was rigor mortis, so it is also called as instantaneous rigor. Okay, one more name, this is also called as cataleptic rigidity. This is also called a cataleptic rigidity. Okay, so if you can see, weapon in hand. Okay, so here this can be suicidal, this can be homicidal also. After murder, someone can kept, like that gun, that gun in his hand. Could be possible. But remember here, if you check this, if you cannot release it easily, then mostly it was what? Okay, this was the suicidal case. This was the cadaveric spasm. Even if you see the plants in hand and weeds in hand. So this is a case of the drowning. What does it mean? After seeing this photo, you can easily understand that, yes, that person was struggling just before death. Like he wanted to hold something, but he could hold only some plants and weeds. So remember here, in drowning and weapons in hand, yes, you can see cadaveric spasm. Please remember, very, very important. Again and again I'm saying, okay, very, very important, cadaveric spasm. Okay, very, very important. Now, suppose if you are going to throw a person in, like in very high flame, kisi ko zinda jala diya agar, but if you are going to expose a person to more than 65 degrees centigrade, or high voltage electric current. See, so because of the muscle protein coagulation, entire body will be like this. Okay, so what kind of posture is this? Okay, this is called the boxing's attitude, right? No, boxer's attitude. Also like defending attitude or fencing. This is called as pugilistic attitude. Please remember, pugilistic attitude. This word is important for your exam. Pugilistic attitude. Okay, this will be seen in Burns case. What is the root cause of rigor mortis? ATP depletion. What is the root cause of pugilistic attitude? Muscle protein coagulation. Muscle protein coagulation. Okay, very, very important. Very, very important. Now, say remember here. See here, now the temperature, now you see that now we are going to learn late signs of death. Late signs. Okay. Late signs. Okay, now adipose, see here, suppose if the moisture will be there, see like the environment, moisture is there and warm climate is there, moisture, warm climate, and if there will be airflow also, moisture, warm climate and airflow. If all these are present, okay, this will be called the putrefaction. This will be called the putrefaction. Putrefaction. But only moist, see here, only moist and warm climate. No airflow, warm climate hai, humidity hai. Wahan pe, so do you think there will be more sweating part will be there, sweating, and that will be smelling bad, right? So if dead body will be kept in that scenario, do you think there can be a foul smell, and even, you know, adipose tissue can become somewhat like soap, sabun jaisa kuch hai na? So now it can form what? Adipocere formation. Adipocere formation, which is also called as saponification. Which is also called as saponification. And basically soap like. So basically wax, same like a wax, like a Vaseline. Wax in a grave, it is also called as grave wax. It is also called as grave wax. Okay, fine. Adipocere formation we have learned. And now suppose if there is warm climate, airflow. Warm climate, airflow, no humidity. No humidity. See, remember here. So this can cause what? So basically no humidity, airflow and warm climate. So do you think from the body there can be evaporation of fluid, no, evaporation of liquid? Yes, entire body is made up of what? 70% liquid only, no? So yes, there can be what? Evaporation of liquid, right? No? So do you think body will become, you know, like body will be shrunk? Fine, yeah. Okay, all right. Okay. So basically in mummification, what I'm saying here, no? So yes, there can be what? See, because of this kind of, you know, airflow and warm temperature, because of this, what will happen now? See, because of this now, you can see this kind of, see, shriveling of dead body here. This is called as mummification. Mummification. So can you tell me here, out of adipocere formation and mummification, where will you say foul smell? Foul smell like a rancid butter and ammonia like a smell here, right? Moist climate. Okay, but out of these two, where will you see weight loss? Weight loss, approximately 70% weight loss will be seen in mummification, and no foul smell, odorless here. See here, for this, for adipocere formation, this will be taking approximately 3 weeks to 6 months, but mummification 6 months to 12 months. Remember here, with the help of all these, yes, there can be, even, identity will be preserved. But see, in babies, like in, fetus less than 7 months, in fetus less than 7 months, no fat that time. So you will not be seeing the adipocere formation. Okay, no adipocere, very, very important. Now, see here you can see greenish discoloration. Here you can see greenish discoloration over right iliac fossa. This is the first sign of decomposition. This is the first sign of decomposition. See here, so what is the first external sign of decomposition? Greenish discoloration over right iliac fossa. So this is happening because of what? Hydrogen sulfide, the main gas. What is the main gas being produced by bacteria in our GIT? Hydrogen sulfide. After that, like methane, carbon dioxide and all, but most important gas is hydrogen sulfide. So when hydrogen sulfide will be mixed with hemoglobin in our blood, okay, in our blood. Now see, same blood in cecum will be flowing. Cecum is in direct contact with right iliac fossa. So first you are going to see greenish discoloration over the right iliac fossa. After that, you can see the greenish discoloration here also, right? No, but first in right iliac fossa. So in summer, it will be taking how much time in summer? It will be taking approximately 12 to 18 hours. But in winter, it can take more than 24 hours. In winter, so it can take more than 24 hours. Okay, fine. Now you tell me, see the Casper's dictum. ये बताओ, rate of decomposition will be fastest in water, air or soil. Rate of decomposition will be fastest in water, air or soil. कहाँ पे होगा fastest? Yes, mnemonic is A, W, E, O. Air, water and soil. Air, water, earth. 1:2:8. Fastest decomposition will be seen in air, then water, then earth. In earth, slowest, very, very slow. Suppose if it's, see here, like suppose if there is 1 week, like suppose if it is taking 1 week in air, okay, then it can take, see, 2 weeks in water and 8 weeks in earth. Okay, remember like that. Decomposition in air will be 2 times faster than water and 8 times faster than soil. This is called as Casper's dictum. Please highlight this topic, Casper's dictum. This is extremely important. Okay, Casper's dictum. So can you tell me what is the first organ to go into decomposition? Or what is the first organ to putrefy? First organ to putrefy, bolo? Larynx and trachea. Larynx and trachea. First to go into decomposition, larynx and trachea in both male and female. After that, SIS, L, B and H. S for, see, small, like stomach, intestine, spleen. L for liver and lung. B for brain, then heart. At last, so what is the last organ to go into decomposition? Overall last organ to go into deposition is bone. Overall last bone hai. But if examiner is asking you what is the last hollow organ to go into decomposition? In male, this will be prostate. In female, this will be what? Uterus. Please remember, this is important. First organ to go into deposition, larynx and trachea. Larynx and trachea. लास्ट में याद रखो, ओवरऑल तो बोन है, बट है ना मेजर में, विसरल ऑर्गन में है ना यूट्रस एंड प्रोस्टेट, यूट्रस एंड प्रोस्टेट. ओके, चलो फाइन. व्हाट अबाउट दिस मार्बलिंग? हियर यू कैन सी दैट अलोंग द ब्लड वेसल्स यू कैन सी दिस काइंड ऑफ डिस्कलरेशन हियर ना. देखो ब्लूइश डिस्कलरेशन, राइट, लाइक दिस है ना. सो दिस appears here like, like something like marbled appearance. This is called as marbling. bluish green color along vasculature, along blood vessels, okay. How much time it is taking? This is taking approximately 36 to 48 hours. See, this can differ in different countries as per the temperature, okay. So see, remember here, so you can see marbling over along the blood vessels, so there was, you know, like exam going on in India, and you know, like there was a question, write a short note on marbling, and that student did not read about marbling. So he thought ki forensic hai, dead body, and also he started writing about marbling, ki in some religion after death, dead body will be buried, and after that marbles will be kept over the grave. This is called as marbling, okay, fine. So that was not the marbling. Marbling is along the blood vessels, that appearance, marbled appearance, marbling, okay. Now related to trauma, देखो अब यहां पे, ठीक है, related to trauma. सी देखो प्रोस्टेट होता है ना, प्रोस्टेट को आप लोगों ने देखा, उसका डाइसेक्टेड पार्ट देखा, प्रोस्टेट का डाइसेक्टेड पार्ट, लाइक देयर वाज अ यू नो लाइक प्रोस्टेट को जो डाइसेक्ट करोगे ना सेंटर से ना, तो उसका जो ये पोर्शन आएगा दैट विल बी अपीयरिंग लाइक सेरेब्रल कॉर्टेक्स, है ना, सेरेब्रल जैसा, सेरेब्रम जैसा. So a viva was going on, you know, like a male faculty was there, female student was there, second year. So patho viva was going on. So she was shown that that dissected part of prostate. Okay. So देखो यहाँ पे opposite sex है तो थोड़ा सा soft corner आ जाता है, right? So that female student, when she saw that that section of that, you know, uterus, no, so she was not able to understand what was that, right? No. So after that, what happened? No, after that, what happened? So teacher asked, beta, what is this? What is this? So she was saying, sir, this is, arey beta, something which you have, which I do not have. Sir, this is, arey beta, something which you have, which I do not have. Sir, arey bolo yaar tum jaldi se. Arey sir, is it brain? अब पक्का फेल होगी वो, ठीक है. तो be careful about all these. Okay, remember, uterus is the last to putrefy. Okay. Now, some new BNSS, now some new related to injury. Now we are going to learn mechanical injury related to all that trauma, देखो, very important topic, okay. Earlier देखो hurt के लिए क्या था, hurt के लिए it was, देखो hurt, see BNS I'm talking about, hurt के लिए 114. Earlier for the grievous hurt it was actually what, like IPC number 320, ये पहले था. New BNS for grievous hurt is 116. Please remember it. 116. New BNS for grievous hurt. Okay. See here. So voluntarily causing grievous hurt by the dangerous weapons, 118. Now the question is, what is the meaning of grievous hurt? This is important to memorize all these. Emasculation. See here. Like after that, like after the fight, if a person will be, see, suppose if a person will be blind or deaf, or you know, if there will be fracture of any joint or dissection of any kind, any organ of the body, right? No, or remember any injury to nerve and tendon, right? No, like even so disfiguration of what face also, like suppose if there are so many scars on the face, and head, even, you know, like see here, so dislocation of bone or the teeth, right? Now all these are the examples of grievous hurt. Please remember here. Okay, Dr. Fras, chalo, congratulations. Okay, awesome. Okay, I'm glad. All the best for your future endeavors. Chalo, that's great. Okay, fine. Now see here, so one update we should mention here. Earlier for grievous hurt, see, there was a rule of the 20 days. If a person is bedridden for 20 days, or if he is not able to perform his normal activities for 20 days, then it was called the grievous hurt. But now the new update is only 15 days. Okay, 15 days only. This is update. You should know it. Important here. Okay. Now see here, either there can be blunt trauma and there can be sharp trauma. Blunt means what? What is the meaning of blunt? Blunt means any weapon which is having the broader surface area, like lathi, rod, hammer, brick, stone, है ना, ये सब blunt है. लेकिन blade sharp. So what are the examples of blunt force? Abrasion, contusion, laceration, bone fracture. See here, sharp. sharp weapon and light cutting injury like blade, है ना? So this is called as what? See, this is known as the incised injury. But sharp cutting weapon and heavy like axe. So this injury is called as the chop injury. Sharp and pointed like this knife. This is called as the stab injury. Okay. Remember here, what is the significance of learning simple hurt and grievous hurt? Here, it could be possible that a doctor can be bribed, and doctor, like some people, after injury, doctor can be paid, like 1 lakh, 2 lakh rupees. Ye grievous ko like, see, now the doctor will be asking, asked, कि डॉक्टर वो सिंपल लिख दो ना, है ना? फिर सिंपल को इधर डॉक्टर कह रहा है सिंपल टू ग्रीवस और ग्रीवस टू सिंपल, दैट विल बी एक्चुअली व्हाट? illegal only, right? No, so it is very, very important for you to understand. After seeing the wound, you should understand whether this is simple or grievous, because in court you will also be asked the court, है ना? So you will also be asked. Okay, so remember here, all, like when I talk about abrasion means what is the meaning of abrasion? Same like this. See the photo what I'm showing you here, this is abrasion. And abrasion means what? Like a scratch. Same like a scratch. Noch kharoch, aise kharoch. Okay, fine. So abrasion means what? Like whenever there will be superficial rupture of epidermis with a minor or no bleeding. Superficial rupture of epidermis. So all abrasions will be called as simple hurt or grievous hurt. Bolo. Simple or grievous? Bolo. Yes, remember, all abrasions will be called as what? Simple hurt. लेकिन अगर किसी की आंखें नोच लो तो? What about the corneal abrasion? Yes, now this will not be simple. See the corneal abrasion. Okay, now this will be a grievous hurt. Very easy to, because see corneal abrasion. So because of that, so because of this, what can happen here now? Sight, है ना? यहाँ पे मतलब there can be blindness. ठीक है? Okay, fine. So partial or complete, both are, है ना? So both are in the grievous hurt. Very easy to understand. Remember like this. Chalo. Now we are going to understand all types of injury one by one. Sharp also, blunt also. See this question, and first of all you try to answer. See this question, some lines are missed here, but you can, see the photo first, and after that you tell me, out of these 4 options, which can be the answer for this question? What can be the pattern of this? See, a person got trapped. He got trapped like this. See, now you can see the photo, and now you can see this. Okay, you can see this. My question is that this indicates what? Out of these 4 options. Bolo. Yes. See here. Okay, one by one we are going to learn. Okay, all the abrasions we are going to learn one by one. I will get back to question again. Here answer is actually C. Okay, see the tram line abrasion or tram line contusion. Here you can see like here you can see only these 2 lines here, no? Only external imprint here, right? Only external imprint you can see here, no? Only external imprint. So this is like a railway line or tram line. Okay, let's learn here. We are going to understand this part. Okay. Now see different abrasion. So what is the definition of abrasion I have taught you just now? Superficial rupture. See blunt trauma, like what is a scratch? A scratch means because of nail से scratching, scratch है nail से या pin से या pen से, right? Okay. And if there will be, see, multiple abrasions like this, multiple parallel lines like this. So this is called as a graze abrasion. See, graze abrasion is the most common type. Means when a person will be dragged on the road, on the rough surface, like suppose when you were playing cricket and like when you had to dive, and you had to dive, right now, so there was actually what, see here, so this much portion used to get dragged like on the floor, right now. So whenever, see here, when a major portion will be dragged on the rough surface area, multiple parallel lines, that is called as a graze abrasion, which will be appearing like brush burn, which will be appearing like brush burn. Please write down, see here, graze abrasion is also called as brush burn. Brush burn. Brush burn. It is also called as gravel rash. Gravel rash. And please write down. See, what about the pressure abrasion? See, this can be seen because of the pressure, like in a case of hanging, ligature strangulation, even in a case of teeth bite marks. So abrasion is because of pressure. But what about the patterned abrasion? Patterned abrasion means what? Like where you can see the exact pattern, where you can see the exact pattern of weapon, where you can see the exact pattern of weapon, right? चलो देख लेंगे, एक एक करके समझ जाएंगे. See, yeah, picture number 1 is what? Picture number 1 is just a scratch, right? Just a scratch. Picture number 2 बताना जरा ये. Picture number 2. See, multiple parallel lines. Yes, this can be seen in a road traffic accident, right? Yes, this is the example of graze abrasion. But what about picture number 3? First of all, you look at the abrasion. So can you tell me the exact pattern here? Wire, rope, dupatta. Right? Basically, exact pattern you cannot understand here, right? No. So remember here, abrasion is because of pressure. So this is an example of the pressure abrasion. Pressure abrasion. What about this one, picture number 4? Here you can say teeth bite, but exactly you cannot say molar, premolar, canine and all, right? No. So this is also the example of pressure abrasion. What about this one here? You can see exact print of belt here, and exact print. Then it will be, answer will be what? This is the example of, okay, patterned abrasion. Patterned abrasion. Here also you can see exact pattern here. This is also example of the pattern of a tire. So if you can say superficial rupture agar hai, then abrasion. No rupture, then it will be called as what? Bruise or contusion. Now see, like your examiner can try to trap you. Now you see picture number 1. See, in picture number 1, here I'm not sure which, which weapon was used. कि method of hanging क्या था, ठीक है? So this will be the example of the pressure abrasion, pressure. But same thing, if examiner can show you this photo, where rope is also there, where you can see the exact pattern of a rope, where you can see exact pattern of a rope here, and an exact pattern of a rope is also there, no? Then answer will be patterned. So you have to be very, very careful. Like these questions you can solve only after seeing the picture. So different types of abrasion we have learned. Now, what about contusion? Contusion is also called as bruise. This is also called as bruise. See here, contusion means bruise. How to differentiate abrasion and contusion? How to differentiate? See here in this photo, you cannot see any external injury. You cannot see superficial rupture. But you can see here that what you can see here, under the skin, there is accumulation of blood, right? Like suppose, like if a boyfriend and girlfriend, they were sitting together and they were watching a movie, Murder. Name of movie was Murder. Same Imran Hashmi wala. Okay, so many hot scenes were there, so many different shots were there. So when different shots were there, that boyfriend was looking like he was staring at the screen. But after, so girlfriend got annoyed and she was scratching her. Right now, when she scratched him, abrasion came. First time abrasion, second time abrasion, third time abrasion. Fourth time boyfriend got, he got angry, and after that with his punch, he hit her like this. So when he hit her like this over her shoulder, so see here, so there will be no abrasion, no superficial rupture, but because of this kind of punch, Do you think there can be rupture of internal small blood vessels? Yes. Do you think internal under the dermis there can be accumulation of blood? Yes. That is called as bruise. That is called as bruise. Very easy to understand. Now there should be no confusion in between abrasion and bruise. Okay? याद रहेगा सबको? Very good. Very good. ठीक है? All right? Chalo, fine. Now the contusion. We are going to learn the contusion. See here. So contusion, different types of contusion. Yes. Contusion is what? See, देखो यहाँ पे like ectopic. Ectopic means what? Far from the natural side. What is the meaning of ectopic pregnancy? See here, this is uterus, this is fallopian tube, ovary, right? Ideally, there should be implantation here. But if there will be implantation here, far from the natural place, then it will be called as what? Ectopic pregnancy, right? Ectopic pregnancy, right? Ectopic pregnancy. Now, ectopic, see, ectopic bruise means what? Far from the real side, far from the real side. Like, you know, like raccoon sign. Raccoon sign means what? Like if there will be a fracture of this, if there will be a fracture here. So here there cannot be accumulation of blood, but see, blood can get accumulated under the eye. Ectopic bruise. See, they patterned. If you see exact pattern, exact pattern hai, then pattern. What about the railway line or the tram line? Remember here, railway line or the tram line. See, when a person will be hit by a lathi, when a person will be hit by a lathi or by rod, so only external part will be imprinted. Only external part will be imprinted. Okay. Only this one and this one will be imprinted. See, in between there will be gap. Only external part will be imprinted. Same like a railway line or tram line. 6 penny bruises. Where do we see 6 penny bruises? Please write down. 6 penny bruises. Six penny bruises. Where do we see 6 penny bruises? Yes, 6 penny bruises. See here. Now you tell me. See, if I'm going to strangulate someone like this. Manual strangulation. Do you think because of the heavy pressure of the tip of the finger, like say more than 5 years, so disc-like bruises can come? Yes, that is called as what? More than 6. So 6 penny bruise. What is the meaning of penny? So penny means like a coin, disc, circular just a 6 penny bruise. So this will be seen in a case of manual strangulation or throttling. If you see 6 penny bruises around the wrist, then this is a case of what? Child abuse. Butterfly bruise. Suppose if a child will be abused like this, no, like he will be pinched like this. So do you think because of this here there can be butterfly? Yes, this is called, see, butterfly bruise we see in child abuse. Child abuse. Now, see some pictures and you will be having more clarity. See picture number 1, what it is called as most favorite picture for FMGE exam. Whenever there will be fracture of anterior cranial fossa or frontal part, so there will be accumulation of blood under the eye. This is called as raccoon sign, also called as the panda's sign. Same like the panda eye, same like, see, this is also called a black eyes or black spectacled hematoma. This is actually manukala chashma. Right now, this is black spectacled hematoma. Okay. But if there will be fracture over, see, if there will be basal fracture, or if there will be fracture of middle cranial fossa here, and if there will be accumulation of blood just behind the ear, like this, this is called as a battle sign. Please remember, see here, raccoon sign and battle sign, these are repeatedly asked question. Okay, these two pictures you are not going to forget. Okay, now some bruises or whatever. See picture number 1. This is bruise or abrasion. Picture number 1. Hey, I'm not asking you the diagnosis. I know this is a love bite. Everyone knows this is a love bite. But this is abrasion or bruise. ये बताओ तुम. Abrasion है, bruise है. This is actually what? See, here you cannot see superficial rupture. No, skin is normal. You cannot see superficial rupture here. No, इसमें क्या blood accumulate हुआ है ना? Blood accumulate. This is called as what? This is the type of bruise. ये bruise है, contusion है ये. Right now, so here you can see the exact pattern of lip. Right now, so this is called a patterned bruise. Why it is important? Okay, see here, lip pattern will be different, no? So, see, a study of a lip printing is called as, this is called as chyloscopy, study of lip printing. Okay. What about picture number 2? Here you can see, this is like a butterfly bruise. Butterfly bruise. This will be seen in child abuse. What about this neck part here? Here you can see some, no? So this is a case of what? You can see multiple bruises here. This is a case of manual strangulation. Manual strangulation means gala daba karke marna, like this. This is manual strangulation, which is also called as, which is also known as the throttling. Here you can see only this kind of appearance. Bolo ye hai. Okay, fine. तो ये क्या बताना जरा ये? Yes, this is an example of what? Railway line bruise. Railway line bruise, or this is also an example of what? See, the tram line bruise, है ना? Tram line bruise. Very good. तो अब ये बताओ, ये फोटो जरा देख करके बताओ. What is the name of, जिसमें डायग्नोसिस क्या है? HIV, कालाजार, मलेरिया, COVID-19. बोलो. HIV, कालाजार, मलेरिया, COVID-19. है? Why you are using so much of your knowledge? This is just a, this is the example of COVID-19. Lockdown में बाहर गया, ठुक के आया, वो पुलिस की लाठी से मार करके आया, right? ऐसे याद रखो, लाठी से, okay? लाठी चार्ज, simple, okay? लाठी चार्ज, याद रहेगा सब? चलो, fine. Now you get back to question. Now you tell me, when you see this kind of, देखो, अब जरा ये देखो. Now everything is clear. Will you be able to appreciate this kind of injury? If you can see line like this, only like this, line like this. Okay? ये कैसा line है? Railway line, है ना? Railway line. So this is an example of what? आगे बात समझ में ना? In this manner only questions are being framed. Okay? In this manner only questions are being framed. Now we are going to learn about laceration. Remember here? See, देखो जरा ये फोटो देख करके बताओ, which weapon was used? Sharp weapon or blunt weapon? Sharp or blunt? Sharp or blunt? बोलो, sharp or blunt? Sharp you are saying, अच्छा. बोलो, sharp or blunt? बोलो. Okay, some of you are saying sharp, but most of you are saying blunt. Okay, let's understand this. Okay, let's understand this. See, देखो यहाँ पे, see, whenever, suppose, see, sharp means what? Sharp means what? When I'm going to use sharp weapon. When I'm going to use what? Sharp weapon like this. Sharp weapon, even in operation theater, no, even in operation theater, the blade what you are using. So, okay, with that, there will be what actually? Sharp incision, sharp cut hoga. Okay, right? Like this. Sharp cut like this. Where you see the boundary line margin, hai na, even and irregular. Even if you are going to cut like this, no, blood vessels will also be sharply cut, no? So, bleeding will be fast or slow? Fast bleeding hoga. But what about, see, what about the laceration? Blunt trauma means what? When I'm using, you know, like a rod or like, you know, any stone. And if I'm going to hit someone like this, or if I'm using any kind of, you know, like any kind of the blunt object like this. So when it is going to hit like this and it is going to split like this. So do you think, see, like whenever there will be a blunt trauma, right, skin can come out, yes, but in the blunt trauma, you tell me, margin will be regular or irregular? You see this photo and now you tell me, you see this photo and tell me, what about the margin and boundary line here? Bolo, what about the margin and boundary line? Bolo. Now it's very easy for you, know. See here, uneven, right now, uneven, irregular. Bleeding is fast or slow? slow. So this is blunt trauma. This is blunt trauma. Okay. So remember here, we have to see the margin here. Please write down. Please write down. Margin in incision will be even. See a boundary line regular. Bleeding, fast bleeding is called as the profuse bleeding. Profuse. But laceration mein, this will be uneven. And this will be irregular. Bleeding will be slow. That is called as a sluggish blood flow. You have to memorize all these. All these you are supposed to memorize. And now what about the tissue bridge? See, the tissue bridge means what? Like see, whenever I am going to use a blade, now even the blood vessels will also be sharply cut, separate ho jayega. But whenever there will be a blunt trauma, when skill will be coming out like this. So now this wound will be like this. But in between, no, in between this space, see, in between this space, no, neurovascular bundle will be intact, like a bridge. That is called a tissue bridge. Please write down. See, the tissue bridge is seen in laceration, absent in incision. Yaad rahega? Very, very important. Okay. Now see here, on the basis of margin, boundary line, we should understand blunt and sharp trauma. Blunt and sharp trauma. Okay. Chalo, fine. There are 4 types of laceration: split, see, split, stretch, and the tear and avulsion. Split laceration means, first of all, you look at this photo and now you tell me, sharp or blunt? Bolo, sharp or blunt? Sharp or blunt? Boliye. Okay. See here, when you see this photo, this is like this, right? See, picture came like this, but this is actually red, pura full of blood here. So you can see here, so this is actually 100%. This is blunt trauma. This is the example of laceration. What about picture number 2? What about this one? So can you tell me what about this one now? What about this one? Sharp or blunt? Bolo, jaldi bolo. Sharp or blunt? Here also, bolo yahan pe. Yes. Sharp or blunt, this one? See, this looks like incision, no? Sharp lag raha hai. This looks like sharp, but if you see it closely, now if you now if you watch it minutely, now you tell me what is this? See the margin, see the boundary line, see the bleeding. Bleeding is fast or slow, right? It is. Now you see the margin, you can easily understand here, no? See, it has started from here. Okay, so see here, this is called as split laceration. This is also blunt trauma only. This is also blunt trauma only. Split laceration. What is a split laceration? This is incised looking laceration. Please remember, this is incised looking laceration. Incised looking laceration. That's see here. So the laceration which looks like incision. But okay, one more question examiner can ask you. Laceration looking incision. Laceration looking incision. See, incision which looks like laceration. This will be seen in a scrotum. This will be seen in a scrotum. Please remember it. Very, very important. Okay. Very, very important. Okay. Yes. Okay. Just now I've explained you, Dr. Shivani. ठीक है ना? So like even over the scrotum, because see, in the scrotum there will be folded skin, no? So even incision over the scrotum, that will be appearing like laceration. That will be appearing like laceration. So there should be no confusion here. Okay. So split laceration we have learned. Okay, fine. Now you see this question and try to answer me. These 3 pictures I have shown you here. And can you tell me sharp trauma, blunt trauma, see the chop injury, incised cut? Bolo kya answer? Now there should be no confusion. See, remember here, whenever there will be attack over the bony trauma, when the underlying structure will be bone. See, when the underlying structure will be bone, when the underlying structure will be bone, no, now there can be, see, skin can be split like this. That will be appearing like incision. So remember here, you see this photo. How can you say this is sharp? This is actually what? See, incision looking laceration. This is also what? And this is also what? See, blunt trauma. See, now you look at this. See, like, what about the margin here? What about the margin? Even, uneven, obviously uneven. See, boundary line, regular, irregular. It is what? Irregular. Very easy to understand. Same is happening over the lips here. All these, see here, all these injuries are what? These are the examples of split laceration. These are the examples of what? Split laceration. So, answer is what? Blunt trauma. Blunt trauma. Now, there should be no confusion. Okay? Chalo, fine. Next. Some others like stretch laceration because of bone fracture. See, suppose if there will be bone fracture here, radial bone fracture, but see here, so you cannot see bone. So, bone fracture will be inside only. Inside only. So, bone fracture inside was like this. So, because of this kind of pressure, do you think like skin can be stretched and there can be laceration? Yes. That is called as stretch laceration. But the local impact se halka phat gaya, that is called as tear. But what about avulsion? Shearing force. A person was standing on the road. Suddenly a fast moving car came and he hit him like this. So when a car is going to hit him like this, so do you think skin can come out like this? That is called as avulsion injury. That is called as avulsion injury. Okay. Remember here. Look at these photos. You should know all these terms. When only skin is coming out, when only skin is coming out, it is called as a flaying. It is called as flaying. When skin plus subcutaneous tissue both are coming out, it is called as a degloving injury. It is called as a degloving injury. Degloving injury. When skin and subcutaneous tissue both are coming out. When scalp skin and like this coming out, it is called as scalping. These terms you should be knowing. When only skin, flaying. Skin plus subcutaneous tissue, degloving injury. Degloving injury. Okay. All these are the examples of blunt trauma. All these are the examples of what? Avulsion. Avulsion. Okay. Incised looking laceration kaun sa tha? Split laceration. Don't forget that. Whenever there will be injury over, over forehead, over, like around the lip, right? Around the lip, you can understand mostly it will be what? It will be what? Split laceration. Now, incised cut, sharp cut. Sharp cut means what? Like this. You can easily understand here. See the boundary line, everything regular, even, right? Everything even. But see, remember here, now you can understand here. See, suppose if I'm going to start cutting from here and after that I'm going to finish here. See the head point, see the point of starting will be called as head end. And the point of incision where I'm going to like leave it. Last point, ending point will be called the tail end. Remember, head end will be bigger and the tail end will be narrow. Okay, this will be narrower. In between, the gap is called as gapping. Okay, now look at this picture. Look at this picture, and now you tell me picture number 1 and this ending is picture number 2. So can you tell me which one is the head end, 1 or 2? Which one is head end, 1 or 2? 1 or 2? 1 is head end. Head end will be bigger, right? Head end will be bigger, right? No? But what about the tail end? Yes, see here. So this is called as, yes, this is called as the tail end. Yaad rahega, head and tail end, very, very important. So basically why it is important to learn all these? Why it is important to learn all these? Because we have to understand from which point he was being attacked. Point of, jo uska ye tha, starting point kya tha, finishing point kya tha. This is important. Isse kya pata chalega, angle of attack, from which direction he was attacked, right? Okay. Tissue bridge was seen in laceration or sharp cut? Laceration. Okay. Now, in sharp cut, no, we can see a beveling cut. What is beveling cut? See, suppose if I am going to cut with a blade here, with a blade, suppose if I am going to cut like first point, I'm going to penetrate, after that I'm going to stretch like this. Okay. Now, remember here, only one point I will be able to appreciate. Only this point I can see, this point I cannot see. Right now, so this will be called as what? Beveling cut. Remember here, beveling cut is seen in. Beveling cut is seen in sharp cut trauma, incised injury. If I can see multiple, yeah, what about this photo? So multiple parallel lines over the forearm, like this. See here. So these looks like very much superficial cuts. Superficial hai. है ना? So if you can see multiple parallel lines over the forearm, around the neck, around the chest, around the accessible part of body, so it will be called as what? Yes, these are called as hesitational cuts. These are also called as what? These are also called as the tentative cuts. These are also called as the tentative cuts. These are also called as the tentative cuts, also called as the trial cuts. तो ये बताओ, these are going to be seen in suicide or homicide? Suicide or homicide? Obviously, these are the, see here, these indicate what? Suicide. These indicate suicide. Okay. Remember here, like injury to which organ can never be suicidal? See, whenever you get any patient, if there will be any kind of, like if there will be any kind of, see the cut injury over a scrotum or over a genital organ, it will never be suicidal. ऐसे कौन suicide करता है, right? So obviously this will be what? Homicidal. Homicidal यानी किसी और ने attack किया है, right? Remember, like hesitational cuts, superficial cuts, and so these are examples of what? Suicidal tendency. Now look at this photo. Now you tell me which weapon was used. Which weapon was used? बोलो. Yeah, this is called as axe. है ना? जैसे मतलब बुचर्स लोग होते हैं, जैसे ऐसे करके वो कहते हैं ना कि मतलब कि मीट को जो चॉप कर देते हैं, ऐसे चॉपिंग, राइट? नो, मीट क्लेवर्स एंड चॉप, axe, sword. Say this view. So this is also the example of what? This is also the example of what? Chop, cut, heavy cutting weapon. Okay. Now see this question. On the basis of shape of the wound, now you tell me which weapon was used. Dr. Shivani, laceration will be, like a very small part. Okay, only a small part, like a small thickness. Now you see this question and try to answer. Okay, Dr. Shahbaz Begum, Dr. Akshara, Dr. Ryan, Dr. Osman, all of you. Yes, Dr. Barad. Yes, Dr. Runa. All of you are doing great. Bolo. See the chop wound, Dr. Khurshid, you can see what? See the chop wound, you can see multiple depths will be there. Multiple depth will be there. But है ना, avulsion में क्या हो गया? Avulsion में split of skin or subcutaneous tissue will be coming out. Okay, chalo, now let's learn here. See, now I'm going to talk about the stab wound injury. Stab means what? When sharp and pointed. When only, see, if you see only one entry point, it is called as penetrating wound. But if you see entry point also, exit also, R par ho gaya, then it will be called as a perforating wound. Okay, perforating wound. Remember here, in the perforating wound, entry wound will be bigger and exit wound will be smaller. Exit wound will be smaller. Simple hai? But this will be opposite in gunshot injury. This will be opposite in gunshot injury. See, in gunshot injury, like entry point will be smaller. Entry point will be smaller. And in, see, yes, so like in the gunshot injury, like exit point will be bigger. Okay, exit point will be bigger. Chalo, this much point is clear to everyone. Remember here, suppose if there is a single-edged weapon like this. Like this. So now shape of a wound will be like either like a triangle or like a wedge shape, like this. If you see the double-edged weapon like this, double-edged. Now see here, both angle will be angulated like this. Okay, now elliptical shape or slit-like, slit-like, very easy to understand. So on the basis of shape of a wound, you can understand which weapon was used. So can you answer me here? Sharp, pointed, and see that triangle here, no? Triangle. So sharp, pointed, and single-edged. Single-edged. This much point is clear to everyone. Now, if a person is going to attack on you, suppose if you are going to hold the weapon, if you are going to grasp the weapon like this, so obviously see here, wound will be there in the web spaces. Wound will be here, web spaces में आएंगे. इसको हम लोग बोल, this is called as active defense wound. But if a person is, see here, but when a person is going to attack on you, if you are going to save yourself like this, right? No, so now wounds will be there. No, wounds will be here only over the back of the forearm and the hand. That is called as this wound. This is called as the passive defense wound. I'm telling you, important. Very, very important. Very, very important. Okay, very, very important. Please remember, active defense wound. Active means front line. See, the passive matlab back side. All right. Now, see here, 100 to 105. You are supposed to memorize new BNS. See here, BNS 100. So this defines the culpable homicide. Mean the culpable homicide means what? 100%. Yes, he wanted to kill him and he killed him. Okay, 100% murder. But see, definition of culpable homicide, not amounting to murder. Okay, not amounting to murder. Like, so what does it mean? Like suppose if there was a bush here, है ना? Bush है यहाँ पे. See here, the owner of that house, that husband, he was sleeping. Husband was sleeping just behind the bush. है ना? मतलब झाड़ियों के पीछे सो रहा था वो. Servant was sitting here. He did not know that his boss was sleeping there. Only wife was knowing this. Only wife was knowing this. Wife ने इसको बोला servant को आग लगा दो यहाँ पे. Burn this bush. He burned this bush. And after that, see here, he died. So this was actually what? Culpable homicide, not amounting to murder. Not amounting to murder. Suppose if you are going to open a big dig on the roadside or like somewhere, and if a person is coming there for the morning walk, and in that dig, like snakes are there, you know, so glasses are there, so many things are there. And after that, when a person is going to fall there, right now, so that will be what? See, that will be the culpable homicide, but not amounting to murder. 103, punishment for murder. See, punishment for murder. And 105, see, punishment for culpable homicide, not amounting to murder. 109, attempt to murder. Attempt to commit culpable homicide. 110. Voluntarily causing grievous hurt. 118. See, now let's learn here. Suppose if a person had the intention to kill someone, right now, and he had actually, you know, like he did actually, like he attacked him. So like severity was there. Yes. Like he wanted to kill him. And after that, he died also. So now it will be on the, see here, 103, 100% culpable homicide. See here, like there was intention, severe hurt, but no death. So this will be considered as what? Attempt to murder. See here, there was intention. Yeah, but see here, the attack was not that much harsh, but that person died. Here. So remember here, see here, 105. See here, punishment for culpable homicide, not amounting to murder. Intention was to kill that person, not so much harsh, and that person did not die. Now this will be what? See, attempt to commit culpable homicide. Okay, remember like this. Now BNS number 22, McNaughton's rule. Again and again we are going to revise this. See now, see the 23 and 24. See, this is related to like intoxication. First of all, suppose if there will be involuntary intoxication, means like you offer this tea to someone, he did not know, but you mixed, like something else, or you offered like a glass of Pepsi or Coca-Cola, but you mixed alcohol also. He did not, like he was not aware of this. So this is called as what? Involuntary intoxication. After that, if he's going to commit any crime, no punishment. Okay, the person who intoxicated him will be punished. But voluntary intoxication है, पीने के बाद ही उसको मारूंगा, है ना, उसके बाद ज़्यादा एनर्जी आएगी, then, है ना, so then he will be punished for this. So along with the topic also, I have explained it. Okay, remember it. Now, when there is a child, when a child will be hit, or if a child is going to like hit against any kind of pointed object, so see the skull will be soft, so only indent, like there will be a small dent will be there, like a small dent like this. A small dent, same dent on your car, same dent, अंदर हल्का सा धस गया. So this is called as indented fracture. Indented fracture, also called the pond fracture. Same like this, same like the table tennis ball, like this, same like the table tennis ball, right? No, ये क्या है? Table tennis, like in China, this is the national game. In China, it is called a ping pong. So it is also called a ping pong fracture. Please write down. See, this is also known as ping pong fracture. After striking on the head, like suppose if a small portion of the bone, was not there, like this, you can see only a hole, like a gutter. It is called the gutter fracture. After the injury, see, suture of the skull got separated like this. So it is called as suture fracture, diastatic fracture. Rod came across the head like this. This is called the perforating fracture. Now, if a person actually fell from like very, very high building, like from 15th floor, and if a person is falling on the floor over his butts or over his feet, so because of that, do you think there will be heavy pressure will be coming out from the lower part of the head like this? मतलब कि lower part of the body से ऐसे करके जाएगा, or even if there will be heavy blow to the chin like this. So do you think in this condition, whenever there will be heavy pressure from the lower part, do you think head can go like this? So do you think head can get separated from the ring of foramen एकदम ऐसे? Yes, from the ring side, if head get separated, it is called as a ring fracture, also called the transverse fracture. Okay, see the transverse fracture, skull will be separated from the point of ring of foramen, from where spinal cord is coming down, right? Okay, but if there was like bike rider, like he was driving very, very fast, suddenly after skidding, when he skidded on the on the road, like after skidding on the road, what will happen? See, देखो बाइक ऐसे करके गिरेगा. So do you think from the road side also heavy pressure will be there over the skull? Yes, and in this manner skull can separate it into two half, है ना? Half part बिल्कुल ऐसे separate हो जाएगा, half part, right? Now, so now face will be like this, head will be like this, like a nodding face sign, है ना? So like same like a hinge, like on the door, hinge fracture, motorcyclist fracture. Here only you can see nodding face sign. Suppose if you are going to hold the head of someone, after that you are going to strike against the wall, सर पकड़ के मार दो किसी का, ठीक है? तो skull is actually bony part, but inside skull cerebral cortex is freely movable, no? Inside the skull cerebral cortex जो ऐसे वो तो बिल्कुल free है ना? तो जैसे strike किया, the way you are going to strike against the wall. So do you think, like suppose if this is the cerebral cortex and this is the skull wall, so do you think a skull will be striking against the wall like this, right? So do you think there can be injury here? Yes. See here, at first point injury is called a coup injury, but skull, see, cerebral cortex will go back also, right here. So injury here, anterior part also, posterior also. Injury over the point of impact. See here, injury over the point of impact is called as coup injury. And injury at the, see here, like at the point of, like the posterior part, this is called as counter coup. First point injury is called a coup. Backside injury is called as counter coup. Now intracranial hemorrhages. Say, look at this CT scan image. And what is the diagnosis here? Idly shaped, right? No, idly shaped bleeding is here, right? Idly shaped. So it is what? EDH. Which blood vessel you are going to see here? Which blood vessel will get ruptured? Middle meningeal artery. But a subdural hemorrhage means what? See, this is a skull bone. Skull hai, a skull bone. After that, some layers. Okay, this is called the pia mater, arachnoid mater, and dura mater. If there will be bleeding here, this is called as EDH. If under the dura mater, it is called as SDH. If bleeding is just below the arachnoid mater, it is called as what? ये क्या होगा? Subarachnoid hemorrhage. And after that here, intracerebral. This much point is clear to everyone. This is favorite question in anatomy also, very, very important. Which blood vessel will get ruptured in subdural hematoma? Bridging veins. See here, any kind of aneurysm rupture, subarachnoid hemorrhage, and MCA part, intracerebral. See what are the medical legal importance here? Let's learn this. Okay? See here, anatomy part over, surgery part over, but what is the medical legal aspect? What is the medical legal aspect? In EDH, you know what is happening here in EDH, no? First of all, you see this question, you will be able to understand it. Bolo. See this question and the topic which I want to explain you. Okay, it will be covered here. Let's understand here. See, after head injury, if a patient, like suppose here, after head injury, if a patient comes to your hospital, see that time patient was completely unconscious. After 4 to 5 hours after basic management, he became fully conscious. Okay, he appears to be very much normal. So can you discharge him? No, because in EDH again he can be unconscious. Okay, so a period of consciousness in between two period of unconsciousness is called as lucid interval. Lucid interval, period of consciousness in between two period of consciousness, it is called as lucid interval. Okay, so biconvex shape here, yes, EDH case. So lucid can be seen, yes, middle, yes. And remember here, now see, when a person was lying on the roadside, when he was completely unconscious, after that police van came, he got up. After that, he got up. After that, looking at the police, again he fell unconscious. So what police people will be thinking? What they will be thinking? They will be thinking that this man is fully drunk. So please write down, EDH also mimics like drunkenness. My question is that during the period of consciousness where patient looks completely normal, he wants to go home. So can you discharge him? But if you are asking, no, I want to admit you for more 2 days. So patient will say, no, doctor, you want to make money. That's why you are admitting me. So kya karoge? Are you going to discharge him? No, remember here, you cannot discharge him. Because again there can be unconsciousness. And I see here, suppose if we are going to discharge him without any medical legal paper, after reaching home, if he will be going into unconsciousness, no, now you will be responsible. For this. Because doctor, how come you don't know about lucid interval? It is there in EDH. So how cannot you understand? And आना चाहिए सबको आपको. Okay? So remember here, even if they are requesting, they are supposed to sign a special paper that is called as a LAMA, leave against medical advice, or a DAMA, discharge against medical advice. Okay, this is a medical legal paper. You have to ask the patient or family members to sign. Okay, and they will be writing on the paper that doctors have explained me about all the complications, but I want to go home at my own risk. If anything happens to me, doctor will not be responsible. So patient or family member, they will put the signature and doctor will put the signature. Leave against medical advice, discharge against medical advice. Okay, my question to you is that during a lucid interval, if a person is going to sign any contract, will this be valid or not? Bolo. Answer is yes, but he should be signing in front of 2 eyewitnesses. Okay, because see, remember here, lucid interval is a complete phase of, and you see here person will completely be oriented. Okay, fine. And remember here, now you tell me, see, like there is a case of the child abuse, like where a stepfather, when he got angry, he hold the head of the child. After that, he shoot the baby like this. So what does it, so do you think because of this there can be internal hemorrhage also? So this is called as shaken baby syndrome. In child abuse, we see subdural hemorrhage. Okay, subdural hemorrhage. Now, suppose if you were driving a car, suddenly because of, like someone came in front, and suddenly if you have to stop the car, sudden, and so do you think because of the sudden stoppage of the car, your head will go back and front like this? है ना, आगे पीछे होगा बिल्कुल, same like this. And you think because of this, there can be injury to a spinal cord also? This is called as a whiplash injury. Whiplash injury, important. Whiplash injury means after sudden stoppage of car, yes, head can go back and forth, right? This is called as whiplash injury. Suppose if you were driving, okay, suppose like you were walking on the road and suddenly a car came and hit you like this. So first point of contact is called the primary impact injury. After, see here, after getting hit by the car, so now you will be falling on the car. Now you will be falling on the car. So because of that, there will be injury that will be called as secondary impact injury. I am saying what? See, the primary impact injury, secondary impact injury. So first of all, see here. So now suppose if you were walking, suppose if a car is going to hit you like this. First time attack, first hit, it will give you, see, this will give you the primary impact injury. After that, you will fall on the car, secondary impact. After that, you will fall on the ground. So because of the ground also, there will be injury. This will be called as the tertiary impact injury. Tertiary impact injury. Here, injury will be because of car. But here, injury will be because of the ground. So see, secondary, see, the tertiary impact injury is also called as secondary injury only. Secondary injury. Either you say tertiary impact or secondary, same thing. Now, out of these three, where will you see fracture of tibial bone and knee fracture? बोलो कहाँ पे देखोगे? Obviously in first, right? है ना? Okay, see, when the first point of contact, so bumper hit, right? Or bumper hit, so fracture of tibia bone or patella bone, depends upon the height of a person. So here you can see in the primary impact injury, you can see bumper fracture. Please remember, this is old question, bumper fracture. Now, ये देख के बताओ कि what was the position of this? See, ये बताओ कि when a person was sitting on the like on the driver's seat and if a person was sitting on the front passenger, where do you expect? See here, so one is the driver, second is the front passenger, My question to you is that out of driver and front passenger, where do you expect like ankle fracture, foot fracture? Obviously ankle and foot fracture. Ankle and foot fracture. And you can expect in the driver. And you can expect in the driver, right? Okay, driver. And because of what? Accelerator, brake and clutch. But where can you expect femur fracture or hip dislocation? Hip dislocation, like this X-ray. Femur fracture, hip dislocation. In the, see, like you can see this kind of fracture in the driver or front passenger and a long drive pe, right? So please remember, this is called as dashboard fracture. Femur fracture, you can see femur fracture and hip dislocation. Seat belt injury. Suppose if a person is going to wear seat belt properly, mortality rate will be decreased by 80%. Okay, but remember here, all the organs which come under seat belt will get ruptured. So what is the most common organ to get ruptured here? Mesentery. After that, GIT organs. Now see the thermal injury. See the thermal injuries here. See here, by hot liquid. Okay, this is called a scald burn. By hot metal, this is called as the thermal burn. इसको देख के नहीं bike पे silencer touch हो गया. By acid alkali, if you can see the pus collection here just after burn, so that is called a chemical burn, But what about this one? Lightning burn, because of bijli kadakne se, lightning burn. Whenever there will be a splash of electricity from the cloud and like a splash of like, when that will be coming down, anyone who comes in between, he can get a lightning burn, which is also called as filigree burn. which is also called as filigree burn, also called as arborescent burn. Arborescent burn. Here you can see the pattern like this, something like a flower like pattern. This is also called as a Lichtenberg. This is also called as a Lichtenberg flower like pattern. See, examiner can give you same picture, and in one option there will be what? Marbling also. Marbling is along the blood vessels, but filigree burn is around. ना filigree burn कहाँ पे आएगा? Over epidermis. Superficial है ये, superficial है. Very easy to understand. All these points are important. Remember, filigree burn, repeatedly asked question. Repeatedly asked question. Okay. Now electric burn. You should know that there are two types of electric current. One is called the direct current, low voltage current, low voltage current. Another is called as alternating current, high voltage current. In low voltage current, a small wound will be formed over the over the palm like this, and like a small like electrical appliances. But alternating current, remember here, when a person will get stuck to any like alternating current, no, person will not be able to detach himself until and unless the main switch is getting off. Why? Because electric current, say here electric current, so this will create the situation like that tetany, situation like that tetany. And remember here, so because after that, no, when a person will be stuck to the electric current, no, so like entire body will go into a spasm like this, okay, tetany like symptoms. And remember, see, the electric current follows heart impulses, heart impulses. When electric current is going to enter your body, so it is going to follow, it is going to move as per heart impulses, as per heart impulses, right? So remember here, what will be the cause of death here? Obviously, it can cause what? So it can cause ventricular fibrillation. So what will be the cause of death in electric burn? What will be the cause of death? Yes, see, cause of death will be cardiac arrest. Cardiac arrest. This much point is clear to everyone, right? Now, suppose if there will be a firm contact with the low voltage current, you can see a small wound here, a small wound. This is called a joule burn. Suppose, say here, now you tell me, suppose if there will be like electric current that was about to touch your skin but could not touch, and it went like this, halke se like this. So this will give you like splash appearance, like a splash burn, splash burn. See, loose contact with high voltage current. Now you see this type of skin. Which type of skin is this? Hard leather, like crocodile, crocodile. And this is called the crocodile burn, crocodile burn. Sometimes, you know, like the metal. See, yes, so molten metal can get deposited in the bones also. And sometimes, see, yes, molten metal can get deposited in the tissues. Right, a molten iron metal can get deposited in the tissues, which you can see only through, only with the help of electron microscopy. That is called as, see, that is known as the current pulse. But remember, see here, see this metal, this will be releasing heat also, na? Heat also. So bone minerals can get melted also, and it can get deposited at different places at bones, like this. So these are appearing. So these are appearing like what? Bony pearls, bony pearls. Remember here, jewel burns, splash burn, and the crocodile burn, bone, and see here, bone pearls and the current pearls. All these are synonym of electric injury, which is called as electrocution. There should be no confusion here. Now you see this question and answer me. Now it's very easy for you. Very easy now. Bolo. And very easy, no? So what will be the cause of death here? Now in this case, what can be the cause of death? Obviously, and this is an example of electric current, right? Electric current. So answer is what? Answer will be cardiac arrest, right? Okay. Now you see this question. After they burns, see, like frequently asked question, which one is the sign of ante-mortem burn and post-mortem burn? Signs of ante-mortem burn. If a person died because of burns, now you have to look for some ante-mortem, means okay, before death it was there, before death, right? So like in a case of burns, are you going to see black soot deposition in the respiratory tract? Soot is nothing but carbon compound. Okay. So ye to pura 100%. This is what? Antemortem. Antemortem. Before death. Yellowish green sputum means what? He was having any kind of pulmonary infection. Okay. See what about the curling ulcer? There are two types of stress ulcer which you would have learned in general part of surgery. One is called as curling ulcer. Another is called as Cushing's ulcer. In burns, you see curling ulcer. In head injury, you see Cushing's ulcer. Remember here, you should not be forgetting these 2 points. One is called a curling ulcer and Cushing's ulcer. So when a person was alive, then only these ulcers can form. No. So curling ulcer is also an example of what? Antemortem. But what about pugilistic attitude? Like this kind of, posture kya tha? Same like boxers, defense, fencing attitude, 100% post-mortem. So can you tell me the name of 3 rules for rigor mortis, what we have learned? Bolo. Rule of 12, Shapiro's rule, and Nisten's rule. Nisten's rule, sequence. Can you tell me the sequence? Eyelid, neck, chest, upper limb, abdomen, lower limb. Last, fingers and toes. 7. Okay? Sequence of appearance and disappearance is the same in Nisten's rule. Remember it. Very, very important. Okay? Very, very important. Now, bomb blast injury. See, bomb blast injury. Remember here, say here, the first injury will be because of the blast wave. This is called the primary blast injury. Some people make the bomb, they can keep nails inside also. Nails hota na, keele jo hote, keel, nails. So obviously after bomb blast, now the nails will be, so nails will be flying in the sky. So see here, so because of the flying projectile, secondary blast injury. Because of the energy of the bomb, now the person will be displaced from here to there. So because of the victim displacement, it will be called the tertiary blast injury. Because of bomb blast, there can be building collapse also. There can be fire in the building. That will be called as the quaternary blast injury. Right? And after this, after many weeks and many months, yes, there can be what? Because of the chemicals, because of the radiations, yes, that will be called the quaternary blast injury, right? A quaternary blast injury. See, like in Hiroshima, Nagasaki, now still some kind of injuries are happening to the people. Right now, long back it happened, but still so quaternary. Now, see here, see this picture, and now you tell me, see this picture. So this is because of waves. So this will be called the, see, जिसको क्या बोलेंगे? Primary. Here you can see flying projectile, secondary. Victim displacement, this will be tertiary. Okay. Because of the flying projectiles, do you think there can be abrasion over the body? Abrasion ho sakta hai. There can be bruises. There can be laceration also. Abrasion hai, bruise hai, laceration hai. This is making a triad. Can you tell me what is the name of this triad? This is called as Marshall's triad. Very important. Please highlight this. This time neetpg question. Marshall's triad is seen in which type of bomb blast injury? Secondary blast injury. Okay, Marshall's, very important. There will be abrasion also, contusion also, laceration also. This is making Marshall's triad. Now, related to this last time FMG question. See, first most important point. See, because of bomb blast, what is the first organ to get ruptured? In air, first hole will be ear. Ear say directly. So first is the tympanic membrane. After that, major may lungs, then GIT. See, bomb blast can be under the water also. So when head is above the water level, but like see, this head part is above the water level, but this part is below, like under the water. Okay. So what is the first hole to go inside? Rectum only. So first organ to get ruptured in this condition, GIT. After that, lungs, then ear. When head is also under the water, then both hole, ear also, rectum also. first ear and GIT, at last lungs. I'm telling you, bomb blast injury repeatedly asked question. Sequence, अगर कुछ नहीं याद है तो इतना याद रखो यार, ear में है ना, ear tympanic membrane basically. Okay, remember like this. But you have to memorize all these in sequence. Now the torture methods. Beating on the soles is called as phalange or bastinado. Beating on ear like this, telephono. Suppose if a person can use a plastic bag and they can keep that plastic bag, you know, like fecal matter will be there, urine will be there. After that, he's going to immerse the head of a person there. That is called as a wet submarine. Only plastic bag wrapped around the head, dry submarine. You are hanging someone like a parrot. Means you are going to tie the wrist and ankle and then you are going to hang like this. Okay, this is called as the parrot's perch. You are letting someone sit on wooden horse, lakdi ka ghoda. For how many minutes a person can sit like this? Obviously it will be very much painful. Saw horse, isse bhi zyada punishment dena hai, then at the legs, at the feet, you can hang a 5 kilo weight. Saw horse. Dubo ke marna. Means first of all, you are going to immerse a person, then you are going to take him out. You are giving him some extra time to confess that truth. If he's not speaking that truth, after that, again, you are going to immerse him. Again, you are going to take him out. This is called as a dunking. Dunking. Mafia people. Mafia. Say, yeah, they can tie their wrist and ankle like this. And the same rope, they can ligate around the neck. And they can throw the person in a forest. So, see, when a rope will be ligated here, and because of this, there will be obstruction in the blood supply here. Right now, this is called as incapacitamento. Incapacitamento. Okay, incapacitamento. Okay, dinner break. Chalo, theek hai. After this chapter, I will give you a break. Don't worry. See, the cattle prod means what? Cattle prod. Please write down. Whenever there will be electric shock over genitals. Electric shock over genitals is called a cattle prod. Black slave was especially for black Americans. See, whenever they used to do any mistake, hot iron rod, they used to like insert in their anal canal. Okay, it is called as black slave. Okay, remember here, very good. Chalo, all these points are good. You are able to recall everything. Okay, okay, so we can take a small break now. But remember, see here, so break will be only for, see, the 10 minutes will be fine. Right, okay, small break. See, the class chalegi aaram se 12-1 baje tak, don't worry. So now the break is only for 15 minutes, okay? Only 15 minutes break, 15 minutes, okay? Have something and you come back, okay? Chalo, we will continue it because see here, half portion of forensic is over, half part is over. Big chapters we have completed, okay? Chalo, all right. See you after 15 minutes. Thank you so much. Oh, yes, everyone, we're going to start now. Chalo, 15 minutes over. Ajo, get back. Okay, see, like 50% we already have completed now. Okay, now we are going to start like asphyxial death. See, dekho, all BNS got updated on 1st July 2024. Okay, so we are already working with new laws. So we should be expecting at least one question from BNS. And especially I'm thinking related to dowry or McNaughton's rule. McNaughton's very commonly asked. Okay, rape cases and, especially murder and, especially say related to grievous hurt, very important. Now, what is the meaning of asphyxia? Can you answer me? Meaning of asphyxia. See here, whenever there will be difficulty in breathing in and out, there will be, see, whenever there will be, yes, see, whenever there will be breathing in, like difficulty in breathing in and out, right? It is called as what? Asphyxia. Remember when I say hypoxia, hypoxia means, see, when there will be deficiency of oxygen, anoxia, absence of oxygen. Asphyxia, whenever there will be difficulty in breathing in and out. Okay, and remember here, what is the literal meaning of asphyxia? This is called as pulselessness. This is called as pulselessness. Okay, pulselessness. So now, see, when like whole body will be suspended in air. Whole body will be suspended in air with a neck constriction. This will be called as what? Hanging. Okay. Now, no suspension of body in air. Only neck constriction. That will be called as what? Yes, that will be called as strangulation. That will be called as strangulation. Like strangulation. Like suppose if I'm sitting on this chair and someone is standing at my back and if he is going to ligate my neck with a rope, so that will be called as what? Strangulation. When a rope ligature material is being used, then it will be called as what? Ligature strangulation. Ligature strangulation. If a person is using his palm to kill a person, it will be called as what? Manual strangulation, right? Manual strangulation, which is also called as manual strangulation, is also called as throttling, is also known as the throttling. Okay, remember all these points are important. We have learned hanging, see the definition of hanging, and after that is strangulation. But if there is no suspension, no neck constriction, and still person is going to die because of asphyxia, that will be called as what? Suffocation death, right? That will be called as suffocation death. Suffocation death, right? Like when mouth will be closed, mouth and nose will be closed like this. Suffocation death. Even, like even the drowning is also a type of asphyxial death. See, the drowning is also a type of asphyxial death. When water is going to enter the lungs and replace the air, right? No, so that is, so even so remember, even the drowning is also a type of what? Asphyxial death. Now let's start with hanging. Now you tell me, say now you tell me when the neck will be strangulated like this. Okay, so do you think because of this, there will be severe pressure over the blood vessels here, right? Over the blood vessels here. So do you think there will be severe congestion also, congestion of blood vessel? No, there will be congestion of blood vessel. After that, see, because of the severe pressure, do you think there can be rupture of blood vessel also? Yes. So after that, see, after that you can see like a small the blood accumulation over the faces like this. So what it is called? So can you tell me, say whenever obstruction of blood vessel here, now the lack of blood supply, do you think it can cause cyanosis also? Bluish discoloration? Yes, I am talking about a triad. Please remember here, yes, there can be cyanosis. Cyanosis means bluish discoloration. Yes, there can be, see, there can be the congestion of blood vessels, and you can see a small blood, see here, just make as a hemorrhages jaisa, that is called as, yes, these are called the petechial hemorrhages. These are called the petechial hemorrhages, which is also called as, which is also known as the tardive spots, which is also known as the tardive spots. Remember here, Whenever there will be cyanosis, congestion and petechial hemorrhages, 100% we can understand this is a case of asphyxial death. Okay, whenever there will be asphyxial death, bluish discoloration, cyanosis, congestion and tardive spots can be there. Now let's start with the hanging. Hanging, where first of all we have to know about, see, like on the basis of knotting, like when I'm going to see here, like है ना, ये जो rope है, ये जो दिख रहा है ना, this is called as a knot. This is called as a knot, right? No, so wherever, like if a person will be hanged, no, whenever there will be, say, wherever there will be the knotting, see, ligature mark will not be there, because see here, so like this kind of ligature mark, no, like here, see, at the place of knotting, this point will be loose. So here there will be no ligature mark, Now remember here, suppose if the, like see, the knotting is exactly at the back, over the center. Okay, this is called the typical hanging. Basically over occiput. This is called the typical hanging. Ligature, see here, ligature material will be applied around the chin, also submental. See, remember here, apart from occiput, anywhere else, if ligature, see, if suture, like suppose if knotting will be there, no, then it will be called as what? Atypical hanging. These two are examples of atypical hanging. Remember here, so on the basis of knotting, there are two types of hanging. Typical hanging, atypical hanging. Typical, atypical. Exactly over the back, nape of the neck, occiput, usko bolenge typical. But angle of jaw, submental, these are the examples of what? Atypical. Remember, judicial hanging. Judicial hanging will have this one, angle of jaw. So knot will be placed over the angle of mandible. But most effective is submental. Submental is most effective. Oh. Now on the basis of suspension, see, when entire body is suspended in air, this is called the complete hanging. Complete hanging. When any part of the body is going to touch the ground, it is called a partial hanging. Now, so whenever there will be suspension, there should be force of constriction. No, overall there should be force of constriction, right? When entire body is suspended in air, now see a force of the constriction will be body weight. Okay, but when any part of the body is going to touch the ground, now force of the constriction will be head weight. Weight of head. Okay, weight of head. Now the question is that whenever there will be, see, complete hanging, what will be the cause of death? Asphyxia, respiratory blockage. But remember here, when any part of the body is going to touch the ground, now head will come down. So because of the weight of the head, now there will be constriction here. So there will be obstruction of the blood vessels here. So here most common cause of death will be what? Ischemia. Lack of blood supply to the brain. But overall, what is the cause of death? Ischemia with asphyxia. Okay. Remember, all these points are important. Now the question is that suppose if you are going to hang someone, and if ligature, see here, suppose if rope is like this, yahan pe hai rope, and suppose if rope is like this, right, like this. Okay, see, now you tell me, see, in this condition, do you think there can be the dribbling of saliva? Answer me yes or no. So do you think there can be dribbling of saliva? See, rope is here. So do you think there will be dribbling of saliva? Yes. Why? Reason is what? So there will be pressure over the floor of mouth. Do you think there can be, see, why there will be the dribbling of saliva? Why? See, because in this, see here, no, because in this condition, there will be irritation of salivary glands. That means there will be irritation of salivary glands, right? Because of that, there will be dribbling of saliva. See, do you think there can be the protrusion of tongue? Yes, there will be protrusion of tongue because of the pressure over floor of mouth. Remember here, the question is, when I talk about dribbling of saliva, this is because of irritation of salivary gland. Irritation of salivary glands. And please write down, dribbling of saliva is the most pathognomic what? Antemortem sign. See, the dribbling of saliva is what? anti-mortem sign. Most important anti-mortem sign when person was right, when he was alive. Remember here in hanging, see here, so like minimum it will be taking how much time? See 3 to 5 minutes. So when he was alive, there was irritation of the salivary glands. Because of that only saliva came out. So dribbling of saliva is what? Anti-mortem sign. Most important anti-mortem sign. And if ligature, see here, if not will be placed over lateral part here. So because of the compression of cervical sympathetic chain, see, because of the compression of cervical sympathetic chain, same side eye will be open and the tongue will be coming out. This is called as what? Lymphashi-sympathetic. Lymphashi-sympathetic. Please remember, lymphashi-sympathetic and dribbling of saliva, both are anti-mortem sign. Both are anti-mortem sign. Now, you look at, see here. See, now you look at this photo and now you tell me where a knot was placed. Over the occiput, so below the chin, or over angle of jaw? Bolo. Look at this photo and tell me where a knot was placed. Where a knot was placed? Angle of jaw, occiput or submental? See, देखो जहां पे knot होगा, where there will be knot, so there will be no ligature mark. There will be no ligature mark, right? So here, okay, no ligature mark will be there. मतलब basically क्या है कि ligature mark will not be there. Simple logic है, right? Okay, now you tell me, see here, repeatedly asked question on the basis of ligature mark, you have to diagnose the case. Okay, so now you tell me, suppose if I am going to hang someone like this, देखो, इसमें ये wire है, this is the rope here. Okay, suppose if I am going to hang someone like this, अगर ये ऊपर की तरफ जा रहा है यहाँ पे, so here knot will be over the occiput. Now you tell me ligature mark will be over suprathyroid or infrathyroid? देखो, suprathyroid. Now you see here, so ligature mark will be oblique or this will be transverse? Oblique, right? And this will be complete or incomplete? This will be incomplete. So in hanging, ligature mark will be IOS, incomplete, oblique and suprathyroid. Okay, suprathyroid, very easy to understand. And so even in the examination room, if you are not able to recall all these all these ligature marks, so you can ask for the wire from the examiner, and after that you can try it there. So that time they can understand, okay, paper is very difficult, है ना? तो be careful, right? मतलब overall समझ में आ जाएगा ना? जो overall समझ में आ जाएगा, right now, कि how in hanging, see here, so rope or the ligature material will be placed. On the basis of ligature mark only you can diagnose the case, right? Okay. But if someone is standing at my back, right? And suppose if he is going to ligate my neck like this, and कोई पीछे से खड़ा है, तो now you see here, now the ligature mark will be suprathyroid or infrathyroid. देखो, see, this will be infrathyroid. So this will be oblique or this will be transverse? Yes. मतलब क्या horizontal है या transverse है? If someone is going to ligate my neck from the back side, he will not be taking any chance, no? He will be ligating completely, right? And so what are the ligature marks we are going to see here? ITC, infrathyroid, T for transverse or horizontal, and C for complete. ये याद रखना बस. This is more than enough. Okay? Now, you see, now you look at picture number 1 and picture number 2. So can you tell me picture number 1 is, ligature strangulation or hanging? Bolo. Answer. Picture number 1. See, this is going actually what? Obliquely, right? Now, obliquely it is going, no? Obliquely. Right now, so this is a case of hanging only. Yes, very good, very good. But what about picture number 2? Bolo, what about picture number 2? Now very easily, see, देखो, now it's very, very easy. On the basis of ligature mark only you can tell कि this was the case of hanging case or hanging case था या फिर ligature strangulation था, right? Very good. Okay, now you tell me picture number one is a case of typical hanging or atypical hanging बोलो. Say typical hanging or atypical hanging. See देखो not is placed here. See देखो यहाँ पे actually है ना, there is no ligature mark here ना, there is no ligature mark here, right? So this is a case of what? Atypical hanging, right? Atypical hanging, right? Okay. Now do you understand here? So remember here, when I talk about hanging, IOS. When I talk about strangulation, there will be ITC. Now, see here, how to differentiate the typical hanging and partial hanging. Remember, a typical complete hanging में same होगा IOS, fine. But remember, partial hanging means the head will come down and ligature material will come down. Okay, so now ligature mark will be below thyroid cartilage, and this will be the transverse but incomplete. Remember like this. Okay, remember like this. Okay, very, very important. Now, see, when a group of people is going to hang someone, it is called as a lynching, mob lynching, right? Now, mob lynching. When a group of people is going to hang someone, okay, judicial hanging, remember here. See, what is this means? As per the law, See, judicial hanging means what? Remember here there is the rule कि length of rope from the point of suspension should be equal to height of the person. Okay, and after that, when the wooden plank will be released, after that, when he will be falling down, no, at that time, see what will happen? Now knot will be here. Suddenly there will be jerky movement, and after that there will be pressure over C2 and C3 vertebra. So there will be fracture of vertebra there, right? Now, so here mostly there will be fracture of C2 vertebra. So that's why, see here, so that's why fracture of C2 vertebra is also called as hangman fracture. Examiner can give you this kind of X-ray also, and there will be fracture over C2 vertebra, and then they can ask you where a knot was placed in this case. Where a knot was placed. So knot was placed over angle of jaw. And now see here, this is what? This is a manual strangulation, which is also called as the throttling. Which type of bruise we are going to see here? Can you answer me? Which type of bruise? Yes, Dr. Danish. Yes. Boliye, danger Danish. 6 penny bruises, right? 6 penny bruises, right? 6 penny bruises. Very good, very good. Now tell me, signs of a struggle will be more in hanging or strangulation? Strangulation, right? Okay. Now you look at picture number 1. Picture number 1 बताओ क्या है ये? This is hanging or ligature strangulation. Picture number 1 is what? Okay, this is a case of hanging. ठीक है. Why? Because oblique जा रहा है, oblique. Now this is a case of the typical hanging or atypical hanging. Can you answer me? Typical or atypical बोलो. Typical or atypical बोलो. Yes, see here actually there is no ligature mark, no, at the back over the occiput. So this was the case of typical hanging. Okay, now you look at picture number 2. Now you tell me what is the diagnosis here? Picture number 2. See, you can see multiple, like you can see multiple clots here now. Like, so bruises, 6 penny bruises. So picture number 2 is what? Manual strangulation. What about picture number 3? Can you answer me this one? What about picture number 3? Yes. है ना, कैसा ligature mark कैसा? बिल्कुल transverse. So this is a case of what? Ligature strangulation. Okay, so this you should not be forgetting. Okay, this you should not be forgetting. Remember here, hanging में IOS, like incomplete oblique suprathyroid. Ligature strangulation में ITC. Okay, see, like infrathyroid, transverse and complete. These ligature marks you are not going to forget. Now see some other methods of strangulation. When a rope will be thrown from the back side and after that neck will be ligated. This will be called as garroting. Okay, पीछे से रस्सी फेंक करके गला दबा करके मारना. Right, that is called as garroting. A type of garroting where iron collar rod is applied. Iron collar rod is applied around the neck. After that, they are going to fix the screw here. Right now, this is called as what? Spanish windlass. Spanish windlass. Remember, this is called a what? A Spanish windlass. Please remember, Spanish windlass is a type of garroting only. Spanish windlass is a type of garroting only, right? Garroting only. When two bamboo sticks or two rods will be applied around the neck. After that, if you are going to strangulate the neck, and it is called as baas dola. Baas is a Hindi word of bamboo. So if you are going to apply two bamboo sticks, baas dola. If you want to kill someone under the bend of your elbow, that is called as mugging. Mugging. Remember, all these are one-liner questions. Very easy to understand. Okay. See here now. Hyoid bone fracture can be seen in hanging also, strangulation also. But see, like in a manual strangulation, when you are going to like strangulate like this, right? So fracture will go inside, fracture of bone will go inside, right? No, like this. So this is called as adduction fracture. Adduction fracture or inward compression in manual strangulation. But see, from the hanging side, and so one side pressure, now the second side can go opposite side, outward. Outward means going away. So it is called as abduction fracture. Abduction fracture. Remember here, in strangulation, there will be adduction fracture of hyoid bone. And in, see here, in hanging, there will be abduction fracture. Abduction fracture. In hanging, yes, there will be a rupture of what? So like even the thyroid cartilage also, right? Even the thyroid cartilage also, right? Yes, Dr. Ali, Dr. Keshav, chalo. Oh, yes. How are you people? एकदम बढ़िया. चलो आजमी वालों सब हो यहाँ पे. चलो, very good. I'm good to, yes. Okay, good to see you people. चलो ठीक है. Let's continue with the subject. See here, in hanging, there will be rupture of the thyroid cartilage also. My question is that, see here, question is that signs of a struggle will be more in hanging or strangulation? Obviously in strangulation. Okay, but now the question is that if you are going to ligate here, okay, ligate here, are you going to see dribbling of saliva? See, देखो यहाँ पे ligature strangulation है. Are you going to see dribbling of saliva? No, because इसमें क्या है? Because there is what? No irritation of salivary glands. But yes, see, yes, signs of a struggle will be more. So now, see, now the blood will be coming out from the mouth. Okay, remember like this. Now, suffocation death. If you are going to block outer respiratory part here, mouth and nose, it will be called as what? Smothering. 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 If internal respiratory passages will be blocked, remember here, if it is accidental, and this can be homicidal also. Homicidal also. Yes. Remember here, this is called as smothering. Smothering. You are going to keep your palm or pillow over the mouth and nose. Okay. But remember here, accidental blockage of inspiratory, see here, like internal respiratory passages because of bone, fish bone and coin. But homicidal, if a person is going to push paper roll or cloth inside the mouth, right? That is called as gagging. Now, very heavy object is there over the chest, like in a building collapse, in a case of, like in a case of road traffic accident, railway accident, when 100 kilo is there over the chest. So do you think there can be obstruction? There can be, like, after that there can be difficulty in breathing, right? A mechanical obstruction hoga na. Yes, this can be seen in a case of road traffic accident, in a case of railway accident, in a case of stampede, right now? Okay, see here, now when there is what, so this is called what, asphyxia due to trauma. You can say this is called a traumatic asphyxia. Now see, when there is a heavy object over the chest, do you think there can be obstruction of the blood supply to the facial part? Yes. So here, just upper part of the shoulder, here there can be bluish discoloration, face पे bluish discoloration, है ना, something like a mask of ecchymotic sign, है ना. This is called as ecchymotic sign. This is called as ecchymotic sign. Okay, ecchymotic sign. Okay, remember this kind of, see, देखो bluish discoloration around the face, shoulder पे है, ecchymotic sign. Now there is the combination of, smothering and asphyxia due to trauma. This is the combination. Last time this was the question. Burking method. Burke and Hare, these two were friends. So whenever they wanted to kill anyone, see here, so whenever they wanted to kill someone, so they used to invite them, okay, and after that they used to offer the alcohol, victim ko alcohol, and after intoxicating them, now Burke, he used to sit on the chest, he used to close mouth and nose, and now Hare used to hold his leg, he used to pull him, he used to drag him around the room till the time he used to die. This is called as Burking method of killing. Burking method of killing someone. Burking. Okay, this is the combination of a smothering and asphyxia due to trauma. Asphyxia due to trauma, right? Smothering and asphyxia due to trauma, right? Very, very easy to understand. So can you tell me, suppose if I am going to throw a rope from the behind, after that I am going to ligate the neck. It is called as garroting. Okay, suppose if I am using iron collar rod around the neck, इसको क्या बोलेंगे? Spanish windlass. Spanish windlass, right? Suppose if I'm using up to two sticks here, baas dola. Under the bend of elbow, if I'm going to kill someone, mugging. Okay. Now, आसमान से गिरा, टायर में अटका. See, yeah, when a person will be like, when a person will get stuck here, no. Now, because of his position, his neck will be like this and there will be asphyxia. So, because of the position, if a person is getting asphyxia, it is called as positional asphyxia. See, it is suggested that mother should not be sleeping with a newborn baby. Newborn baby. Why? Say, some mother can over rely on the baby and baby can die. Okay. No, baby can die out of suffocation. It is called as overlying. In a cafe, if a person was enjoying his lunch food with alcohol, in a cafe, like in a afternoon, if a person was enjoying his lunch with alcohol, after that what happened? Suddenly a bolus of food got obstructed in the larynx, and because of that, suddenly there will be what, like whenever there will be a stimulation of laryngeal nerve ending, suddenly after that he will start having pain and he will fall on the ground, on the floor. Now what other people will be thinking? Heart attack. So coronary artery in a cafe, it is called a cafe coronary syndrome. And this is not heart attack. This mimics like heart attack. So cafe coronary syndrome. How to help? Which maneuver is this? This is called as Heimlich maneuver. This is called as Heimlich maneuver. Heimlich maneuver. From the back side, after that you are going to stuck here. And after that you are going to apply a pressure here. Right? This is called as Heimlich maneuver. Now, next very important topic, that is called the dry drowning. When water is actually entering the lungs and replacing this here, when water is actually entering the lungs and replacing air, it is called the typical drowning, typical or a wet drowning, wet. When water entered the airway, see at that time, see just because of the parasympathetic supply, what happened? See here, so just because of that there was a laryngospasm. And because of that, water could not enter the lungs, but still person died. So he died because of dry drowning. It is called as atypical drowning. When water is actually entering the lungs, it is called a typical drowning. When water is not entering the lungs, it is called the atypical. Simple logic hai. So how water can enter? Fresh water drowning, salt water drowning. Fresh water means river water, like from the Himalaya, a river is coming, that is fresh water. Salt water means ocean water, all right. So my question is that, see, white frothy discharge, froth, right, white froth.
See, what is this fraud? Why, what? See here, why it is coming out? Why white frothy discharge is coming out from the mouth? Remember here, when water is going to enter the lungs, see inside the pleural cavity, obviously there will be lung surfactants also, no? So can you tell me what, see here, what is the composition of lung surfactant? Bolo, phospholipids ka hai, right? Phospholipids, like, yes, surfactant, phospholipid hai na? L by S ratio should be more than 2. Lecithin is sphingomyelin, you would have learned in biochemistry. So when this, see, when ratio is more than 2, you will be having normal breathing. But when ratio is less than 2, then there will be ARDS, acute respiratory distress syndrome. So when water is going to mix with surfactant, and lipids are soap-like, after that, see, a white frothy discharge will be coming out. That is called, so remember here, see, frothy discharge will be seen in typical drowning, and only in those drowning where water is actually entering the lungs, right? So first of all, let's learn the cause of death in the typical drowning. See here, fresh water drowning and salt water drowning. Remember here, I hope you are able to recall this basic physiology. Basic physiology, see, like if a person is alive, in a normal person, how much salt content is there? 0.9%. Sodium chloride I am talking about, sodium chloride, okay? And fresh water will be having 0.45%. Salt water will have 3 to 4%, 3 to 4%. Okay. Basic physiology, all of you know that. See here, hypertonic fluid will attract hypotonic fluid. Okay, basic physiology is this. Hypertonic fluid will attract hypotonic fluid. So when a person was alive, he had what, 0.9% salt, but fresh water में 0.45% है. Okay, so now when I compare a normal person and fresh water drowning, which one is hypertonic? Normal person when he is alive. Now you see here, when water is entering the airway, after airway it is going to enter the lungs, and after that, see here, hypertonic fluid in systemic circulation will be attracting fresh water from the river. So now it is going to enter into systemic circulation, right? Systemic circulation, in your blood circulation across the body. So do you think now there will be hemodilution? Very good. Hannah, do you think there will be hemodilution? Yes, now there will be hemodilution. Now there will be hemodilution. Dilute ho gaya na blood. Okay, fine. Now whenever there will be hemodilution, do you think there can be hemolysis? Yes, now there will be hemolysis. Hemolysis means a breakdown of RBCs, and you have learned that whenever there will be breakdown of RBCs, now what will happen to potassium? Now what will happen to potassium? Now there will be more and more release of potassium in the blood. So it will be causing what? Hyperkalemia. Hyperkalemia, which can cause ventricular fibrillation. This much point is clear to everyone? Because of, see, so much fluid in the lungs and heart. See, in the lungs and heart. So do you think there will be, see, the cardiac overload also? And because of this, there will be overload in heart, no? Overload hoga. Basically, cardiac overload and ventricular fibrillation, both are responsible for which type of death? So what will be the cause of death in fresh water? See, the cardiac arrest. Say cardiac arrest. Okay? So the cause of death will be cardiac arrest. This much point is clear to everyone? Cardiac arrest. What about salt water drowning? When I compare these two, which one is hypertonic? Ocean water is hypertonic. So hypertonic attracts hypotonic. When water is going to enter the airway, from airway it is going to enter the lungs. Now see here, in the lungs, there is what? Hypertonic water. Hypertonic water hai na? So this will be attracting hypotonic from the systemic circulation also, from your blood circulation. Now it is going to attract more and more fluid in the lungs. It is going to attract more and more fluids in the lungs. Do you think now there will be severe pulmonary edema? Yes. Now it will be causing what? Severe pulmonary edema. What will be the first cause of death? Respiratory failure. Respiratory failure. See, yeah, first cause of death is what? Respiratory failure. But remember here, when water is there, like overall, whenever there is so much accumulation of water in the lungs, so that will be affecting heart also, na? So cardiac overload will also be there. So remember here, overall, what is the cause of death? Respiratory failure and cardiac arrest. Suppose if examiner is going to ask you one question, only one. So first most important root cause is respiratory failure. After that, but overall respiratory failure with cardiac arrest. Okay, both. Salt water drowning. So pathophysiology we have learned. Now the question is that suppose if we get a dead body from, like from the drowning, after the drowning, if we get a dead body. Okay. Now, so do you think like we can easily understand that dead body was recovered from fresh water or salt water? Do you think so? Yes. For that we have a test. This is called as a Gettler's test. Gettler's test. Now let's learn here. Please highlight this test. Gettler's test is extremely important topic. Gettler's test. Remember here. See, dekho. Now when a person is alive, normal person, how much salt? 0.9%. Here 0.45%. Here how much? 3 to 4%. Hypertonic. Now we have learned one more pathophysiology, that there will be movement of solutes from matlab ye sodium chloride, movement of solutes from high concentration to lower concentration, hai na? Higher concentration to lower concentration. This we have learned, right? Okay, fine. Now when I compare fresh water and normal person, so can you tell me which one is having higher concentration? Normal person when he was alive. And fresh water is having how much salt? Less. So when a person will be thrown in, a river, now you tell me there will be a movement of water from human to river or river to human. Higher to lower jayega na? Higher to lower jayega. So obviously movement of water will be there from human body to river. Now if I do a test, yes, Dr. Shiva, chalo, I'm glad. Thank you. है ना? चलो fine. है ना? तो इसमें क्या human to river. Now the question is that, see here, now if I do blood test, if I want to check sodium chloride, if I do postmortem examination, especially in the heart chambers, so especially I would like to see the chloride content. Now you tell me, in that dead body, salt content will be lesser than normal or more than normal? Bolo, lesser than normal or more than normal? Salt from here to here when? So here it will be lesser than normal, right? Lesser than normal. Very easy to understand. But what about salt water drowning? Higher concentration to lower concentration. Here higher concentration is salt, no. So there will be movement from ocean water to human body. Okay. So ocean से human body में आ जाएगा. Now if I am going to check sodium chloride, the chloride content, now you tell me in this dead body from the ocean water drowning, it will be more than normal or lesser than normal? Bolo, see the chloride content, it will be more than normal. We keep a margin of 25%. Okay, see the 25% more or less, 25% more or less. Very easy to understand, right? So this is called as Gettler's test. On the basis of Gettler test, we can easily understand fresh water drowning or salt water drowning. Very, very important. Please remember Gettler's test. You cannot take a chance to forget this. Okay. Now there is one more, diatoms test. Diatoms is nothing but unicellular algae. These are very, very small in size, 60 micron. These are this much small that if a person is going to swallow the water, no, this can enter even into systemic circulation. Okay, even after 1 month of, even after 1 month of death, if a decomposed body was there, remember, decomposed body was there, if you are going to do bone marrow aspiration of femur, if you can identify the diatoms, so what does it mean? ड्राउनिंग केस था ये, ड्राउनिंग केस था. रिमेंबर हियर diatoms can enter into systemic circulation also, bone marrow also. So diatoms will be positive only in like a wet drowning, or in the case where water is actually entering the lungs, water is actually entering into the systemic circulation. Very easy to understand, right? Very easy to understand. Very good, very good. Okay, fine. And so diatoms test will be the sign of antemortem or postmortem. अब बता दो जल्दी से, antemortem or postmortem. Diatoms will be what? यानी कि when he was struggling, when he was actually struggling, right? At that time when he swallowed some water, right? So antemortem sign. Okay, white frothy discharge, antemortem. Even see here, so even if you see the cadaveric spasm, antemortem. Very easy to understand, right? What is the surest sign of antemortem drowning? What is the surest sign of antemortem drowning? Water in stomach. Water in stomach and small intestine. Okay, yes, see here, water in stomach or intestine, it means yes, he was alive when he swallowed the water. Very easy to understand. देखो diatoms क्या है ना, diatoms will be resistant to so many things, so like it will not be decomposed easily. If you get diatoms in the blood circulation, 100% this was the case of drowning. Diatoms and Gettler test you cannot forget. So can you tell me what is the cause of death in freshwater drowning? Cardiac arrest. What is the first cause of death in salt water drowning? Respiratory failure. But overall, respiratory failure with cardiac arrest. Okay. What was the cause of death in electric injury? Bolo electric injury mein cause of death. See, electric injury mein cardiac arrest, right? Cardiac arrest. Very good, very good. We have learned all these. Okay. Now, whenever there will be the drowning case, know how to help. See, the drowning case may, what is the importance here? See here, whenever there will be the drowning case, so overall, what is the cause of death? Asphyxia. Means there will be difficulty in breathing in and out. So what is the first thing? You have to start doing CPR. CPR. So what is the like main line of management? Ventilation. Ventilation. CPR. Okay, CPR. Shift the patient to hospital, and after that you have to do what? Intubation. Mechanical intubation is needed. Intubation is needed, because you have to give mechanical support. Mechanical support देना पड़ेगा, है ना? Mechanical support. Okay. After that, remove the wet cloth. You have to keep the person fully dry. My question is that why to remove wet cloth? Can you answer me? Why to remove wet cloth? Why to remove wet cloth? Bolo. See, because wet cloth, no, low temperature hoga, right? No, right? So hypothermia will be causing what? Vasoconstriction. Hypothermia will be causing vasoconstriction. After that, more and more there will be formation of urine. So diuresis will be there. Diuresis, right now, and more fluid loss will be. And more and more fluid loss will be there. So patient can die because of what? Hypovolemic shock. Hypovolemic shock. More and more loss of fluid from the body, right? Very easy to understand, right? Okay. After that, symptomatic treatment. And a symptomatic treatment, right? Okay. Now atypical drowning. Obviously, so when water is not at all entering the body, when water is not at all entering the body, it is called as dry drowning. The cause of death यहाँ पे क्या हो जाएगा? Laryngospasm. But immersion syndrome, if a person will be thrown in cold water, when a person will be thrown in cold water, so cold water can enter the body through ear, nose and mouth, okay, and it can touch the laryngeal nerve endings of vagus nerve. So remember here, see, this is also called a cold water drowning, also called as hydrocution. See, injury because of electric current was electrocution. Injury because of water, cold water, is called as hydrocution. So whenever there will be sudden inhibition of a vagal nerve, vagal inhibition, suddenly I hope you are able to recall that vagus nerve is also supplying heart, lungs. And so sudden vagal inhibition, what will happen now? Sudden cardiac arrest. So what is the cause of death here? This is also what? Vagal inhibition. Vagal inhibition. Vagal inhibition. Very good. What about submersion of unconscious? Suppose, see, a submersion of unconscious before submersion in water. See here, before submersion in water. See, that person got, see, that person got unconscious. Like suppose if a person was walking near the swimming pool, he had a seizure, he fell in swimming pool. He had hypertension, he fell in swimming pool. Right now, he had myocardial infarction, he fell in swimming pool. If a person was having alcohol, like alcohol near, like near swimming pool, after intoxication, he fell in swimming pool. So all these are the examples of what? Submersion of unconscious. Submersion of unconscious. Near drowning, डूबते डूबते बचा, फिर secondary complication से मर गया. Okay, what does it mean? Near drowning. See, after drowning, a person was saved. After CPR, he got saved. But see here, no, when dirty water is going to enter the body, there can be secondary symptoms also, na? Right? No. Now, after 1 week, he had so many, like sepsis, and he died because of encephalopathy. Right? No. So this is because of what? Secondary complications. It is called as near drowning. It is called as near drowning, also called as secondary drowning syndrome, post immersion syndrome. I have given you the example of, see, 2 examples of typical drowning: fresh water, salt water. 4 examples of atypical drowning: dry drowning, immersion syndrome, submersion of unconscious, and what? Near drowning. Very, very important. Last time, INICET question they have asked, what is the cause of death in hydrocution or like immersion syndrome? Very, very important. Okay, chalo fine. We have learned all these. Theek hai. Now see here. Now see this question and now you rule out. See, this kind of question I anticipate. This kind of question. Very good, Dr. Arfad, Dr. Rayan, Dr. Brad, Dr. Akshara. Yes, very good. All of you are doing great. Dr. Muhammad. Okay. Dr. Hashim Pasha. Yes, all of you are doing great. Chalo. Bolo. See this question and try to answer. Anti-mortem signs I'm asking you. Okay. Out of these 7, see fraud, yes. Anti-mortem. See the cadaveric spasm, yes. See the diatoms in bone marrow, yes. These are. But all these we are going to learn. These are post-mortem sign of drowning. So answer क्या हो जाएगा यहाँ पे? Answer will be C. Answer will be C here. Okay. Now what are the post-mortem sign? See देखो. See post-mortem sign when hand will be in water for longer duration. Yes, it will be like this. This is called as a washerwoman's hand. Washerwoman's hand. Sometimes they can show you the photo of these feet also. है ना? ये same ये washerwoman's है. See here, even there can be the piloerection, and like here you can see the skin is like the puckered skin. This is called as goose-like skin. Goose-like skin. This is also called as cutis anserine. Cutis anserine. Or goose-like skin. Remember here, these are post-mortem signs. Post-mortem signs. Goose-like skin, cutis anserine. Okay. Now see here, what are the other signs? Now see here, the dirty water is going to enter the lungs also. And lungs also. So do you think it can rupture the pleural membrane here? So do you think over the lungs you can see like red spots, hemorrhages you can see? Yes. है ना? तो उसको क्या बोलेंगे बताओ? See, that will be called as the Paltov's hemorrhage. Okay, that will be called as, see, the Paltov's hemorrhage. Hemorrhage means like a small petechial signs over the lungs parenchyma. Okay, Paltov's hemorrhage. Okay, remember here, even there can be what? See here, Paltov's hemorrhage. Even there can be so much accumulation of water in the lungs. So now see here, now if you are going to do postmortem examination, if you remove the sternum, now lungs will be coming out like a balloon. है ना? So that is, see, this is called as ballooning of lungs. This is called as ballooning of lungs. Lungs will be coming out like a balloon. Ballooning of lungs. Even so much accumulation of water in the lungs. Okay, this is called as emphysema aquosum. Emphysema aquosum. Aqua in, like emphysema, you would have learned in respiratory pathology, right? Respiratory medicine, emphysema, obstructive lung disease. So emphysema is related to lungs. So aqua in emphysema, aqua in lungs, emphysema, aqua. So I'm telling you again and again, drowning is an important topic. Can you tell me what are the ligature marks we have seen in typical hanging? Please write down in chat box, all of you, please write down. What are the ligature marks we have seen in typical hanging? Bolo. IOS, right? IOS. IOS, right? Hana? Like incomplete oblique suprathyroid. And can you tell me what are the ligature marks we have seen? What are the ligature marks we have seen in ligature strangulation? Ligature strangulation batao. ITC, like infrathyroid, transverse and complete. Very good. Now see this question and try to answer. See this question and try to answer. Bolo. And so first of all, this is a case of what? Asphyxia. But out of these four, which one? 6 penny bruises here, no? So answer will be manual strangulation, or this will be called as the throttling. Now see this question. This was actually, I think a few years back, this was asked in FMG. I think this was the question in FMG August 2020. Bolo. Wrong statement related to this. Here you can do mistake. Remember here said this kind of questions are being framed, big questions, okay? See, first of all, we can rule out. See, see, a person was found dead in bushes with, okay, fine, with the tied arms and legs. So 100% homicidal hai na? Now on post-mortem examination, his face was deeply congested. Nails were blue. Nails were blue means 100% this was the case of asphyxia. Asphyxia. Now, hypostasis or liver mortis was fixed. How much duration, how much time is required for the fixation of liver mortis? 6 to 12 hours, right? 6 to 12 hours, okay. Was fixed on back. Rigor was seen all over the body. It takes 12 hours to appear and 12 hours to persist. So it was there all over the body. Okay, so it means the duration of death is within 24 hours from the post-mortem examination. Now, see here, abrasion and nail marks were marked on chin, face, nostrils, lips were lacerated. So this was the case of smothering, not the throttling. This was the case of a smothering, not the throttling, okay? So see, in this manner, questions are being framed. Now, human identification. So can you tell me what is the most reliable method of identification? Yes, fingerprinting. Fingerprinting is the most reliable method of identification. Fingerprinting. Okay. Remember here, see, fingerprinting is also called as a dactylography. Fingerprinting is also called as a dactylography. Okay. Where the first center of fingerprinting was established? Okay. This was established in Kolkata. Kolkata. And please remember, this is the most reliable criteria to diagnose. This is the most reliable criteria of identification, most reliable. This will be different even in identical twins, okay? So, and this is also called as a Galton's test. Means Sir Francis Galton, he discovered this, okay? Kiloscopy, study of lip printing. See here now, fingerprinting, no, under, see here, under the fingerprinting, yes, there will be what? Sweat pores. So a study of sweat pores is called as poroscopy. Poroscopy. Even hard palate, like a study of rouges, hard palate, study of rouges is called as rougoscopy. A study of hair is called as, a study of hair is called as See the trichology, right? Now trichology, study of hair, because at the murder spot, if you have found some hairs, so hair could belong to animal also, human also. So first of all, we have to differentiate animal or human, right? Okay. A study of footprinting is called the podography. Okay, podography. So where do we use a footprinting marks? Where do we use? Yes, see, at the murder scene, at the crime scene, if a person went there without wearing shoes, okay, you can get footprinting, right? Now, but remember here, especially in maternal hospital, why? See, just after the delivery, nurse will take the baby and nurse is going, okay, nurse will weigh the baby, and at the same time, she can take the footprint. And because in maternal hospital, in one day, there will be more than 50, 60 deliveries, so that there should be no exchange of babies. Okay, remember, see, okay, study of footprinting, right? Okay. Now you tell me, suppose if a dead body was found and the murderers, see, they disfigured a face also, they destroyed face also. Okay, now? So now police can ask, okay, get me old photo of this person. So remember here, photo of a skull and old photo will be matched. And a skull photo, old photo will be matched. If see all angles and all everything, right? So if this is going to get superimposed, 100% this was the same person. This is called as superimposition technique. Okay, last time this was FMG question. Superimposition technique. Now there is a word, please write down. This is called as corpus delicti. You should not forget this. Corpus delicti. This means essence of any crime. Say yes, so corpus delicti means what? Essence of crime. Essence of crime. What does it mean? What does it mean? See, body of crime, essence of crime. What does it mean? See here, like suppose from a building, if a police has received a phone call, sir, you please come here, a murder has happened here. When police is going to reach there, to reach that apartment, police can see that like there are like so much, so much blood and, shattered glasses, so broken windows. So basically all these are signifying that yes, there was a crime here. And matlab crime hua hai. So essence of crime, this is called a corpus delicti. Please do not forget this. This is called as corpus delicti. Corpus delicti. Okay. Remember it, very, very important. Now see here, what is the best bone? First of all, you answer me. What is the best bone to determine a race of a person? Race like American, European, Chinese, Indian. What is the best bone for this? Skull bone. Skull bone. What is the best bone to determine sex of a person? Hip bone or pelvic bone. Okay. What is the best bone to determine height or a stature of a person? Femur. And stature. Femur. Right? Femur. Very, very important. Okay. Race. So can you tell me the name of races at least? If name of races bata do. Name of races. Name of races. Okay. Please remember, one is called as Caucasoid. Right? European and Chinese. Second is called as a Mongoloid. Mongoloid race. See, especially Japanese and Asians. And third is called as Negroid. Third is called as Negroid. Negroid. Africans and Aryans. I hope you are able to recall that like once upon a time Aryans came to India. So remember here, European and Chinese, so they come in which category? Caucasoid. Japanese and most of the Asians, Mongoloids. But Africans and Aryans, right? Negroid race. Remember here, see like Indians are the mixture of Negroid and Caucasoid. See, Indians are, we are all mixed fruit juice, right? Because if you go to South India, if you go to North India, East India, West India, everywhere, see here, now the texture will be different, see the color will be different, right? Now hair quality will be different, right? Now everywhere it will be different. So we are mixture of what? Negroid and most of the features of Caucasoid. Okay, chalo, fine. These are three races just for the information. Now see here, what is the best bone? Overall, suppose if you are getting 100% skeleton, then 100% accuracy. If you are getting only pelvis, then 95% accuracy. Only a skull, 92%. See, pelvis and skull both you are getting, then 98%. Old question, repeatedly asked question, what is the best bone to determine the sex of a person? Sex of a person. Or, so during the construction of a building, when all laborers were digging out the earth, they found a skeleton. So to find out male or female, what is the best bone here? Best is pelvic bone. And inside the pelvic, what is the best parameter? Greater sciatic notch. What is this greater sciatic notch? See this red color here. No, see this red color. Okay. So this is a greater sciatic notch. Please remember, in a male, greater sciatic notch is narrow and deep. In a female, greater sciatic notch is wide and shallow. Now you look at picture number 1. You tell me this is a male or female. See, in male, it will be deep and narrow. Deep and narrow, greater sciatic notch. So picture number 1, you can say, okay, male. What about picture number 2? Wide and shallow. Very good. Kya hai? Female. What about picture number 3? So this is also somewhat wider only. So this will also be what? Female. Okay. Now let's learn here. See here, how to differentiate male and female. This will become your question in forensic. Now, who is big-hearted people, male or female? Who is considered as big-hearted people? Can you tell me? Bolo. Who is considered as big-hearted people, male or female? Fight kar lo sab log. Bolo. Yes, males are big-hearted people, right? Remember, males will have, see the pelvic inlet I am talking about, a pelvic inlet, heart-shaped pelvic inlet. But who is the mother of all these big-hearted people? Obviously female. Okay, now it is okay balanced. And the female mein pelvic inlet will be circular. Remember like this. Male will have heart-shaped pelvic inlet. If you see the bone here, no? See here, so male will be having heart-shaped pelvic inlet, but female will be having circular. See the pelvic cavity in male, yes, this will be funnel-shaped. But in female, this will be flat bowl shaped. Flat bowl. Why it is flat bowl shaped? See here, for easy delivery. After that, see, look at this angle. This is called as subpubic angle. Subpubic angle. See, if it is equal to or less than 90 degree, then it is male. But a female may subpubic angle will be equal to or more than 100 degree. More than 100 degree, then female. Please remember, very, very important. Remember here, one point you should know, say general formula. See here, all bony prominences, all muscle, all muscle tuberosities, all bony prominences will be more prominent in male than female. All bony prominences, all muscle tuberosities, everything will be more prominent in male than female, except 3. One is a frontal eminence. This one, frontal eminence. Second is the parietal eminence. And see the third is the preauricular sulcus. Preauricular sulcus. These are more prominent in females. So first is frontal eminence, after the parietal eminence, and then preauricular sulcus. These are more prominent in females. Remaining all are more prominent in males. Okay, yeah, but greater sciatic notch, deep and narrow, male, wide and shallow, female. On the basis of a skull bone, if you see the skull bone looks like very, smooth, beautifully made, beautifully crafted, samajho pakka female, if architecture is beautifully made, beautifully crafted, smooth, female, rough and tough, male. Hum log ka ubad khabad, no? Males ubad khabad pura. So remember here, if it looks like a rough male, but female may, this will be what? Well crafted. After the frontal eminence, parietal eminence will be more, see here, this will be more prominent among females. Okay. And after that, see, like, just my forehead, dekho forehead. See, in male, forehead will be having one angle. Male में forehead will be having, see, yeah, steeper forehead, but female में straight, vertical. See here, when I talk about, see, frontonasal junction, here we are having one angle. I can keep a pen also here, right? See, like this. So male will be having one angle here at the frontonasal junction, right? But female will be having a straight like this. If you do not have like this, don't think that you are defected piece. Okay, everything is fine now. है ना, हो गया, पैदाइशी होगी सबकी, right? Remember like that. तो ये सब कितना है basically. Now how examiner will be asking you some question, okay, they will give you some pictures of bones, or they can ask you some bones were found while digging the earth. Okay, subpubic angle in the pelvic bone was 88 degree. Can you tell me, male or female? 88 degree. 88 degree equal to or less than 90 degree, male. है ना, male. Very easy to understand. If they ask you कि greater sciatic notch was wide and shallow, then okay, simple logic, please keep in mind. Now, suppose if you are getting a dead fetus in a forest, length of that dead fetus was actually 25 centimeter. How to calculate the age? We are having two rules to calculate gestational age of fetus. One is called as a rule of Hasse. So starting first month ke liye rule of Hasse. Like, so here a square root of CHL. What is CHL? This is the crown to heel length. A square root. Are you able to recall how to calculate a square root? Mathematics thoda baki hai? Okay, fine. So can you tell me how much is the square root of 100? Bolo. How much is the square root of 100? Okay, 10. How much is the square root of 81? 9. How much is the square root of 64? 8. Chalo, basic mathematics, you should know. See, doctors will have weak mathematics, no? Okay. Chalo, fine. And second is what? A rule of Morrison. Okay, remember here, this length you are supposed to divide by 5. Okay, so suppose if you have got the length actually 25 centimeter, no? So even if you are going to take out the square root of 25, it will be 5. Or even if you are going to divide by 5, answer will be 5. So answer will be 5 month. So please remember, rule of Hasse and rule of Morrison. Both are very, very important. Rule of Hasse, square root of CHL. Square root of CHL. Okay, CHL. Okay, chalo, very good. Now after that क्या है? Rule of Morrison. ये बताओ, sex determination is legally allowed or not? In India it is legally allowed? Yes or no? No, it is not allowed. Sex determination is not allowed. But if a doctor wants to check, suppose if a doctor wants to determine the sex, then what will happen? Say, by which age sex determination can be done? Bolo, after 4th month, है ना, 16th week by ultrasonography and physical examination, right? But it is illegal, right? It is illegal. Okay. Now, suppose if there is a young murderer in the court, young murderer hai, he appears to be like 16, 17 or 18. His advocate is fighting that my client is actually juvenile. And opponent say, no, he's adult. Why this fight is going on? He is juvenile or adult. Why? See, because see, age less than 18 years will be called as juvenile. So what is the first test to check whether he is a juvenile or adult? What is the first test, bolo? What is the first test? First test to be done is X-ray of wrist. X-ray of wrist. Okay, don't think that like first test is to write essay writing. है ना, Porsche case, BMW case था, essay writing से पता चला कि भाई juvenile or adult, हाँ? No. X-ray of wrist. Remember here you have to see ossification. Because different bones will be having different ossification age. Ossification means what? See, the process of bone formation. So suppose if there will be a complete bone formation, you can see on the X-ray. If you see the pisiformis, so pisiformis will be completed by the age of 9 year. But wrist here, most important. Say, look at ulnar ossification. If ulnar ossification is completed, then age of that person will be around 17 to 18 years. Still confusion? But if you see radial bone completion here, if radial bone is completely formed, no, now age of that person will be at minimum 18 to 19. Complete ossification of, radial part here will be happening only after 18. So if you can see complete, like complete radial bone formation here, 100% he is adult. 100% he is adult. Ischial tuberosity here. Ischial tuberosity. See, here ossification will be completed for more than 20 to 23 years. 22 to 23 years. This bone, this ischial tuberosity is going to decide for how many hours you can sit in a class continuously, right? So remember here, you have to do X-ray of wrist. Very, very important. Now, age estimation from the dental part. Okay, dentition, which is very, very important topic. Dental. Okay, dental part. Here, many students will be having so much confusion. I will make it very simple for you. Dekho, dentition. We are going to learn about dentition now. First of all, please remember there are two types of dentition. There are two types of dentition. One is known as the primary dentition. Another is known as secondary dentition. See, the primary dentition is also called as the temporary dentition. Say temporary. Okay. This is also called as milk teeth. This is also called as milk teeth. This is also known as a deciduous teeth. What is the meaning of deciduous forest? See, in Russia, in Kyrgyzstan, Kazakhstan, like the forest will be there, like in in winter, during a snowfall, all leaves will be falling, and during autumn, all leaves will be coming back, right now? So that's why it is called about deciduous forest. Hai na? So in the same manner, the teeth, the primary dentition, these are supposed to fall and supposed to be replaced by the permanent dentition. That's why deciduous teeth. Okay, but secondary dentition, this is known as the permanent. Secondary is called as the permanent. Okay, permanent. What is the first temporary tooth to get erupted? Lower central incisor. Lower central incisor. What is the first permanent tooth to get erupted? Molar number 1. Molar number 1. By which age first temporary tooth is erupting? 6 months. By which age first primary tooth is completed? By the age of 6 years. So what is the formula for temporary dentition? 2, 1, 2. 5 into 4. In total, this will be 20. But what about secondary dentition? 2, 1, 2, and 3. Okay. 8 into 4. 8 into 4. This will be equal to 32. Please write down, in temporary dentition, there is no premolar. There is no premolar. Please remember, there is no premolar in temporary dentition. Okay, this much point is clear to everyone. First temporary tooth to erupt is lower central incisor. One question you can be expecting from is a dentition set. Okay, so first tooth to erupt is lower central incisor. After that, upper central incisor. Then upper lateral incisor. Then lower lateral incisor. So by which age they are erupting? By the age of 6 months. Upper central 7 months. Upper lateral 8 months. Lower lateral 9 months. Simple logic hai. 6, 7, 8, 9, right? 6, 7, 8, 9. One more mnemonic you should be knowing. I am Chief Minister. Okay. This is central incisor. This is molar number 1. C for canine and M to molar number 2. This will be, see, 6 months. Molar number 1 by the age of 12 months. Canine 18 months. And molar number 2 by 24 months. By 24 months. Please remember like this. So see here, I have taught you here all the primary dentition, age and eruption, very, very important, very, very important. Now, how to memorize the age of eruption of the permanent tooth? For this, we should know very commonly used mnemonic. Mom is in pain. Mom is in pain, and Papa can make medicine. Papa can make medicine. Very commonly used mnemonic. Mom is in pain, Papa can make medicine. Please write down. M is what? Molar number 1. This is molar number 1. This is central incisor. This is lateral incisor. This is the premolar number 1. This is premolar number 2. This is canine. This is molar number 2. This is molar number 3. How to memorize it? 6 year, 7 year, 8 year, 9 year. Say 10 year, 11 year, and 12 year. Molar number 3 by the age of 17 to 25. Molar number 3, this is the last tooth to erupt. Okay, it is called as wisdom tooth. Right, it is called as wisdom tooth. This much point is clear to everyone right now. Very easy to understand. See, remember the mnemonic. Mom is in pain, Papa can make medicine. They can ask you when the permanent molar will be erupting. Molar number 1 will, है ना? So when permanent molar number 1, okay, see here 6 year में है ना? So when first see permanent actually central incisor by 7 year. Very easy to understand. So 6, 7, 8, 9, 6, 7, 8, 9, 10, 11, 12. After that last tooth, 17 to 25. Now, there will be a period of mixed dentition also. In between 6 to 11 year. 6 to 11 year. See here, and total number of teeth will be 24. In this age, there will be primary dentition also. There will be what? There will be permanent dentition also. दोनों रहेंगे साथ में. ठीक है ना? Mixed dentition. So they are asking question. How to calculate total number of permanent teeth? Age minus 5 multiplied by 4. Suppose if there will be a 9-year-old boy. So can you tell me in 9-year-old boy, how many permanent teeth will be there? How many temporary? See here. So 9 minus 5 multiplied by 4 equal to 16. 16 permanent and remaining 8 will be temporary. So can you tell me in a 10-year-old boy, how many permanent teeth? How many temporary? Can you write down? All of you bolo, jaldi bolo. Bolo. Yes, see, age minus 5 multiplied by 4. So remember here. So here कितना हो जाएगा? See, there will be the 20 permanent and remaining 4 will be the temporary. Okay, very easy to understand. Can you answer me? In a 8-year-old boy, how many permanent and how many temporary teeth will be there? Can you answer me? Bolo. एट ईयर में बोलो, 8 year में. Yes, 8 minus 5. So there will be, yes, so there will be the true. Yes, there will be 12 permanent and 12. Yes, there will be 12 permanent and 12 there will be temporary dentition. Very easy to understand. Period of mixed dentition you should not be forgetting. Okay. And now, see here, what is the name of the test on the basis of which we can estimate the age? Please write down. This is called as Gustafson's test. Gustafson's test. Gustafson's test. For adult, Gustafson's test. Okay. See here, as per the age, there will be resorption of teeth. Hai na? So remember here. See here, if you can see the root transparency. This is the most reliable method. And second most reliable is, say, deposition of secondary dentin. Okay, just remember the name, Gustafson's test. Say Gustafson's test. This we are using to check to assess the age. Okay, where we have learned about Gettler's test, Gettler's test. Okay, in the drowning, right? In the drowning. Galton's test. Dactylography. Very good. Okay, dactylography. Now remember here, by which age, by which intrauterine life? See here, so fingerprinting will start by the age of, see by the age of, yes, see the 12th, yes, very good, very good. All of you are doing great. And by the 12th week, and this will be complete, fingerprinting will be completed by 24th week, right? Very good, very good. So can you tell me what was the cause of death? Can you tell me what was the cause of death in freshwater drowning? Can you answer me? Freshwater drowning bolo. Okay, cardiac arrest, है? Cardiac arrest. अच्छा ये बताओ ये कहाँ पढ़ा था हम लोग? Where we have learned about Marshall's triad. Where we have learned about Marshall's triad. बताना Marshall's triad कहाँ था? Bomb blast injury में. Which bomb blast injury? See primary, secondary, tertiary or quaternary? Secondary में, right? Very good. Abrasion, bruise, laceration, right? Very good. अच्छा बताओ tissue injuries can be seen. Tissue injuries can be, see the tissue bridge can be seen in laceration or sharp cut. Laceration, okay? Laceration, very good. ठीक है, काफी है. This is more than enough to understand, right? ठीक है, बताना जरा formation of two triangles in the eyes. Formation of two triangles क्या था? At the two corner. Okay, that is called as what? Tachynoia sclerotica. Can you tell me what is, say here, a period between somatic death and molecular death is called as supravital period, right? Supravital period, right? Very good. Chalo, very good. Supravital period. Okay. McNaughton's rule, which BNS? Okay, 22. अच्छा वो क्या था? Rate of decomposition in air, water and soil 1:2:8. So what was the name of that test? So the Casper's dictum, है ना? Casper's dictum, where we have learned about where we have learned about the corpus delicti. बोलो corpus delicti. अभी essence of crime, है ना? Essence of crime. Very good. Essence of crime, है ना? Okay, all right. ठीक है, चलो fine. अच्छा बताओ. See, artificial preservation of dead body is called as what? Artificial preservation of dead body is called as what? Embalming, है ना? Embalming, which is also called as the thanatopraxia. Embalming, thanatopraxia. ये बताओ, out of adipocere formation and mummification, where can we see foul smell? Adipocere formation or mummification. Foul smell कहाँ पे आएगा? Adipocere formation. What are the other names of adipocere formation? Saponification, grave wax. Okay. Where we are going to see weight loss. Weight loss बताओ. Weight loss किस में आएगा? Mummification में. Mummification will be having foul smell, yes or no? No, obviously no. Odorless, right? Odorless. Very good. Chalo, काफी है. Yes, you are able to recall everything. Very good. Chalo, I'm glad. Okay, fine. So देखो, now you have applied for the FMG exam. So you would have given your fingerprinting, right? No. So there, see there, like they are going to use a machine for the biometrics. No, biometrics. So basically, how many points of comparison are important? See that 10 to 12 points. See that 10 to 12 points of. है ना? See, if 10 to 12 points of, like all lines will be matched, it means you are the real person. Okay. Say here, remember, so when I talk about dactylography, remember, what are the shapes of fingerprinting? Loops, most common. After that, holes, and then arc, and then, see the composite. Most reliable method of identification. Different shape. See, if you see like this, and then arc. So this is called as what? Arc shape. But if you see, first of all, like a tent, like a tent. After that arc, this is called as the tent arch. See, this is like a loop. Loop is most common. And here, see, one loop is going up and one loop is going down. So this is called about double loop. Here, actually, after that, so this is called a packed loop, hole, right? Like this. And this is actually mixed. See, remember here, Yes, very good, Dr. Preeti. Yes, chalo, I'm glad. Okay, Dr. Hitesh, Dr. Neetu, all of you are doing great. Okay, chalo, fine. Dr. Shinan, yes, all right. Dr. MBBS, Dr. Aditya, sub. Okay, chalo, everyone is doing good. Now, the question is that in which condition, देखो, see here, see the fingerprinting will be same throughout the life, but in which condition fingerprinting can be changed? Remember, like radiation injury, L for leprosy, electric injury, G for skin grafting, है ना? G for skin grafting. Please remember here, radiation injury, leprosy, and electric injury, skin grafting. In all these, fingerprintings can be changed. Okay, fingerprintings can be changed. Remember it. Very, very important. Okay, chalo fine. Now DNA fingerprinting. ये बताओ, see DNA fingerprinting, how many of you are thinking that DNA will also be there, fingerprinting will also be there? Eh? No, it is not like that. Remember here, DNA fingerprinting means what? Only DNA test. Suppose like from the murder spot, we have got, like any kind of, like hair or blood or whatever. So with the help of see here, now we have extracted DNA, right? And after that, with the help of PCR machine, polymerase chain reaction, now we are going to make multiple copies of the DNA. Basically, fingerprinting of what DNA, multiple copies, right? No, so that like it could be possible that a police can arrest 4 people, 5 people, 10 people, है ना? So we have to make, right? So remember here, we have to make multiple copies. That is called as DNA fingerprinting. Okay, so DNA fingerprinting will be same in identical twins. It will be same in identical twins. Okay, identical twins. That's why, see, fingerprinting will be different even in identical twins. Keep in mind. All right. Now, see, from the crime scene, we have got this DNA. Now, tell me, so 2 people got arrested, A and B. So, see here. So, this is being matched with A or B. Yes, है ना? B से match करा, right? Very easy to understand. So remember here, DNA fingerprinting, okay? DNA fingerprinting. Now, see the tattoo marks. See here how we are going to visualize the faded tattoo, right? Remember here, by using the 3% hydrogen peroxide, we can also use infrared photography, UV lamp, magnifying glass, high contrast photography. These are simple. But what kind of question we can expect? Suppose after the murder, like if the murderer has removed the tattoo from here, and like he has removed the tattoo from here like this. After that, what is the last examination? See, remember here, what is the ink? What is the name of ink which we are using for this? This is called as Indian ink. Black ink, and black ink, Indian ink, which we are using for making tattoo. So see here, so like this will get deposited under the skin, and so remember here, so now this will be taken up by regional lymph nodes. So even if murderer has eradicated, even if he has removed the tattoo, now what we can do? We can do biopsy of regional lymph node. If lymph node will be having black ink, 100% there was a tattoo. So please remember this point. What is the last examination? What is the final examination to check if there was a tattoo? Lymph node biopsy. Now, see, blood stain test. First of all, like suppose if we have found like a drop of blood or any amount of blood from the crime scene. First of all, we have to check whether this blood belongs to human or animal. Human or animal. For this, we have to do serological test, especially see the precipitin test. But if we have found, like old blood stain, or like any kind of old fluid collection, any kind, so that appears to be like brown. But whether that is blood or not, that can be semen, that can be saliva, that can be pus discharge, anything it can be. So we have to check whether that sample is blood or not. वो blood है या नहीं है? Blood. Most important test is spectroscopy. After that, macro and micro. See here, you have to memorize the Takayama and Teekman test. Takayama and Teekman. See, in the Takayama test, you can see this kind of, you can see this. See, remember here, See, when I talk about the Takayama, no, see here you can see the pink feathery. See, देखो ये सब दिख रहा है ना? All these are what? See, pink feathery crystal of hemochromogen. Remember, see here, no, hemochromogen will be seen only in blood. So if we can find out, see the Takayama test is positive, 100% this was blood, 100% this was blood. If I can find out, see the brown crystals, see the brown crystals of hemine chloride. So this hemine is seen only in blood. So this is called a Takayama and Tieckmann test. Remember here, Takayama and Tieckmann test, very, very important test to identify the blood. Blood check करने के लिए, okay, blood. Macro में सीधे Castle-Meyer test and all, right? Remember, all these are important. Now, semen analysis. One is a Florence test, another is Barberio. Suppose if we are going to add, like, suppose if a fluid collection was done from the, like, murder scene. Okay, female dead body was there, but some other liquids were also there. So if we are going to mix with the picric acid, no. If this turned into brown color, Florence test. In Florence test, you will see brown color. So this brown color is because of, see, due to choline from the seminal vesicles. And Barberio's test, if you see yellow needle-shaped crystal, 100% semen hai. Remember here, Barberio, this is a Barberio. See, remember, you see the brown color, this is actually Barberio's test. Hai na? See, remember like this. Sorry, see here. Just a minute. Okay, see here. Now, if you can identify, see, whenever there will be, see, mnemonic is FB. FB is what? See, Florence test mein, there will be the brown color. There will be the brown color, rhombic crystal, brown color. Okay. But BY, see, Barberio's test, yellow needle shaped crystal. Yellow needle shaped crystal. See, this is Barberio. This is Barberio. See, remember FB, Florence में brown color, Florence brown color, Florence brown, but Barberio yellow, Barberio yellow needle crystal. See, remember here, Takayama, Tieckmann, there should be no confusion. Florence and Barberio's, there should be no confusion. Semen analysis. But how will you understand that whether this was, you know, this semen was belonging to human or animals? Remember here, Y bodies. Remember, Y bodies will seen only in humans, not in animals. Okay, fine. Next, now we are going to learn forensic toxicology. Very, very important chapter. Say here, forensic toxicology. Here we are going to learn about the poisoning now. All poisoning, minimum 2 to 3 questions you should be expecting from here, the toxicology. Okay, fine. Vitriolage means what? See, vitriolage means what? Acid attack on the face. Acid attack on the face, vitriolage, acid attack on the face. Sulfuric acid can be used, you know, sulfuric acid can be used, even potash, right now? Okay. So remember here vitriolage, obviously, see BNS number 124, first part. See, voluntarily causing grievous hurt. So there can be, see, the 10-year to lifetime jail. Second part here, see, voluntarily causing, or you can say what? Attempt to throw acid, 5 to 7 years in jail. And now, remember here, Bharatiya Nagrik Suraksha Samhita, section number 33. Whenever we get any case like the poisoning case, you know, like acid attack case, or if there will be any kind of, you know, like if there will be any kind of homicidal case, yes, we are supposed to inform the police. See, not informing the police is a punishable offense. This is a punishable offense. Okay. Now vitriolage. The question is that, see here, how the poisons are going to destroy your body. Okay. How it is going to affect inside your body. Please write down here. देखो समझते हैं पहले इसको. See here, see the poisons can be neurotoxic. See, the poisons can be neurotoxic. So I can say that this is the neuropoison. है ना? See, what is the meaning of the poison? Anything which is going to irritate inside your body or outside your body. ठीक है, यहाँ पे भी अगर itching होने लगा inside or outside, right? So this is called a what? Poison. So like which poison can cause, you know, which poison can have the neurological symptoms? Remember here, one is a thallium, which can mimic like Guillain-Barré syndrome. Guillain-Barré syndrome. Even arsenic, even mercury. Yes, neuro. Okay, which poisons are heart poisons? I'm asking you, which poisons are heart poisons? Can you answer me? See the cardiac poison. See the cardiac poison. Remember cardiac poison like aconite, nicotine, digitalis. Aconite is what? Aconite. See, aconite is also called a meetha zahar, wish. Okay, aconite, a woman's bane, blue rocket, devil helmet, all cardiac poison. What they do? They are going to block what? Sodium gated channel of the heart. And after that, there will be more and more release of the potassium, right? So because of severe hyperkalemia, there will be what? Ventricular fibrillation and death. So aconite, nicotine, digitalis, right? Okay. Which poisons will be causing asphyxia? Bolo. Asphyxia. Can you answer me? Yes, CO poison. In carbon monoxide poisoning, what is the cause of death? Anemic hypoxia. Okay. What about cyanide poison? Histotoxic hypoxia. Cyanide can be made at home also, and this can be seen in the seeds of so many fruits, no? Seeds of apple, plum, and after the pear, right? And those seeds of apple, plum, pear, all the almonds, right? Okay, fine. Asphyxiant, these are asphyxiants. Yes, there can be metallic irritant. There can be metallic poison. Like I will be teaching you about, like some mercury, arsenic, lead, right? Okay, metallic irritant. Yes, after that, there can be acidic and alkali poison. So can you tell me, out of acidic and alkali, which one is more dangerous? Acid or alkali? Alkali is more dangerous. Please remember here, because it is having hygroscopic nature. It is having a hygroscopic nature. What is the meaning of hygroscopic nature? This will be attracting, this will be absorbing more and more water from the systemic circulation. Because of this, there will be more and more penetration inside the body. Right now, see, like acid poison may, like sulfuric acid, nitric acid, these are having local impact. Wherever they are going to touch, they are going to burn it. Right now? And so there can be local injury also, systemic also, but alkali mostly systemic. Okay, remember all these. So when I talk about sulfuric acid, H2SO4, so can you tell me which type of symptoms you are going to see? See, acidic and alkali mein. Sulfuric acid you would have seen in class 11th and 12th, no, wo jo usme lab mein, hai na? Wherever sulfuric acid will go, it will burn it. So inside the body also, you can see what? Black tongue. If you do post-mortem examination, see, even they see, yes, so stomach wall will also be what? Black leathery stomach, right? Black leathery stomach. Okay. And here, what will be the color of teeth actually? Teeth, see, remember here, when sulfuric acid will be mixed with here enamel, no? Enamel mein. So here, what color of teeth? Okay, same like the जो उसका blackboard का chalk होता है ना, yes. Okay, chalky white. What about nitric acid? Can you answer me? What about nitric acid? HNO3. Bolo nitric acid HNO3. See, remember here, whenever it is going to touch, see, any body part, now what will happen here? Yes, bolo. Nitric acid में. Yes, okay, there will be xanthoprotic reaction, है ना? तो इसमें सिर्फ इतना याद रखो कि it will make everything yellow teeth, like wherever it is going to touch, even the tissues or organs, even the cloths, like yellow discoloration of the teeth and the organs and the tissues. But see here, when nitric acid will be mixed with hydrochloric acid, now see, yes, stomach layer will be what? See, a stomach layer will be what? Brown color stomach in post-mortem examination. Brown color. Remember here in sulfuric acid, black, black, black. Say nitric acid में क्या है? Yellow, yellow, yellow. Remember like this. Okay? Very good. Now, है ना? So acid, alkali, poison, all these poisons we are going to learn one by one. Now see here, when a person is going to consume any poison, if a stomach was, see if like a stomach was full, like suppose if a stomach was full, after dinner if a person can take, after dinner if a person is going to take, poison in, sweet dish and as a dessert. So when a stomach was full, now you tell me which part of a stomach will be getting maximum damage. Lesser curvature. Please write down. When a stomach will be filled, okay, now lesser curvature, maximum damage, lesser curvature. Now in this situation, obviously poison has to go inside, poison has to make its pathway to go inside, right? No. So remember here, this will be choosing the shortest pathway like this. Shortest pathway. See, this is called as the stream. This is called as what? A street of a stomach. This is called as a megantros. Megantros. Okay, this is called as megantros. But if a stomach will be empty, suppose if a stomach will be empty, now see here which part of a stomach will be having maximum damage. Now see here, now the poison will be coming and getting down here, right? At the lower dependent part, remember here, fundus is spared. So lower dependent part, body will be having maximum damage. Body will be having maximum damage. Okay, body will be having maximum damage. All right, chalo, this much point is clear to everyone. Now can you tell me, if I have to give one incision to open the stomach, I should be giving incision over lesser curvature or greater curvature? Answer is greater curvature. Okay, so now whenever you are going to get any patient of the poisoning, obviously first is what? A, B, C, D, E. Basic management, you have to check vitals. You have to check all the vitals. Remember here, if temperature is high, mostly this was the stimulant drug. If temperature of body will be low, mostly depressant. Like see benzodiazepine, alcohol, these are what? Depressant. But cocaine, amphetamine, these are what? Stimulant. So if you see the temperature of body is high, stimulant high, right? Yes, okay, chalo, that's great. Okay, fine. Very easy to understand. Right. This one point is clear to everyone. Vitals. And at the same time, you have to take history. Okay? After that, you have to do what? After that, you have to do what? Decontamination. Decontamination means what? You have to wash the stomach. So how to do decontamination? Either you can induce emesis, vomiting, or you can use the catharsis, right? Catharsis means, see, emesis means what? To induce vomiting. From the mouth it will be coming out. See, what is the meaning of the catharsis? From the rectum, like with the stool it will be coming out. Or see, emesis and the catharsis, or gastric lavage. Remember here, whenever there will be liquid poison, please avoid emesis and all. Why to avoid it? See, because see, there will be risk of aspiration. And now there will be more and more injury to esophagus also. Okay, emesis can be induced only within 1 hour after the poisoning. Okay, gastric lavage means what? See, this is gastric lavage. You have to wash the stomach with 300 ml. Warm ml normal saline. Warm hona chahiye ye. So first of all, you are going to like infuse inside. After that, you are going to keep the tube downwards. So because of the gravitational force. Now after, see here, no? Like when water is going to enter the stomach, it is going to wash it, and after that it is going to come out. Right? No? So this is called as gastric lavage. To clean the stomach, to wash the stomach is gastric lavage. Question is that, what should be the position of patient? Left lateral. Because in left lateral, see here, so body will be over the dependent part. Very easy. Or sitting position. What is the name of the tube for gastric lavage? Lavaquator. Best hai. But evals. But very commonly, Rile's tube will be available everywhere. Okay. Now the question is that, See here, so gastric lavage can be done in all the cases. Remember here, gastric lavage, whenever there will be gastric lavage, please write down. Gastric lavage is completely contraindicated in liquid में like acid alkali poison, acid alkali poison, except बोलो phenol, except phenol. See the contraindication of gastric lavage. Phenol which is also called the carbolic acid. Phenol is also called as carbolic acid. Okay. This we are using as a disinfectant. Remember here, this is the poison, phenol or the carbolic acid, where urine will also be turned into green color. Urine will be green color. Old question. In which poisoning you see green color urine? Okay, see carbolic acid. Remember here, see here, gastric lavage is contraindicated in acidic and alkali except phenol, carbolic acid. Okay, and this should also be avoided in a case of if there will be what? Varicose formation. Varicose formation or varices. What is the meaning of varices? इसका meaning क्या होता है? Varices क्या होता है? See here. Overall, what is the most common cause of upper GI bleed? Peptic ulcer disease. And see, like esophageal variceal formation also. ये varices क्या होता है? See, one is called the portal blood system. See, one blood system is called the portal circulation, another is systemic circulation. This is a liver, right? And see here, so from here, like one blood vessel is coming up, like left gastric blood vessel. So this blood vessel is coming from, see, the portal circulation. And one blood vessel, hemiazygous vein, from the esophagus it is coming. So two blood vessels are going to join at a point. So there will be a point of anastomosis. No, this point of anastomosis, okay, fine. Remember here, how much is the normal portal pressure? Can you answer me? How much is the normal portal pressure? 5 to 10 mmHg. When there will be formation of varicose, when there will be portal hypertension, when it will be 10 to 12 mmHg, portal hypertension. Portal hypertension will be when there will be what? Pressure will be 10 to 12. When bleeding can happen, when portal pressure will be more than 12. When when hypertension will be there, no. So the point of anastomosis will be weak only, weak. So now because of the hypertension, there will be the tortuosity of vein. So this will be somewhat like this, no. This tortuosity of vein, this is called as a varicose formation. Varicose formation. Simple logic, varicose formation. Remember, so if you are going to insert the tube for gastric lavage, you can rupture this. And there can be severe bleeding. Okay. Same where esophageal varicose, see around the umbilicus, caput medusa, rectum में क्या है? Hemorrhoids, यही तो और क्या है वो? Simple logic है, right? Very easy to understand. Very good, very good. So varicose formation, and if patient is in coma, remember here, if patient is in coma, please don't give gastric lavage. Don't give gastric lavage, because see, what will happen now? See, if you are going to give gastric lavage, if person is in coma, entire body part will be relaxed, no. So now it is going to push the poison more inside actually. So this will be damaging intestinal part also, right? No, that's why we should avoid it. Mechanical antidote is called as, see here, this is called as charcoal, okay? See the charcoal. Dr. Aniket, dying deposition declaration will come, don't worry. Mechanical antidote, this is nothing but that. See here, this is just the carbon, see this is the carbon compound. 1 gram of carbon, see this is a type of what? Adsorbent. How much surface area, see it is going to absorb? Approximately this will be having effect over, see 3000 like, है ना? Okay, fine. So 1 gram, this is what? Mechanical antidote. Okay. After decontamination, if antidote is available, then you can give. You can also use the chelating agent which can combine with the poison and take it away. Right now, like Edita, penicillamine, all these, I hope you are able to recall. Now, can you tell me some of the antidote? If there will be the paracetamol poisoning, what is the antidote? Paracetamol poisoning? N-acetylcysteine. N-acetylcysteine. What is the antidote for? What is the antidote for, see, benzodiazepine toxicity? Flumazenil. Flumazenil. What is the antidote for iron poisoning? Okay, see here, so desferoxamine, right? Right, see the desferoxamine, right? Okay, what about the opioid antidote? Overdose of opioid? Naloxone. Naloxone. Okay, naloxone. Okay, chalo, fine. Now, next we are starting with mercury poison. See, what is the symbol of mercury? Hg. So, the poisoning of mercury is called as hydragyrosin. Hydragyrosin. Easy to understand? Hydragyrosin. Now, remember, mercury will be, see here, this is going to damage the nerves first of all. Mercury is going to damage the nerves first of all. Nerves. Okay. See, first of all, like see here, so beginning symptoms will be there. So there will be what? Excessive salivation, gingivitis, loosening of teeth, blue lines on gums. But remember here, especially where do we use mercury? Like in hat industry. See, in the glass blower industry. Glass blower industry. So all factory workers who are working in hat industry and the glass blower industry, do you think they are at the risk of mercury poison? Yes. In PSM, you would have learned this. After a few months, there should be a medical checkup to all the workers, right? So first sign of mercury poison will be, see here, so there will be difficulty in writing. And because all workers will be coming in the morning and they have to put their signature, attendance, no? So first sign will be difficulty. See, first sign will be difficulty in writing. So first will be seen in hand. So this is called as what? Shaking palsy. Shaking palsy, or a kind of the tremors. So this is called as the, see, this is known as the Danbury tremors or the coarse intentional tremors. So this kind of shaking palsy happening in hat industry, hatter shakes. See, in the glass blower industry, glass blower shake. And same worker who was working in hat industry, who is getting neuropsychiatric symptoms also. Now he is behaving like a mad person in hat industry. He will be called as a case of mad hatter syndrome or erethism. One-liner question, which poison will have psychiatric symptoms? So here there can be personality changes, there can be delirium, and there can be shining, there can be irritation and all. Remember, mercury poison, erethism. Some people can use, like when they will be exposed to mercury vapor, you can see in front of the lens, Okay, you can see in front of the lens. Yes, there can be brown deposition. It is called as mercuria lentis. This is called as mercuria lentis. But remember here, visual acuity will be normal. Okay. Now, acrodynia means what? Acrodynia. See, yes, some kids who can be hypersensitive to mercurous chloride. Hypersensitive. Okay. So there can be what? Hypersensitivity reaction. Now say yes, some kids will be going for dental filling. Dental filling के लिए जाते हैं, right? No, dental filling powder, right? Dental filling powder. Some kids can be hypersensitive to this, and he can get hypersensitivity reaction. Now say yes, so hands will be pink, feet will be pink, right? No, so pink, puffy and painful. This is known as the pink disease. This is known as pink disease, which is also called as acrodynia. Please remember, very, very important. Okay. Say yes, a pink disease, also called as acrodynia, also called as swift fever disease. Now, Minamata. So there was a river in Japan. Name of river was Minamata. At one bank of river, there was one factory. At another bank, there was a group of people were living together. Okay, so from the same community of people, one patient got admitted in hospital with difficulty in, like walking. He was having seizure. He was having difficulty in writing, speech also, and seizure like symptoms were coming. So doctors were treating, okay, chalo, seizure. But, from the same group of people, from the same group of community, so many patients started coming with similar symptoms. Doctor was not able to treat. So now when they did inquiry, they found that this factory, so see here, so they were releasing, so they were discarding their waste material in that river, okay. And see here, these people, they were feeding on seafood. So they used to have what? Say contaminated fish, है ना, contaminated fish. And because of that, see, है ना, तो उसमें क्या था वो? See, in this, see, इसका जो waste material था ना, there was so much of what? Mercury. Okay? Right now, so because of Minamata disease, it is called as what? Like overall, say this because Minamata river, it is called as a Minamata disease. Minamata disease. Now, see here, now extreme condition of mercury poison, where patient can have seizure also, neuropathy also, deafness also, blindness also. Hunter-Russell syndrome. So related to mercury poison, I have taught you 6 diseases. Can you write down the name of 6 diseases? बोलो क्या क्या था? सबसे पहले क्या पढ़ा था हमने? Danbury tremors. Right now, Danbury tremors. Right? After that, we have learned about what? Erethism. Eye में, see, mercuria lentis. Right now, mercuria lentis. After that, वो क्या था? Hypersensitivity reaction. See, pink color, pink disease. River related, Minamata disease. Extreme condition, Hunter-Russell syndrome. Mercury is an important topic. Next, arsenic. Remember, arsenic, what is the best? Like suppose if a person is going to poison someone, okay? See, what is the best part about arsenic? Arsenic mimics like a natural disease. Which natural disease? Cholera. Okay? See, gastroenteritis, right? No, gastroenteritis, cholera. Okay? After that, there will be severe loose motion, and person will die because of hypovolemic shock. Everyone will be thinking, okay, this was the case of a natural death, I say, है ना? Remember here, arsenic. See, first of all, what arsenic is going to do? In GIT, it is going to destroy the normal healthy flora. It is going to destroy the normal healthy flora. The normal bacteria will also be killed. Right? Because of that, now severe loose motion. Okay, fine. Arsenic will be causing, vasoconstriction. So do you think there will be lack of blood supply? After that, cyanosis, then ischemia, finally necrosis? Okay. See this photo. Lack of blood supply to the peripheral part. This is called as Blackfoot disease. This is extremely important. Blackfoot disease. Say here there will be no blood supply to the feet, right? Now because of that there will be what? Say the gangrene formation in the feet, and there can be spontaneous amputation also. Repeatedly asked question. Blackfoot disease is seen because of which poisoning? Arsenic. Okay. See here, because of the lack of blood supply here, like over the hand also you can get what? Black deposition, like something like this one. See, black deposition, a small over the hand. So this is like raindrop pigmentation. This is also important. Raindrop pigmentation. Over the nails you can see white lines. This is called as Mees line. Aldrich Mees line. Very, very important. Okay, see, white line over the nail is called as Mees line in arsenic poison. See, because of the peripheral lack of blood supply. See, accommodate part here. You can see here over the sole. Yes, there is what? See, extra deposition. Basically, kya? Hyperkeratosis. Remember, related to mercury, most important is Mad Hatter syndrome and what? Say, Danbury tremors. Related to arsenic, most important thing is what? Blackfoot disease, raindrop pigmentation, and then there will be cholera. It mimics like cholera. Okay, fine. And see, when rashes will be coming out, no, it will mimic like measles rashes. Even there can be, see here, depigmentation in the macula, leucomelanosis. Chalo, all these points are very easy to understand. One is, see, arsenic is going to destroy the normal flora of the GIT. Second, it will be causing vasoconstriction. So lack of blood supply. Now remember here, see here, when there will be lack of blood supply here. And after that, see here, so destruction of the flora also, right? And vasoconstriction also. So yes, there can be, see, see the damage over the walls of the stomach. And see some old damage, some fresh. So you can see some red color also here, some black color also. Same like a strawberry gallbladder. Here also you can see what, if you do post-mortem examination, no, this will be having what? See the pink velvety stomach or a strawberry stomach. Old question. In which poisoning you will see complete black color? See the charred stomach, sulfuric acid. In which poisoning you see the brown stomach, nitric acid. In which poisoning you see yellow discoloration of the tissues? Bolo kya tha? Yellow, nitric acid. Very good. Now you tell me, see here. Yes, very good. Now where, see, in which poisoning you will see, like in the post-mortem examination, in which poisoning you will see like the strawberry color of the stomach, right? Arsenic. Where will you see black foot disease? Arsenic. Remember like this, okay? So see how to treat if there will be acute poisoning. See, like freshly prepared ferrous hydroxide. See, ferrous hydroxide, this will be combining with arsenic. It will take the arsenic out of the body, okay? Remember, all these points are important related to arsenic. See, the good part about arsenic poison is that it mimics like a cholera. It mimics like a natural disease. But what is the bad part about arsenic? Remember here, देखो यहाँ पे समझो. There was a case, a newly married female. She was having loose motion for last 9 days. And she was married for 2 years, okay? So like she was having loose motion for last 9 days. So doctors, like they tried all antibiotics, but her loose motion was not going away. Right? So doctors had, like they had some doubt. Yaar, what kind of loose motion is that which is not responding to any antibiotics? So doctor asked her, okay, what about your husband? How is your relation? Is it very healthy? She said, okay, no, sir. Earlier he was not so good, but for last 15 days, no, he's very good. How? Sir, he's not allowing me to enter the kitchen. Every day he is entering the kitchen, he is serving me food. Okay, so what is the profession of your husband? Sir, he is a professor. Acha, in which department? Organic chemistry. Good. Blood sample was taken. Right? Blood sample was taken. Arsenic was found. Okay, so husband will be in jail. Easy to understand? But remember here, so like long term mein arsenic can get deposited in hair also, bone also, nail also. So we have test Marsh test and a Reinsch test. Suppose if that female would have died after 2-3 years, if someone would have informed the police that that was not the natural death, that was not because of hypovolemic shock. Okay, that was not hypovolemic shock. So that was because of the poison. So now what will happen now? Now, do you think there can be a re-post-mortem examination? Yes. Who will give the permission for re-post-mortem examination? Magistrate. So now suppose if exhumation is done. Exhumation means what? What is the meaning of exhumation? Digging out the dead body from the grave. Actual meaning is actual meaning gade murde ukharna. Digging out the dead body. Ideally, it should be done in early morning so that there should be whole day for the examination. See, remember here, is there any time limit for exhumation? No time limit. Any time it can happen, even after 1 year, 2 year, 3 year, 5 year. So no time limit for this. Okay, no time limit. Now, see here, so what is the negative point about this? This delays putrefaction, first of all. This can be detected even in completely decomposed bodies. Even if you do bone examination, you can add in, even if you burn the dead body, arsenic can be found in ashes also. So remember all these points. Arsenic, very, very important. Lead poison. Lead is what is the symbol here? Pb. So the poisoning because of lead is called as plumbism. This is called as the plumbism or saturnism. See, plumbism or saturnism. Now, lead can be damaging. See, where lead is used, lead will be used in wall paint. Wall paint में. See why it is used in the wall paint? Because lead will increase the durability of, like wall paint. And see here, so lead will increase the luster. Even after 6 months, this will appear to be fresh. Lead is used even in the petrol as anti-knock. See, lead is used even in making the bullet. Bullet jo banate hain, lead, right? Okay, lead is used in the battery, yes, battery. Lead is used even in sindoor also, sindoor also, right? Chalo, fine. Now, how lead is going to cause problem in your body? See here, first of all, in CNS. Remember, lead will do demyelination. Lead will do what? Demyelination. Lead will do what? Demyelination. Demyelination. And a myelin sheet को destroy करेगा. Myelin sheet. Okay, this will be destroying myelin sheet. Okay, myelin sheet. So because of this, obviously now there will be neurological symptoms. Yes, there can be. See, there can be what? Foot drop. And there can be wrist drop in adults. In adults. I remember here, see here, like in the kids, this can cause encephalopathy. So there can be irreversible damage of brain also, CNS mein. Okay, fine. Now, lead will block. See, in blood, how it is going to create problem? Can you tell me in blood? See, this is going to block what? Heme synthesis. Heme synthesis. Heme. So can you tell me which enzymes are being blocked by the lead? I have taught you in psychiatry also. ALA dehydratase, ALA dehydratase and ferrochelatase. And ferrochelatase, please write down. ALA dehydratase and ferrochelatase. Okay, so obviously lead will be causing what? Blood related problem. Means there will be anemia for sure. So remember here, see here, after heme only there will be formation of hemosiderin. Then there will be formation of hemosiderin and iron, and then biliverdin, and then bilirubin. So basically when heme will be affected, bilirubin, biliverdin, see stool color is because of what? Bilirubin, biliverdin only, no? So it means hepatobiliary system will be involved. Okay, this will be affected. Okay. Okay, fine. ठीक है, चलो, very good. ठीक है, तो इतना समझ में आ गया, blood and CNS. After that, see here how it is going to affect your renal part. Renal part, please remember here. See, this is going to block the excretion of uric acid. See, it does not allow the uric acid to go out of the body, right? So because of this, so like hyperuricemia, it can cause gout. It can cause gout. How it is going to affect bone? Please write down how it is going to affect the bone. Lead can get deposited in the bone, and this can cause osteopathy in a child. And this can cause osteopathy in a child. Okay, so we have learned here CNS, blood, renal system, bone. All these are, see, even GIT also, GIT, all these are affected here, right? All these are affected. Now, if you do blood test after lead poisoning, no, if you do blood test, right? Okay, fine. See, if you do blood test, remember here, you can see the basophils will be like this. Basophil, like will be a stacking of coins. This is called as basophilic stippling. And if you suppose if that person was having dental caries, no, the bacteria will be there. So that will be releasing what? Hydrogen sulfide. Hydrogen sulfide with the lead. Now there can be bluish green color around the gums. You see the gums here, no? Bluish discoloration. This kind, see here, this one. This is called as Burtonian lines. Burtonian, please write down. Burtonian line is extremely important. Repeatedly asked question. One liner question they're asking. Burtonian lines especially seen in which poison? Lead. Lead may. See, blue lines around the gums can be seen in mercury also, but especially if you have to choose one, lead is first. So now what are the symptoms in lead? A, B, C, D, F, G. A for anemia, yes. B for Burtonian line, basophilic, stippling, bone line. C for, see, remember, see, like in the lead poisoning, no, there will be, see, the constipation and there will be the dry belly ache. C for colic, constipation or dry belly ache. D for drop, wrist drop, foot drop, lead palsy. C, E for encephalopathy among the kids. F for facial pallor because of what? Anemia. G for gout. H for hypertension, impotency. Okay. How to treat? Chelating agent, edita, penicillamine. So far, how many poisons you are able to recall? Please write down in chat box. In the beginning, from the beginning, what I have taught you, all the poisons, please write down here. Bolo. See, sulfuric acid, after nitric acid. After that, we have learned about, see, the carbolic acid, phenol, right now, see, green color urine. After that, we have learned about what? Say mercury, arsenic, right? Or mercury, arsenic, lead. These three are extremely important, I'm telling you. Okay. So can you tell me? Yes, very good. So can you tell me where we have seen the Danbury tremors? Can you answer me? Where we have seen Danbury tremors? Bolo, answer karo. Where have we seen that Danbury? Bolo. Doctor, I don't know about him, so I cannot make any comment. Okay. Very good. Chalo, fine. Now, where have we seen Blackfoot disease? Bolo, Blackfoot disease kahan dekha tha? Blackfoot disease kisme? Blackfoot disease? Arsenic mein tha na Blackfoot disease. Arsenic, right? Arsenic. Okay, ye batao. Where we have seen basophilic stippling and the constipation, the pain, dry belly ache, and the Burtonian lines. Lead, eh? Very good, very good. Chalo, fine. See the thallium poison, please write down thallium poison. This mimics like Guillain-Barré syndrome. Symptoms will be AND, alopecia, neuropathy and diarrhea. Okay, see the thallium. See the cadmium poison, especially because of the contaminated fish and seafood mein. See the cadmium, no, so like this is going to destroy the bone minerals. Okay, so because of this, what will happen? No, see the bone will be very, very much brittle bones. Remember a bone problem here. See brittle bones. At the higher risk of bone fracture. See here, so it is going to destroy all the minerals, no? Right? All the minerals, no? So now even, you know, like symptoms will be like osteomalacia. And even if you are going to touch the patient will say, ouch. Means what? Ouch disease. Bony pain, ouch disease. Which is called as Ita disease. Ita is a Japanese name and it means it hurts. See the phosphorus point, please write down. One is a red, another is white or, yes, very good. White or yellow phosphorus. Okay. Remember here, this is poisonous. Red poison, see a red phosphorus in non-toxic. Okay. So white or yellow, this is extremely inflammable. That's why phosphorus should be kept underwater. This is highly inflammable. This emits light. This emits smoke. So anyone who was getting exposed to phosphorus, no, whenever he will be passing his stool, there will be light coming out from his stool. Smoke will be coming out from. So this is called dhua syndrome. Smoky stool syndrome is because of phosphorus poisoning. Smoky stool syndrome. Okay. Even if he will be vomiting out, from the vomit, actually light will be coming out. Remember all this point. Remember here, so even matches. So where do we use phosphorus? Making, you know, bullets, bomb, and even ye jo hota na Diwali firecracker, even matchstick, matchstick, right? So remember here, what is the most important point? Yes, here a person who will be getting exposed to phosphorus. Now, see, this is going to damage the lower part of mandible bone. So first symptom, there will be toothache. After that, swelling of jaw, then loosening of teeth. Finally, there will be necrosis of and necrosis of lower jaw. See, because of that, in the bone, there can be formation of sequestration. There will be accumulation of, and after that, there will be accumulation of the pus. So now here there will be swelling in the lower jaw, same like this. Okay, it is called as Lucifer's jaw, Fosse jaw, glass jaw. Please memorize this. Fosse jaw is because of phosphorus poisoning. Repeatedly asked question. Fosse jaw, yes. है ना, Lucifer's jaw, very important. Okay, very important. Okay. अच्छा ये बता, वो जो whitener होता है ना, whitener, जिससे आप वो मतलब किसी का भी लिखा हुआ मिटा सकते हो, whitener. तो उसमें कौन सा क्या यूज होता है? whitener में oxalic acid, whitener, है ना. Suppose if examiner is going to mention any case of forgery, है ना, forgery case अगर mention किया तो समझ जाओ. See here, oxalic acid. So this will be used in, like in the bleaching also, even in the like the color printing also, है ना, जो whitener होता है उसमें oxalic acid use किया जाता है, oxalic acid. Okay, oxalic acid. If there will be poisoning because of oxalic acid, remember here. Now, first of all, when it is going to mix with, hydrochloric acid, so it will be damaging the lower part of a stomach. And when he is going to vomit out, now vomit color will be coffee color vomiting. There will be coffee color vomiting. And this will be disturbing, see, the calcium metabolism also. And calcium metabolism also, you have to give extra calcium, like IV calcium gluconate from the outside, right? So remember here, there will be a time when there will be imbalance of this here. So which gland is responsible for the calcium hemostasis, for the calcium metabolism? Parathyroid gland. If in extreme condition, you will have to do surgery also. You will have to remove the parathyroid gland. Okay, that is in oxalic acid. Remember, oxalic acid important hai, whitener and all. Chalo, fine. Now all plant poison one by one. First of all, see the Ricinus communis. Okay, active ingredient is a ricin. Okay, seeds are not poisonous, but entire plant is poisonous. This is used as biological. See, this is used as biological warfare. Abrus precatorius, abrin. Here active ingredient is abrin. This is being used as, say here, to kill the, yes, this is used as cattle poison. Suppose if you are having 5 cattle and if your opponent is having 50 cattle, now if you want to kill his, cattle, so what you can do? Say seeds, these seeds, you are going to make the powder out of these seeds. After that, mixed with dhatura and then spirit. After that, you make the paste, and then you make small needles, and you have to dry under the sunlight. Now you are having so many needles. Now you can take a big stick. You are going to fix one stick. See here, like at the tip of the stick, you are going to fix a needle. In night time, you can enter his cattle house. वो जो होता है गौशाला. Now you can poke all the cattle one by one. And by the morning, all cattle will be dead. What is the best part? When other people are going to see what happened to these cattle. See here, this mimics like a viper snake bite. Viperine snake bite. Log kya samjhenge? This was a snake bite. So please write down. Say here, sui needle. Okay, fine. Very good. Very easy to understand. Abrus precatorius. Sui needle. You should know. Sui needle. We are making out of what? Abrus precatorius. Now semicarpus anacardium. Here active ingredient is a semicarpol and bilavanol. 2. Bilavanol. See, these seeds are used as marking nut. Like in old time, like 15-20 years before. See, in all washermen, washerwomen, like they used to wash so many clothes, but they never used to get confused because over the collar, they used to write your room number with these seeds. These can be used. See here, semicarpus anacardium. These are used for what? Say here for, like artificial blister formation. artificial blister formation. Artificial blister. Remember here, suppose if I fought someone, or artificial bruises, artificial bruises, artificial bruise. Suppose if I fought with someone, I hit him a lot. After that, he filed a complaint in police station. Now I will be thinking, no, I should also be showing, no, he also hit me, he also. So what I can do, I can use the juice of this plant, I can apply over my skin, and like this will be mimicking like bruises, bruises, artificial bruises. Okay, but I can apply only over the accessible parts. How to differentiate whether this is real bruise or a pseudo bruise? If you give one incision over the bruise, real bruise, blood clot will be there. Pseudo bruise, acid serum will be there. Simple, right? There will be itching in. See, itching in the plant juice, no itching in the real bruise. Okay. Remember here, many a times they are asking how to differentiate ante-mortem and post-mortem. Ante-mortem and post-mortem. Bruise and abrasion. Bruise and abrasion. Okay. Bruise and abrasion. Okay. See, remember here. In ante-mortem, vital reactions will be present. Ante-mortem is what? Before death. Wo bruise ho, abrasion ho, whatever. Vital reaction means a redness, swelling, there will be pain. Vital reactions will be present in ante-mortem. See, their color changes and all. Right now, signs of inflammation will be seen in ante-mortem, but these are absent in post-mortem. Remember, only this much point. This is more than enough to understand. Right? Okay. See, what about this plant? I'm sure you would have seen this, right? Somewhere. Okay. See, remember, see the Calotropis giganta. Here, see, what is the name of active ingredient? One is called the calotoxin or calotropin, right? No, calotropin. Remember these, see, this plant is this much poisonous that even a cobra snake can die. Even a cobra snake can die because of this. So where do we use? So where it is being used, the Calotropis giganta? See here, one is used as a cattle poison. If you want to kill a cattle, you can, like what other people are doing, they mix with the fodder, with the food. And sometimes, see the juice of this plant, they soak with the cloth and they insert this cloth into the rectum of that animal, that cattle. Okay, fine. So cattle poison. And if you serve one milkshake to a baby, right? So please write down. So this can be used as infanticide also. Infanticide also. Infanticide also. Okay, fine. So I have taught you. Yes. Okay. So can you tell me what are the 4 plants just now I have taught you? Bolo. See, image based questions are coming from here. Ricinus communis, Abrus precatorius, Semicarpus anacardium, and then Calotropis giganta. Calotropis giganta. Very good. So can you tell me, these plant juice, do you think these plant juices can be used for abortion also, illegal abortion? Yes. All these plant juice are, see here, these are also called as abortifacient drugs. Abortifacient means what? See here, how illegal abortion is being performed in the villages. Like they use one stick, bamboo stick like this. After that, they apply the juice of these plants. Okay. Right? After that, they insert into the vagina. They touch up to the cervix part. So now there will be severe irritation in the cervix. After that, there will be hyperstimulation of the uterus. And because of that, there will be expulsion of placenta. Right now? So please write down, all these plant juices are used for illegal abortion. Of course, this will be very risky, very dangerous, very dangerous. See here, so there can be uterine inversion. There can be postpartum hemorrhage, right? No, so yes, sometimes even mother can also die. Sometimes I'm saying, right? No, so obviously this is wrong. This is very much wrong, illegal, 100%. And all these are used as arrow poison also. All these are used as arrow poison also in ancient age, in the age of Bahubali. See, that time there was no any machine gun and all. So they used to fight with what? Bow and arrow. So at the tip of the arrow, they used to apply the juice of all these, or they used to use this kind of suy needle. So person can be saved from, from the injury, but he should die because of poison. Okay, fine. Now, next important topic, ophidiophobia. See here, ophiology. Ophiology means what? Ophiology. And ophio means a snake. Now a study of a snake. Okay. Okay. All right. Now see how to differentiate the poisonous snake and non-poisonous. See, most of the poisonous snakes are nocturnal. Nocturnal. But non-poisonous can come out anytime. But what about head scales? See here, these are head scales. These are head scales. These are head scales. Head scales. Okay. So remember here, and these are actually what? Say now what about the belly scales and distals? Belly scales, distal scales. Okay. Remember, head scales in all the poisonous snakes will be smaller. Will be smaller. Head snakes in all poisonous snake will be smaller. But it will be bigger in non-poisonous. Okay. Remember here, in all poisonous snakes, head scales will be smaller. Except in cobra, only the third one, this one, only the third one, this will be largest. Third supralabial, labia means lips, just above the lips. Okay. Third supralabial will be largest. And in the crab, fourth infralabial will be biggest. Remember this. In the pit viper, there will be a pit. See, there will be a pit just below the eye, pit viper mein. And now remember here, see here, cobra is the only snake where, see the third, see here, see third belly scale is direct in contact with eye and nose. Eye and nose. These are some of the special features of the cobra you should know. See, belly scales, right? These are bigger in poisonous and smaller in non-poisonous. See, the distal scales in poisonous, it will be single row, but non-poisonous double row. See, what about the tail? In the poisonous, this will be actually suppressed. Suppressed. क्या होगा? आगे से दबा हुआ रहेगा. That will be fully flat. But non-poisonous, this will be cylindrical only. But remember here, most important thing, ये बताओ, how many teeth are there? How many teeth are there like in the mouth of a snake? Are you thinking only two? Same like elephant, दो दिखाने के बाकी खाने के. Two are external, that is, see, these two are called as fang. These two are fangs. Fangs. But internally you can see a small teeth here, no? So remember here, see, remember here, see, this is actually, see, this is the poisonous gland. This is the poisonous gland. Remember, see, their fangs are like this, like this, fangs are like this. When a snake is going to bite you like this, now these fangs are going to get stuck in your like skin like this. After that, when a snake want to go out, now there'll be a stretching of these fangs. Because of this, now you see here, see, there is a compressor muscle just behind the venom gland. Okay, na? So what is it? When the snake is going to, like when a snake wants to go out, now there will be a stretching of these two fangs. Because of this, there will be compression over the compressor muscle. Because of this only, there will be what? Squeezing effect on the poisonous gland. Right now, poisonous gland. And because of this only, poison will be coming out in your body. And this is going to enter in your body through fangs. Fangs. Okay? Fine. So remember here, if you see only, see, like suppose if you see only two puncture mark, it means poisonous. Suppose if you see multiple teeth bite marks, non-poisonous. Simple. Yaad rahega? If you are lucky enough, even after a snake bite, if venom did not enter your body, if you are lucky enough, then it will be called as a dry bite. Then it will be called as a dry bite. Okay? Dry bite. Okay? Very good. This much point is clear. Now let's learn all the snakes one by one. सांप को पहले पहचानो. Okay, see, first of all, there are the three families: Elapidae, Viperidae, Hydrophidae. See, in Elapidae you can see, say here, cobra and krat. Viperidae like a viper, so vasculotoxic, है ना? See, Russell viper, all vipers. Hydrophidae, see a snake. Remember here, Elapidae, cobra, see, cobra and krat, these are neurotoxic. Neurotoxic. See, the poison will be neurotoxic. Okay? Okay, Dr. Samir, yes. Okay, I'm glad to see you here. Chalo, all of you. Chalo, all right, all right. See here, so cobra and crab, these are what? Neurotoxic. Remember here, these are going to damage, these are going to paralyze respiratory muscles. So the cause of death in cobra and crab is respiratory failure. Hydrophidy, see a snake, like when you have to do swimming after the severe pain will be there, no? See, myonecrosis, muscle cells will be injured, right? No, so they can damage your respiratory muscles. Here also cause of death is respiratory failure. Viper ready, viper in blood vessels. Now, suppose if there will be DIC, disseminated intravascular coagulation, okay, no, or blood related problem, there can be hypotension, BP shock and all, right? No, so remember here, now here cause of death will be cardiac arrest. Russell viper, saw scaled viper, very good, okay. Fine. So remember there are the three families: Elapidae, Viperidae, Hydrophidae. Right now in Elapidae, see here king and cobra. See here, इसमें क्या है? Cobra and krat. Cobra and krat. Now, remember here, see Indian cobra, which is also known as Naja. See here, all these are scientific names. See, if you get time, you can memorize it. Now, let's learn how to recognize these snakes. If you see these kind of, so these kind of bands, if you see these kind of bands at the interval, okay, agar beech mein band nazar aaye to krat, okay. See, this is also here also you can see some bands are there. Same species, this is also krat. If you see diamond shape like this, no, like this is called as Russell viper. Now, how to differentiate king cobra and common cobra? Look at the head. Look at the head. Here, see in first snake, you can see over the head, there are actually, see, yes, so two eyes are there, two eyes. Right? Same like specs. Okay, same like specs. Please remember, only common people need specs every time. King does not need specs. Simple. Bispectacle head will not be there in Kung cobra, but in common cobra, it will be there. It will be there. Okay. Remember it, very important. You should know, okay, how to differentiate, how to, right? See, remember here. Yes, very good. See here, bispectacle head will be seen in common cobra. Common, not in the king. Not in the king. Okay. Now you tell me, what about this snake? Batao, what about this snake? What about this snake? Which snake is this? Bolo, which snake is this? Here also you can see band, no, band by. This is also krat. Okay, what about this one? Here also you can see band in between. So this is also krat. What about this one? See here, separate diamond, Russell viper. But if diamond will be like this, like saw scaled, है ना? So this is saw scaled viper. Saw scaled viper. Now, do you understand here that? See, remember when I talk about the cobra and krat, remember here, maximum poison at one time will be spit by what? See here, so the king cobra. The maximum poison will be coming out at the same time. That will be the cobra snake. Cobra snake. है ना? Cobra snake. But remember here, so this is actually extremely dangerous. Yes. But what about, see the krat? Extremely lethal. Extremely lethal. Why? Remember your for the, see here, see the fatal dose in common cobra 15 milligram. King cobra up to 12 milligram. Russell viper 40 milligram. Saw scaled viper 8 milligram. See, what about the krat? Even 2.5 milligram is enough to kill a person. Is enough to kill a person. Okay? Fine. Okay, krat. Remember here, and even, you know, one thing, like along with anti-snake venom, we give one more injection of IV neostigmine. IV neostigmine we are giving to reverse neuroparalysis. This is effective only against cobra, not against the krat. After that, after a snake bite, there will be local symptoms. Local symptoms will be there, है ना? Okay, नींद आ रही है, आप सो जाइए आप जा करके, है ना? बाद में देख लेना YouTube पे आप. Okay, Dr. Amjad? All right. ठीक है, fine. चलो, ठीक है. So, local symptoms, like what are the local symptoms? Yes, there can be pain, there can be swelling, there can be pain, there can be swelling, there can be bleeding. There can be bleeding, there can be what? Blister formation, blister formation. So basically क्या है कि obviously after a snake bite, yes, even fang marks, myonecrosis, myonecrosis. Okay, so after a snake bite, after a snake bite, what will happen? After a snake bite, yes, there will be local symptoms. But remember here, local symptoms will be minimal. Local symptoms will be minimal or absent. Minimal or absent in the rat bite. See, like when a person will be sleeping on the floor, like there will be a snake bite over his leg, right? Over his leg. Okay, fine. After that, he will be having just kind of itching, like he will be feeling a mosquito bite tha. But when he will start having neurological symptoms, no respiratory problem and all, then he will get up, then he will be shifting to hospital. See, in the beginning, no one has seen a snake bite. No one knows that. Even doctor will not be knowing that, right? No. So now it will be very, very difficult to diagnose the case. It will be very, very late. And even see, fang marks will be very, very small, almost invisible, right? No, almost invisible. So that's why it is extremely lethal, extremely lethal. Remember, anti-snake venom, whatever we are using in India, no, that is effective against cobra, rat, Russell viper, saw-scaled viper, saw-scaled viper. Okay, fine. Now let's learn here. See here, which test should be done. See, this is called the 20-minute whole blood clotting test. See, remember here, whenever you take the blood sample from the normal person, you are going to collect the sample in red color tube. You keep for 20 minutes. After that, there will be what? So there will be normal clotting and then serum. So separate ho jayega. Even if you tilt it, no problem, this will be separated only. But after a snake bite, no, even after 20 minutes, there will be no normal clotting. There will be no normal clotting. Okay, this is called a 20-minute whole blood cell, whole blood clotting test. Now, snake venom ophthalmia, what does it mean? What does it mean? Okay, now you tell me, see here, what does it mean? Suppose if you were walking on the road, suddenly a cobra came. After the cobra is going to bite you like this, you are going to jump here. After that see, cobra is biting you here, you are jumping here. Again, cobra is biting you here, so again you are jumping here. After that, now when you are playing with the cobra, now cobra will be pissed off. And after that, he will say, Ja tere ko nahi kaatta, muh pe thukta. He will spit on your face. This is called as snake venom ophthalmia. Snake venom ophthalmia. What does it mean? Spitting by a cobra on your face. Okay, spitting by a cobra on your face. Remember here. So what can be the symptoms? Obviously, when the poison is going to enter your eye, severe lacrimation, burning sensation, right? No, severe lacrimation, burning sensation. For time being, there will be temporary blindness also. Now, see the treatment. First of all, what should not be done? My question is that after a snake bite, are you going to apply a tight tourniquet? Answer me yes or no. Are you going to apply a tight tourniquet? Yes, okay. Are you going to do incision and drainage? Incision and drainage. It is very common, no? Okay, like after a snake bite, people will give incision and they will try to drain it out. Incision and drainage. Are you going to behave like Bollywood heroes, like after a snake bite, you can suck the venom after that, like after that heroine will get up? Are you going to do suction? No. Are you going to wash? Are you going to wash the wound? Are you going to run behind the snake to take the revenge? Are you going to run behind the snake to take the revenge? Okay, suppose after a snake bite, the patient is saying, Doctor Sahab, I need last glass. Are you going to give him alcohol? If you are not giving, he is saying, okay, at least give me a cup of coffee. Are you going to use any electric cautery? Yes or no? Please remember, there should be no tight tourniquet, because if you are going to apply a tight tourniquet, now what will happen? After reaching hospital, you will have to remove that. When you will remove the tourniquet, now there will be severe, so fast backflow. Wrong. See, incision and drainage, no. No. So whenever you are going to drain, there will be backflow pressure. Suction, obviously no. Washing, no. Don't touch the wound, keep it dry. Are you going to run behind? Obviously no. Alcohol and coffee, no, because they will increase blood pressure, heart rate, and after that there will be fast blood flow. Any cautery? No. Remember, a tight tourniquet, no, but a soft tourniquet, yes. Soft, that is called as Sutherland wrap. Same like, same like that, see the crib bandage, when you the orange color ka. So see here, after the snake venom will be taken up by the lymph nodes, right? No. So basically we apply a small pressure over lymph nodes so that there should be no, see here, so that there should be no, there should be no venom flow into the blood circulation. So soft tourniquet, okay. Wash bhi nahi karna hai, Dr. Kashif ne wash bhi nahi karna hai. Don't touch the wound. So how to treat? You have to treat a snake bite like, same like bone fracture. Same like bone fracture. First of all, immobilization. Immobilization. Okay? Okay, immobilization. Remember here, immobilization. What does it mean? इसमें क्या होता है? Immobilization क्या होता है यहाँ पे? See, please remember here. See, immobilization means like same like bone fracture. Now you can keep a wooden plank under the leg so that he should not be walking, because if he will walk, high, heart rate will be there. So immobilization. After that, yes, we are giving anti-snake venom. But anti-snake venom, please remember here, anti-snake venom should always be combined with adrenaline injection. Why? Because anti-snake venom is made up from horse serum. Horse serum. So there will always be the risk of anaphylaxis. Okay? And we are adding IV neostigmine to reverse neuroparalysis. The question is that, do you think in all a snake bite we have to give anti-snake bite? Like in all a snake bite we have to give anti-snake venom? No. First of all, observe the patient. Observe the patient. First of all, observe the patient. Keep the patient under observation. If vitals look normal, if local symptoms are normal, no need of anti-snake venom. Okay, but if vitals are fluctuating, low BP and all, and see here, so remember here when I talk about swelling, suppose at the time of admission, swelling was 4 centimeter. After half an hour, this became actually 3 to 5 centimeter. Okay, then no need to give anti-snake venom. But if swelling is also increasing, vitals are also degrading, then please give anti-snake venom. Unnecessarily, please don't give anti-snake venom. Okay? Chalo, fine. All these points are clear to everyone. A scorpion sting, this is also similar to a snake bite. But remember here, this is also neurotoxic, hematotoxic. Now, see, a scorpion bite, no, a snake bite, there will be 2 puncture marks. 2 puncture mark, but in a scorpion only 1 puncture mark, only 1. This acts on sodium and potassium channel, so this will be stimulating sympathetic, parasympathetic both, but at the same time there will be what, say here, uncontrolled release of the catecholamines. Because of this, now patient will be having what, autonomic storm. He will be having what, see, like excessive vomiting, sweating, tachycardia, pain in chest, right? No, see, there can be what, see, hypertension, pulmonary edema, right? No, there can be what, see, a ventricular fibrillation, arrhythmia. All these are there. What is the first line of management? Same, immobilize. And you have to give alpha blocker. Which drug? Prazosin. You have to give the prazosin. Very, very important drug, right? So prazosin, so this will be maintaining what? Blood pressure, pulmonary edema and all. And after that, like if scorpion antivenom is available, then fine. Otherwise, remember here, see, a scorpion venom will be very, very small in amount, very small. Okay, very small. So kya hota hai? This is not lethal for adults, but this can be lethal. But this can be lethal for children. Remember here, because see, like amount of venom will be very, very small. See, amount of venom will be very, very small. Okay, so this is not lethal for adults, but this can be lethal for like the pediatric age group. Now, see Dhatura plant. See the plant photo first of all. Plant photo first of all. Dhatura plant. Okay. See, remember here, this is also called as what? Okay, first question, what you should be knowing here. Active principle is atropine, hyoscyamin, scopolamine, also called a roadside railway side poison. Why roadside? Because like see the plant you can see like at the roadside. Railway side poisoning because you know like for the robbery. Now for the robbery, right? So before robbery, before kidnapping, right? Okay. See what is the meaning of this word carphologia, which is also called as a flocculation, which is also called as a flocculation, aimless picking behavior, aimless picking behavior. What is the meaning of aimless picking behavior? Aimless picking behavior means what? Suppose if you can see there is a passenger who was having, you know, like so many luggages. So you can offer him a plate of biryani with dhatura. Now after taking that, no, he will be having what? Anterograde amnesia. He will get up, he will start picking up, you know, like aimless picking behavior around the railway station, around the platform. You can pick his luggage, you can go away. So see the dhatura is what? This is used before robbery, before kidnapping, rape cases and all, because see person will not be able to recall anything. Antidote, physostigmine. Now see here, remember here, one is a dhatura plant, another is OP poison. OP is what? Organophosphate. Remember here, see in dhatura plant all symptoms will be dry, but organophosphate, like the pesticides used in agriculture field, all symptoms will be wet. All symptoms will be wet. See in dhatura you can see what? See there can be the dry skin, there will be dry mouth, there will be dysphagia, see there can be drowsiness, delirium, death. Right now, but OP poisoning, nausea, vomiting, lacrimation, okay, diarrhea, urination, all symptoms will be wet. In dhatura, एंटीडोट क्या है? फाइसोस्टिग्मिन. ऑर्गेनोफॉस्फेट में एट्रोपिन. If atropine is not working, then you can give what? Oximes like the pralidoxim. Right? I hope you are able to recall. Please remember, see dhatura poison, all symptoms will be dry. Organophosphate, whenever examiner is giving you any question related to, you know, a person is coming back from agriculture field, he has consumed something, and so mostly get pesticides and all, OP poison. Okay? Remember all these points. Now, if you want to do drug smuggling, how to do? So first of all, you can hire a person, and okay, that person will be called as a mule. And like see the cocaine, opioid, all these, and cocaine, opioid, right now, cocaine, opioid, like heroin. Okay? So now you are going to use, you know, like a small, see here, you are going to use the latex. You are going to make a small capsules. So, and after that, you are going to ask him to swallow all these. Okay, swallow all these. So obviously, if you are going to take this much risk, you are not going to do it for 100 milligram, half kg, 1 kilogram. You are making many, see, yes, many small capsules, and that person is going to, like, he is going to swallow it. So basically, you are going to pack his body with the drugs. After that, from Delhi to some other place, easily, Delhi to Dubai. After reaching there, after reaching there, he can use, see the catharsis or latex. After that, so that like in Delhi, he will be swallowing it, and after reaching Dubai, he can excrete out, right? Excreting. Okay, so basically you packed his body. It is called as body packer syndrome. Okay, see here. So body packer syndrome, also called as mini packer syndrome. Chalo, theek hai. Body packer syndrome. Do you think he is at the risk of the poisoning? Yes, obviously on the way, maybe if there can be rupture of any of the capsule. Yes. But if there is a smaller drug peddler, he is keeping only one packet of drug in his hand. He is roaming around the bus station. He was looking for his, client. Suddenly a police came. So like after seeing the police, he swallowed it. Okay. It is called as body stuffer syndrome. My question is that out of body packer and body stuffer, which one is more dangerous? Which one is more dangerous? Highest risk of poisoning कहाँ पे होगा? Body stuffer में. Why? Because body packer is completely pre-planned. Remember here? See, yes, so body packer क्या है? See, remember here? See, the body packer is completely pre-planned. Okay, no? But body stuffer was not planned. In body packer, you can see, you can pack his body through, see, the per oral route, see, the per rectal route, and per vaginal route. But body stuffer obviously only through the per oral route. Okay? Then after the poisoning, yes, ultrasound, CT scan is needed and treatment should be done in ICU. Okay? Now see this question and try to answer. See, we have completed the poisoning also. Yes, the biggest chapter we have completed. Can you answer this question now? Bolo. How many of you are marking IPC 84? That is old. New is C, BNS 22, BNS 22, right? BNS 22. Easy to understand. This is new, McNaughton's rule. Okay? McNaughton's rule. Remember, see the 23, like I have taught you, involuntary intoxication, and 24, voluntary intoxication. Now, sexual jurisprudence. Okay? See, remember here, how much is the age limit for a female to give the consent for sexual intercourse? Answer is 18 years. Even with the wife also, as per Indian law, even with the wife also, a minimum age is 18 years. See, sexual intercourse, remember here, what is the definition of rape? What is the definition of rape? What is the definition of rape? Whenever there will be sexual intercourse with a female against the consent, without the consent, without the will, rape. This will be considered as rape even after taking the consent. If age of female is less than 18 years, it is called as statutory rape. Statutory rape. Even if like she was insane, psychiatric case, or out of fear if she has given the consent, this will be considered as rape. So remember here, minimum age to give the consent for sexual intercourse is 18. Less than 18 years, this will be called as statutory rape. Statutory rape. Okay? As per Indian law, only a man can rape a woman. But as per French law, even women can also be punished for this. Women can also be charged for, like as a rapist. Remember here, suppose if a female is going to report, within 96 hours, within 4 days after the sexual, after the rape, you should collect all the samples, all swab from the vagina, like from everywhere. Okay, and all the clothes which she was wearing during that time, even, the hair sample, everything you have to collect. Now, hymen, what is the meaning of hymen? What is the meaning of hymen? Hymen is a what? See, hymen is a mucosal membrane. Hymen is a mucosal membrane, like spreaded over vagina with its own blood circulation, right? So that's why after rupture of hymen, there is bleeding. Okay. So see here, hymen will be ideally, it will be having one opening only. So most common type of hymen is what? Like this shape, like semi-lunar. If there will be two openings in the hymen, it will be called as septate hymen. Okay, suppose if there will be, see, the multiple opening, okay, then, okay, this will be called as the cribriform hymen. No, see, no opening, imperforate hymen. Big opening, it means she was multiparous. Finger projected like this, fimbriated. Remember, all these are important. Last time, neetpg question was there. A doctor was doing examination to a female patient and he found there was two openings in the hymen. Which type of hymen it will be called as? Septate. And a septate. Okay. Remember, after first time sexual intercourse, yes, there will be a rupture of hymen. They have asked, after first time sexual intercourse, there can be a rupture of hymen. So what will be the shape of rupture of hymen? Okay. First of all, see, this will be in the posterolateral direction. Posterolateral direction. Mostly 4 o'clock, 4 o'clock or 8 o'clock. 4 o'clock or 8 o'clock position. 8 o'clock position. Or it can go deeper up to 5 o'clock or 7 o'clock. First time sexual intercourse, yes, see here. So rupture of hymen will be 4 o'clock, 8 o'clock. But see, rupture of hymen can be because of masturbation also. So shape of hymen rupture in this case will be anterior direction, see here, either 1 o'clock position or 11 o'clock position. Remember all these. Hymen rupture is not seen in a case of girl child. Why? Because of deeper location, of hymen. Remember here, hymen rupture can be seen because of what? Because of the infection, because of fungal infection, because of severe itching, and because of Scilla pith weed. Scilla pith weed. In villages, they are using this. See, for the punishment to any female, any young female who was having any kind of, any kind of affair. So what they do, they insert a weed inside her vagina and they force her to sit in a bathtub. Now this weed will be soiling and after that there will be a rupture of hymen, punishment. Okay. We are using one rod. See, that is called as a Glaster-Keene rod. Glaster-Keene rod. Glaster-Keene rod. Okay. See, especially to check, okay, especially to measure the depth of hymen rupture. Depth of hymen rupture. Okay. Remember all these points. Very easy to understand. Right. Now, who will be called as false virgin and real virgin? First of all, what is the meaning of, see here, first of all, you should be knowing here that, see, the 2-finger test is abolished. 2-finger test is abolished now. This is completely abolished. 2-finger test. Earlier, this was used, after a rape case for physical examination to a female. When 2 fingers will be going inside, completely inside the vagina, then it means like rape has happened. There was like insertion, there should be the like history of insertion of penis inside vagina. Okay, but what about the multiparous female? If there was a rape to a multiparous female, so this will be actually what? Like waste. Right now? So please remember here that, see, 2-finger test is no more in use, abolished. Okay, fine. Ideally, we should not be touching the genital part. Basically, when we do physical examination to a female, no, remember here, first, are we going to take the consent or not? Yes, we have to take the consent. And we should not be doing in any manner where, female should feel where she should feel uncomfortable, right now? Ideally, only after observation, you should be able to understand. Remember how to understand like virgin and non-virgin female. Virgin and non-virgin female, virgin female and non-virgin female. See, what is the definition first of all? See, virgin female who never had sexual intercourse and she had intact hymen. Okay. Non-virgin female means what? Who had experienced sexual intercourse. Simple hai. But only after watching how you are going to understand. Look at labia majora. Labia majora. Suppose if you look at labia majora in a virgin female, labia majora will be thick, fleshy. And see, suppose if this is the labia majora, these two are labia majora, na? These are going to oppose each other in such a manner that you will not be able to see any opening. 100% virgin female. Okay. Labia majora. But if you can see opening, then non-virgin. Now see here, labia minora. In a virgin female, see here, under labia majora, there will be labia minora. In a virgin female, you will not be able to see any external protrusion. You will be seeing only labia majora. You cannot see labia minora. But in a non-virgin female, you can see labia majora, labia minora together. Both you can see. Okay. Here you cannot see in a virgin female. Non-virgin may you can see. Okay. Labia minora will be coming out. See, when I talk about the clitoris, in virgin female, this will be small. In virgin female, this will be small. In non-virgin, this will be enlarged. This will be enlarged. Okay. This will be enlarged. When I talk about hymen, will be seen here, mostly not seen here. Okay. Hymen. When I talk about a vaginal opening, very small opening in virgin female. This will be tight, very small, but non-virgin, it will be roomy, right? It will be roomy. Very easy to understand. So on the basis of all this, we can understand the virgin female and non-virgin female. Okay. Ideally, it should be done by a female doctor. Ideally. Okay, fine. Now, there is a question that Suppose if there is the real virgin, what is the meaning of the true virgin and false virgin? False virgin. Okay. See, the true virgin means what? Who never had sexual experience and whose hymen is intact. Hymen is also false virgin. May hymen is intact. Hymen is intact, but she has had the experience of sexual intercourse. Okay. Fine. So how to differentiate? When I talk about hymen opening in a real virgin, no, hardly the tip of the finger will go inside. But in false virgin, see, easily, like, see, hymen will be loose, hymen will be elastic. Okay, and even up to 2 fingers can go inside. Simple logic. All right. Impotency and sterility. Impotency is what? When a man is not able to perform sexual intercourse. When a person is not able to perform sexual intercourse, he will be called as impotent. Impotency, this is sterility. He can perform sexual intercourse, but he is not able to become father. He is not able to become the parent. Out of impotency and sterility, can you tell me which one is the valid ground for divorce? See, please remember here, see, impotency is a valid ground for divorce. Valid ground for divorce, but not the sterility. This is not. Because see here, so what is the definition of marriage as per like law? Marriage is a contract between 2 persons, male and female, between 2 persons to have sexual intimacy, right? To have sexual intercourse, right? Very easy to understand, simple logic hai, right? Now the question is that, see in the sterility, sexual intercourse is there, but he is not able to become father. It can be because of, might be, suppose if he is a patient of hypospadias. Hypospadias means what? Like if there will be urethral opening here. So where a person is able to perform sexual intercourse, but he is not able to deposit semen in the right place inside the vagina. Right now, so they have option of artificial insemination and all. Right now, very easy to understand. All right, theek hai, chalo. So sterility is not. Remember here, frigidity is what? Impotency in a female. Fridge, thanda, hai na? So when a female is not able to perform sexual intercourse, frigidity. What about, see, what about the coat hang? This is a psychological impotency. This is psychological impotency. A man can be impotent for one female, but he can be very much normal for other female. This is called a psychological impotency. Okay, very good, very good, very easy to understand. So remember, this is called a code hang. Now, if there will be a rape victim and a rape accused, so when you do physical examination, are you going to take the consent from rape victim? Obviously, yes. Okay. Rape accused, are you going to ask him, sir, if you don't mind, can I examine you? Obviously, no. Rape accused or any criminal prisoners, no need of taking the consent. Which chemical we are using in a case of a rape victim? Okay. See, in a rape victim, we are using Toledan blue. Here we are using the Toledan blue, but rape accused, rapist may please write down, we are using what? Lugol iodine. Lugol iodine. Lugol iodine. What is the meaning of this? See, what is the meaning of the Toledan blue? Remember here, see, in this picture, you cannot see abrasion. But after you are going to spray, after you are going to apply the Toledan blue, here you can see what? See, fresh abrasion in blue color. Right? In blue color here, right? In this picture, you are not able to appreciate so much of abrasion. But after applying, see, after spraying it, no, you can see here. So remember here, so Toledan blue is used to appreciate fresh abrasion. Fresh abrasion. You have to insert a speculum for the examination. Okay, sterile speculum. But remember, this should not be, see, why we are inserting this speculum? So that we can understand the physical injury, any kind of abrasion near vagina, vaginal wall or cervix. Remember, see, speculum should not be inserted if there is no history of insertion of penis inside the vagina, or if there is a girl child, no need of inserting this. Okay, chalo, fine. Now, what is Lugol's iodine? Lugol's iodine kya hai? Remember here, Lugol's iodine. See, remember here, suppose if there is history of insertion of penis inside the vagina. Okay. Now, with a filter paper, we are going to wipe the shaft of penis and then we are going to expose to iodine vapor. See, like inside the vagina, vaginal epithelial cells will be having glycogen, no? Right? Glycogen. So remember, a filter paper will turn into brown color, will be turning into brown color. It means 100% yes, there was history of insertion of penis inside vagina. Okay? Remember all these. Rape, remember here, 63 definition of rape. 64, see the punishment of rape. Minimum punishment, see the quantum of punishment for rape or custodial rape. Remember, a minimum punishment is actually, okay, see here, see like up to 10 years, right? Up to 10 years, right? Remember here, 68, dekho 67, 68, 69, 70, please memorize it. See here, 67 is actually, now earlier there was a term marital rape. During period of separation, if husband is going to have sexual intercourse with his wife. So now this term is not used. Okay, now it is not called as marital rape, no. So, but if a wife is going to file a complaint, no. So this will be a punishable offense, 2 to 7 years. Okay. So 67 mein kya hai? Sexual intercourse with wife during period of separation, like separation. 68 mein sexual intercourse by a person who was on the authority. See the person of authority. See here, so because of his official position, if he wants any kind of favor, and suppose see here, like senior person, official person, if he is going to seduce a female, right? Okay, fine. Right, easy to understand. So remember, yes, sometimes if, like sometimes if that, like the person who was, see the person who was like in the position of, like higher authority position mein, and he asked any junior or any employee, okay, like if you have sexual intercourse with me, I will do this for you, I will do this like that for you. So like for that, if she is going to accept that, okay, fine, this will not be considered as rape. But if she is going to file a complaint afterwards, no, then there will be punishment 5 to 10 years in jail. 5 to 10 years in jail. 69. Sexual intercourse by false promise of marriage or by deceitful means, up to 10 years. 70. Gang rape. Remember it. Very, very important. Remember here, are we going to disclose the identity of a rape victim? No. Remember here, disclosing the identity of a rape victim by doctor, by any media person is a punishable offense. Minimum 2 years in jail. Remember here, there should be free treatment to the rape victim and acid attack. Okay. Rape victim, inform the police. Remember here, as per BNSS 366. Okay. Remember here, so this should be done under camera. Remember here, all, like related to, like as a pedophile, pederasty, and also POSCO Act. Okay, POSCO Act. It should be informed to police. Now see this question and try to answer. Okay, Dr. Carson, you please sleep. Good night. Good night. Thank you so much. Right? I have to finish the topic, right? Okay, fine. Yes, see here. Bolo. Age is, see the 12 to 18 year. Hai na? Remember here, equal to or more than age of the 12. He can give the consent for physical examination, for general physical examination, right? For general physical examination. Okay, fine. Remember here, so he can do only general physical examination, only general physical examination. Okay, only one. Remember here, less than the 12 year, so like he cannot give the consent. But see that 12 to 18, he can give the consent only for general physical examination. But no per rectal, no per vagina, no x-ray, no injection, no blood test. See, the legal guardian will give, okay, no? Legal guardian will do. More than 18, he can give the consent. MTP Act, medical termination of pregnancy, very, very important. Remember, yes, see, opinion of one doctor is required up to 20 weeks. Opinion of 2 doctors will be required after 20 to 24 weeks. There are legal aspect. See here, there are legal aspect. Legal aspect, remember, in which condition medical termination of pregnancy can be done? In which condition? Remember, in which condition? If there will be risk of mother's life. Mother's life. Okay, mother's life. If there will be, see here, eugenic problem. Eugenic problem. Means like if there will be any chromosomal abnormality during actually, say here, CVSCs, during actually the chorionic villus sampling, right? Now, chorionic villus sampling, right? Suppose if the doctor is going to find that there is extra chromosome on the 21st, right? No, so risk of the Down syndrome, he can suggest the mother for abortion, mother, okay? In a case of rape, in a case of failure of contraception, but remember here, maximum age limit up to 24 weeks. So this is only for rape. But in a case of failure of contraception, maximum is only 20. Only 20. But remember here, risk of mother's life in any condition, in any age, MTP should be performed. Okay, risk of mother's life, right? Okay, fine. Remember here now the next important, see here. See, remember here, whenever there will be risk to mother's life, fetal abnormalities, anytime, okay, it can be. But a rape case, maximum 24, failure of contraception, maximum 20 weeks, okay. Who will give the consent for MTP? Only wife, only mother, not the husband, okay, only mother, okay. Okay. And remember here, the question is that if age is less than 18, if she is insane, who will give the consent? Legal guardian. Legal guardian. After marriage, husband will be legal guardian. So like there was a question last time in FMG exam, a 23-year-old female came for MTP, but she was found to be, like psychiatric case. In her condition, who will give the consent? Who will give the consent? Legal guardian, her partner, herself, or anyone? Bolo. Legal guardian. See, partner can be boyfriend also. So, see, the boyfriend is not the legal guardian. No, husband they have not mentioned. So, legal guardian. Okay. Remember, all these points are important. Now, illegitimate child means what? See here, the child who was born out of wedlock, without marriage, illegal child. Supposititious child, fictitious child. Suppose there is a child. Suppose there is a child. Okay. Fictitious. So here a female can pretend. A female can pretend that, like she was hiding herself for 9 months and suddenly she is presenting with a newborn baby. She is complaining he is the real father and he is the real father. But that person is saying, why she is claiming like that? For money, like for money, or if she wants to marry, right? No, how to confirm it? DNA test. See, what is the meaning of the posthumous child? After death of a father, if a child is born, right? Atavism. A child is not, see, a resemblance to a child is not with the parent, but with the grandparent. Grandparent, atavism. Okay? Chalo, fine. Artificial insemination. Artificial insemination. Remember here, for MTP, only female has to give the consent. Only female has to give the consent. But remember here, anything which is having what? Which is going to hamper the sexual life. Which is going to hamper the sexual life, right? No? So like in that condition, both partners are supposed to give the consent, like artificial insemination, okay? Hysterectomy, tubectomy, right? Now, vasectomy, both partners will supposed to give the consent, both. Okay. So if semen was harvested from the husband, so that child will be called as what? Okay, that child will be called as what? Legal. Okay, but suppose if there was a wiki donor, artificial insemination by a donor, wiki donor, some other person, okay? Chalo, fine, ye batao. To ye batao, artificial insemination by a donor, that child will be called as legal or illegal? Remember here, although both have given the consent, but remember here that a child, that child by artificial insemination by donor will be considered as illegitimate. Why? Because remember here, illegitimate. Why? Because remember, as per law, only biological father will be considered as the legal father. Okay, only that child can inherit the property, but a donor, he is someone else, but the main father who was there, like he's not the biological father. Simple. Remember here, so artificial insemination by a donor, illegitimate child. Okay, remember, if a wife has, if she has, see, remember here, suppose if artificial insemination was done without the consent of husband can file for divorce. Surrogacy, womb leasing. Okay, a female who is going to carry a baby with intention of giving it back after delivery to other person. Okay, that is called as surrogacy. Two types. One is called as altruistic surrogacy. Another is called as, another is known as the commercial surrogacy. See, altruistic means what? Remember here, this is legally allowed. Means, remember here, no extra money is paid. Okay, see here, no extra money is paid in altruistic surrogacy except the medical expenditures. Okay, see, altruistic surrogacy. Okay, but remember here, if surrogacy will be done for money, for the business, then it will be called as commercial surrogacy. In India, it is illegal. Remember here, if any female is found to practice, like commercial surrogacy, then she will be in jail for 10 years. Fine will be there for 10 lakhs. Question is, who should be surrogate mother? Ideally, she should be a close relative. And she should have at least one own child. Okay, she should have at least one own child. Okay, for how many times she can deliver a baby as a surrogate mother? Only for one time. But see, like in one time also there cannot be successful. So maximum for how many times she can try? Up to 3 times. Surrogacy important. In India, only altruistic surrogacy is allowed. Intrauterine death. Remember here, if you see, the gas in great vessels and heart chamber, Roberts sign. See, overlapping of skull bones, Spalding sign. Hyperflexion of a spine, Ball sign. All these are what? Intrauterine death. Remember here, Roberts sign, Spalding sign, and Ball sign. Now, which test we are using for live birth? Especially why it is important to understand. Remember here, as per law, all babies are considered to be dead born child. So first of all, we have to make it sure whether he respired or not. Okay, no? So if he has respired, after that he died, so now this will be suspicious. Might be neonaticide, might be feticide case and all, right? So see here, what is that test? One is called a Ploquet test. In post-mortem examination of the newborn baby, we are going to take the lung out, body weight out. Lung and body weight. Without respiration, ratio will be 1:70. After respiration, ratio will be 1:35. It is called as Ploquet test. Hydrostatic test means what? Remember, first life test, also called as a regard test. What does it mean? Okay, what does it mean? Remember, after taking, see here, after inhalation, after respiration, oxygen will be there in the lungs, air will be there in the lungs. You take the lungs out. If you keep the lungs in water, it will be floating. Respired lungs will float. Unrespired lungs will be sinking. In the same manner, after lungs, air can go into a stomach also. Now you take the stomach out with the double ligation method. You give one incision over greater curvature, you keep in a bucket of water. If air bubbles are coming out, it means baby has respired. It is Breslau test. Redens is a type of what? In the middle ear there will be what? Embryogenic. There will be the gelatinous tissue. After respiration, this will go down. Without respiration, it will be there only. So if you can find out this tissue, it means baby has not respired. Fodder's test. Respired lung will be heavier. Unrespired lungs will be light. Respired lungs is 60 gram. Unrespired lungs approximately 30 gram. See, ballistics means now the firearms. Okay, firearm. See, there are two types of firearm. One is called as a shotgun. Another is called as rifled weapons. See here. Now see, what is the problem here? What is the problem here? See, first of all, this is called as a barrel, right? No, this is called as a barrel. Remember here, in the barrel, when I talk about a smooth barrel was there, right? No, a smooth barrel. So remember here, what was the problem here? There was the dispersion of lead shots. That's why now when we made one more barrel, we made some kind of riflings. Riflings means groovings. Rifling means, and the same like in the bottle cap, like there are actually some groovings. Because of that only you can, after that only you can lock, no? So see here, so we did a rifling. Because of this rifling, now it is called as a rifled weapon. In smooth bore gun, there is no rifling. There is no rifling. In a rifled weapon like machine gun, revolver, in all these, yes, there will be a rifling. Rifling means there will be grooving. So what are the benefits of rifling? Now there will be more. See here, so because of the rifling, now there will be more spinning motion. So it will increase the velocity and destructive power. Remember, in a rifled gun, we are using bullet. In a smooth bore gun, we are using lead shots. So that's why it is called a shotgun. Okay? So है ना, तो इसी को हिंदी में बोलते हो ना, वो हिंदी में जो बोलते हो कि छर्रा. Right? No, charra. My question is that, see here, only this much part is called as bullet. Only this much part is going to enter their body. Okay. Now, the question is that whenever there will be, see here, agar a bullet hai, only one bullet will be coming out at one time. So you will see only one opening. But multiple lead balls are coming out. You can see multiple opening. Now the destructive power of bullet is, see here, so this is because of mass or velocity. Bolo? Yes, see, the destructive power will be because of velocity, because you have learned the kinetic energy, no? Half mv square. Please write down, destructive power is because of velocity, Okay, remember all these points. Now, see here. Now first of all, we are going to learn about, like the rifled gun. Suppose, see here, suppose if there are four, suppose if there are four victims. One is standing here, A. B is standing here. C is standing here. And D is standing here. Okay. Remember, in all ranges, remember here, in all ranges, shape of wound will be circular. If you see circular wound, it means, like, see, the bullet entered the body at 90 degree. If you see oval shape, no, then see bullet entered the body at acute angle. Okay. Chalo, theek hai? All right. Now see here, when I talk about if the gun is in direct contact with the skin. So what is the range? What it is called as? This is called as contact range. Okay, see, this is called as, see, the point blank. Dr. Amar, I think more 20 minutes or more half an hour max. Okay. B. See, the person who was standing in the range of a flame, he will be called as in close range. A person who was standing beyond the range of flame, but in the range of gunpowder, he will be called as in which range? Near range. Who was standing beyond the flame, beyond the gunpowder, D ko kya bologe aap? Distant range. Okay, so 4 ranges I have taught you. Okay, now see here, now to understand this. So like in the bullet, obviously there will be, see, the gunpowder also, है ना, gunpowder we are using. Remember here, we are going to repeat all this, don't worry all, है ना. Earlier we were making black gunpowder, but the negative point about the black gunpowder, it was having so much smoke. So because of that, lack of velocity. So what were the components of that? PCS, potassium nitrate 75%, charcoal 15%, sulfur up to 10%. That's why we have started making smokeless gunpowder. If we are using only nitrocellulose, single base. With the nitrocellulose, nitroglycerin, double based. With the nitroglycerin, nitroguanidine also, it is called as, okay, this is called as the triple base. Now, see the anatomy of a wound. When you will do the examination of the, say, gunshot injury, gunshot wound, no. See, this is called as entry wound. After that, see here, see now in the barrel, see the grease will also be used as a lubricant. Now when bullet is coming out of the barrel, when bullet is going to hit the body, it is going to enter. Do you think, see here, you can see abrasion collar also here. See, there can be the collar of grease also. Yes, this is called as a grease collar and a dirty part. And because of the spinning motion, see around the wound, you can see what? Abrasion collar also. Because of a smoke, you will see blackening. And because of unburnt gunpowder can get deposited under the dermis. See here, like under the epidermis. So because of unburnt gunpowder, you will see what? Tattooing effect. How to differentiate blackening and tattooing? If you see a gunshot injury case, no, you wash with the normal saline. See, blackening will go away, but tattooing will be there only. Now, let's learn here. See one more time. A person, see here, when the gun was in direct contact, isko bolenge contact range. In the range of flame, close. In the range of gunpowder, right? Near. Beyond the range of these two, okay? Isko kya bologe aap? Distant. My question is that, see here, victim number B, who was standing in the range of flame, are you going to see burning, singeing of hairs, tattooing, blackening? Yes, you are going to see everything. No, you are going to see burning also, singeing also. See here, when I talk about the burning, what? See here, victim number B. You are going to see the burning, yes. Singeing of hair, see, yes. Hana means like the burning of hair, it will become short. Blackening, tattooing, all. But what about a near range? What about near range? I am talking about victim number C. Near range. See, in near range, he was standing beyond the range of flame, but in the range of gunpowder. Are you going to see burning and singeing? Obviously, no. But gunpowder tattooing, yes. So in near mein, see burning, singeings, no. But blackening, tattooing, it can be there, yes. Especially that tattooing will be there, yes. And now you tell me, see victim number D, who was standing beyond the range of flame, beyond the range of gunpowder. Are you going to see burning, singeing, tattooing? Kuch dikhega? In distant range, all these you will not be able to see. No. Yeah. See here, so from here only you are going to see the question. B, C, D. Range you should know. Remember here, now you will be asking, sir, what about the contact shot? What about the contact shot? And very easy to, what about the contact shot? When see gun is in direct contact, when the gun is in direct contact, okay, now see when the gun is on direct contact, are you going to see the flame outside? Are you going to see the gunpowder outside? Outside, you will not see burning, singeing and all. But inside, yes. Inside you will see. Inside you will see. Outside, no. Remember here, in all these ranges, shape of wound will be circular. But when gun will be in the, see, when gun will be in the, like in the direct contact, no. Now there will be blast effect. So shape of a wound will be like a stellate. There will be the cruciate margin. Remember here, star shaped in direct contact or point blank. Now see the photo and tell me, what about this one? What is the range of firing? Can you tell me? Bolo, what is the range of firing? Yes, you can say, ये direct contact में है, right? This is in the direct contact, right? है ना, direct contact. Very easy to understand, direct contact. What about this one? Picture number 1 and picture number 2. In table में, oh sorry, see here. So this will be actually, see, this will be actually close. And this will be actually close. Right now, B is actually close. Okay, thank you so much. And here, this will be close, this will be near, this will be distant. Okay, chalo, fine. Now here you can see blackening also, tattooing also, burning also. So this is in the close range. But here you can see only tattooing. So this is a near. This is near range, right? Near range. Very easy to understand. Now it is very much clear. Now see, dekho, here you should understand that entry wound will be a smaller. Entry wound will be a smaller. Exit wound will be bigger. If you see, where will you see abrasion collar? Where will you see the grease collar? Right now, all this you are going to see at entry point. But where will you see fat, like fat protrusion? Fat is coming out. So that will be seen in what? Exit wound only. Remember like this. This is more than enough. Now see here, now shotgun, very, very important. See here, first of all, I have taught you 4 ranges in a rifle. Pehla tha direct contact, close, near, and then after that distant. Now shotgun, okay? Shotgun mein yaad rakho. See here, first is the same, like see, like suppose if this will be in the direct contact, okay, contact range. Within 1 meter, it will be called the close range. 1 to 2 meter, near range. 2 to 4 meter, intermediate range. More than 4 meter, distant. In shotgun, we are doing, there is something called as choking. This was the barrel. So what was the negative point about this? See, what was the negative point about this? Okay, there was the dispersion. There was the dispersion of lead shot. So that's why we have narrowed the distal part here. Right now, isi ko narrowing of distal part is called as choking. Because of this, what will happen now? Lesser dispersion. And there'll be more accuracy, more velocity. Okay, fine. So remember here we have to learn with the help of ranges. 0 meter, 1 meter, see that 2 meter, 4 meter. Suppose if there are 5 victims, A, B, C, D, and E. Okay, A will be called as in the range of the contact. B within 1 meter, close. C 1 to 2 meter, near range. We are adding one more range here, intermediate 2 to 4, and more than 4 meter, distant range. Remember here, up to 1 meter you will see all signs, burning also, singeing also, tattooing also, everything will be seen. After 1 meter, only entry wound. Please remember, after 2 meters, suppose see here, after 2 meter, no, lead shots will start scattering. Right? After 2 meter, now the dispersion will start. Okay, dispersion will start. After 2 meter, please write down, dispersion starts. But after 4 meter, maximum dispersion. See, remember here, like suppose if you have made, see, how do you buy in a shotgun? Suppose if I have given you, like 1 pound of lead. I asked you to make any number of balls you can make. So you have made 16 small lead shots. It will be called a 16 gauge gun or 16 bore gun. If you have made only 8 lead shots, small, it will be called as 8 gauge or 8 bore. Okay. So remember, after 2 meter, now when suppose if 16 lead shots are coming out, so obviously see in the center 4 or 5 balls will be entering at the one hole. After that there will be dispersion. And see 4 or 5 will be coming out like this. After that there will be dispersion. So after 2 meter you can see one big hole with a small hole. After 4 meter all dispersion, small hole. देखो यहाँ पे, you look at this photo, now you tell me this is a range of what? Intermediate range or a distant range? बताओ ये क्या है? बोलो. See here you can see one big hole with a small. So this is what? Intermediate range, right? Intermediate range. Now what about these pictures? Maximum dispersion, all small. तो इसको क्या बोलेंगे हम लोग? Yeah, distant range, more than 4 meters. So remember here, we have to understand very much clearly that, remember on the basis of pictures, you can easily understand, right? Remember, see, ballistics are very, very important. So what about 1 to 2 meter? Here you will see only one, one entry, but before 2 meters, somewhat potential came, no, for dispersion, no. So now see, before dispersion, all shots entered the body, but inside it will be going on like this. So inside it will be making like this, no. This is called as a rat hole appearance. Rat hole appearance is seen in 1 to 2 meter. Rat hole appearance. Okay, all these points are clear to everyone, right? Chalo, now medical jurisprudence. See, inquest, see the last chapter. See, inquest means what? Inquiry. Most common is police inquiry, but most superior is magistrate inquiry. Okay, once upon a time in India, there was the use of, see, the coroner's inquest. Means like there used to be a team, they used to do inquiry and they used to give judgment, but there was so many loopholes. So now we are not practicing it, but you should know, once upon a time we were using the coroner's inquest. Worldwide, most superior is medical examiner. Along with the police, doctor will also be going. Okay, so doctor will have the better observational skills, but in India we are not practicing this. So remember here, worldwide most superior is medical examiner system, but in India most superior is magistrate inquiry. What is most common? Police inquiry. है ना? So now it is what? 194, 196, right? Now, see here, now the police inquiry will be done in after murder, after suicide, rape case, right? But like after, so death by animal, death by machine. My question is that if a death of a person has happened during police interrogation, if death of a person has happened because of the police bullet, right, a police bullet, or if a person has died in jail, now who will do inquiry? Now police will not be doing inquiry. Who will do the inquiry now? Higher authority, magistrate will be doing inquiry, right? Very good. So magistrate inquiry will be done in A, B, C, D, E. Death in asylum, like hospital, है ना? Like psychiatric asylum. Borstal school is the jail for juvenile. C for custodial death, D for dowry, E for exhumation. There are two types of magistrate. One is called as judicial magistrate. Another is called as executive magistrate. See, executive magistrate, they are like, see here, so main responsibility of these magistrates are to maintain law and order, to maintain law and order. Okay, no? So like, say deputy collector and the collector, revenue divisional officer, and even the tahsildar. Judicial magistrate is appointed by the President of India. Executive magistrate is appointed by a state. See, judicial magistrate, like they have the maximum power, they can do inquiry in all the cases, but executive magistrate only in dowry and exhumation. Please write down. See, executive magistrate can do inquiry only in dowry and exhumation. Okay, only in dowry and exhumation. Okay, remember it, very, very important. Now, see, when I talk about civil court and the criminal court, see here, yes, one is a civil court, another is criminal court. See, civil court means what? See, civil court means what? See, देखो civil court में ना, like they will be like for the land disputes, for the family disputes, right? For the marriage, for divorce and all. In civil case, the party who is filing the case, he will be called as the plaintiff. A party who is filing the case is called as plaintiff. And against whom the case is done, he will be called as what? Defendant. And I say defendant. But in the criminal court, see here, the party who is filing the case, okay, will be called as a state. And the opponent who has to defend, he will be called as a defendant. He will be called as what? Defendant. Remember here, in civil case, the party who is filing the case is called as plaintiff. Okay, plaintiff. Okay. Now, see, there is a sequence of the criminal court. Highest level, Supreme Court. State level, High Court. After that, Session Court. After that, see here, Supreme, High Court, Session Court, or also called as additional. After the junior courts are there, like Assistant Session Judge, Chief Judicial Magistrate, first class judicial magistrate and second class judicial magistrate. Okay, see, this is the sequence: Supreme Court, High Court, Session Court. After that, Assistant Session Court, Chief Judicial Magistrate, First Class Judicial Magistrate, Second Class Judicial Magistrate. Remember, Supreme Court can give any kind of punishment, death sentence, right? Question they have asked: what is the lowest court which can give death sentence? Lowest court is what? Session Court. It can also give the death sentence, but it should always be approved by High Court. Remember it. Session Court is also called as additional session judge. Remember, assistant is junior. And what about these people? What about these, remember rule of 13710. Assistant session judge can send a person to jail maximum for 10 years. Chief judicial 7 years. First class up to 3 years. Second class 1 year only. Up to this much, how much fine they can impose? Unlimited. But here there is update. First class, he can impose up to 50,000 rupees. And second class can impose the fine up to say 10,000 Indian rupees. This is the update. Remember, see, these are the powers of all the courts. Now, medical evidences, one is a written, oral, which is called the parallel. Remember, this is most effective because here a person will be standing in the court. You can ask any question. You can ask leading question. You can do the cross-examination. Circumstantial, what you have received at the crime scene. Mauqae wardat pe kya mila? Like hair, fingerprinting, blood stain. Right now, at the murder scene, if you get suicidal note also, that also find fingerprinting, blood, bullet, and a bullet. Whatever you are getting at the crime scene during the circumstance, it is called as circumstantial evidence. And like if a person is standing in a witness box and advocate is asking the question, okay, to collect evidences, it will be oral. Okay, but written may most basic form, medical certificate like fitness certificate, right? And a leave certificate. MLC, medico-legal case. Medico-legal case. In any, see here, road traffic accident, poisoning case, see the drug abuse, rape case and all, fight case, any kind of injury, you have to make MLC. Minimum for, you have to preserve minimum for 3 years. Maximum, no time limit. Now, important is a dying declaration or dying deposition. Suppose after the murder, if a person is about to die, when a person is about to die, okay? So now if he wants to give any statement, okay, so just before death, if a person wants to give any statement, it is called as a dying declaration. Who will record it? Ideally, it should be recorded by magistrate. But see, at that time, you will not be having that much time to bring or to call or to invite the magistrate to hospital. See, person is about to die within 2 minutes or, few minutes. So who can record? Anyone can record. Anyone can record. See, it can be recorded by the doctor also, police also, village headman also, but it should be recorded in front of 2 eyewitnesses. Are you going to take the oath? Obviously, no. See, like it is assumed that a dying person does not lie. Are you going to do the cross-examination? No. Leading question means what? Answer should be in yes or no. Only yes or no. No leading questions. See, do you think doctor has to certify that before giving any statement, person was completely, fully, mentally composed, compos mentis? Yes. है ना कि yes, पूरे होशो हवास में बयान दिया. In India, are we practicing? Yes. But dying deposition. Remember, see the dying deposition. Okay. See, remember, you see the dying deposition, like suppose if a person is about to die, doctor said that you are having 7 days or 10 days. है ना? Now, if he wants to divide his property among his son and brothers, he can invite the magistrate, okay, for dying deposition. So that's why it is called as a bedside court. Who will record? Only magistrate. Oath will be taken? Yes. See, what about the cross-examination? Yes. Leading question? Yes. Yes, doctor. In India, are we practicing? No. So please remember dying declaration and dying deposition. Very, very important. Very, very important. Okay? Fine. Now witnesses में one is called as see, one is called as common witness, expert witness. A and B were fighting. C was watching them. So C will be called as a common witness. See, there can be eyewitness. There can be hearsay witness. Hearsay witness. See, when A and B were fighting, no, A took his revolver, he killed B. C has seen the murder. Now C will be called as eyewitness. Now C is running towards the police station. On the way, D met him. D asked him, hey, है ना, से उसमें क्या बोला कि D क्या बोला यहाँ पे कि D उसको कि where are you running now? Where are you running now? तो उसने बोला no, A killed B. So D will be called as hearsay witness. Okay, but most authentic will be eyewitness. Expert witness like doctor, firearm expert, writing expert, picture expert, right? Picture expert, all these, right? No, all these, right? So remember here, see here, doctor can be considered as common witness also, expert witness also. Remember here, when doctor is talking about कि wound है, normal ये वो this that, तो हो गया common. But if doctor is speaking about antemortem, postmortem, then he will be called as expert witness. Hostile witness who keep on changing the statement. Who keeps on changing the statement. Leading questions can be asked anytime from the hostile witness. See, what is the meaning of the perjury? After taking oath, if a person is lying in the court, it is called as perjury, punishable offense. Now see here in the court, first of all, oath will be taken. Oath will be taken. Less than the 12 year, no need of taking oath. No need of taking oath because it is considered as bacche man ke sache, they do not lie. But after 12 and the 12, they should take the oath. After this, there can be two advocates. One is called the public prosecutor who was fighting for victim, and one will be considered as a defense lawyer who was fighting for the accused person. Suppose if there was a witness who was summoned in the court. See, summon or subpoena. Please remember, summon or subpoena. S-U-B-P-N-O-E. Subpoena is what? This is like invitation letter from the court. This is a legal document which compels you to attend the court for giving the evidences. You cannot you cannot say, I will not become. If you are summoned by the court, you have to go to the court. Okay, summon or subpoena. Okay, fine. Now you tell me, earlier I was working in New Delhi, now I'm in Hyderabad. है ना? So suppose if I will be summoned by the court, suppose if during my duty, if any patient died, during my duty, right, I will be summoned by the court. I have to travel from Hyderabad to Delhi, right now, or to some other place where actually the case is going on. I will be getting some money. See, that money is called as what? See, that money is called as conduct money. Very, very important. This money is called the conduct money for the, yes. Who will pay you money? In civil case, the party who has invited you, and you will get the money during serving the summon. But what about the criminal case? You will not get the money during serving the summon. You will get the money after hearing the case. Who will pay you money? Either court or the government. Remember it, very, very important. Okay. Now, see here, suppose if a witness was invited by the public prosecutor, the advocate who has invited his witness, he will start the procedure. And see, this is called as examination in chief or direct examination. After that, opposite lawyer will do the cross examination, and again first side lawyer will do re-examination. Remember here, leading questions can be asked Leading questions means what? Where answer is only yes or no, yes or no. Suppose if the advocate is asking you, did you see the murder? Yes, sir. So the length of sword was 40 centimeters. No, sir, actually from the right side I saw. No, answer me yes or no. No, sir, from the right. Hey, answer me yes or no. So where answer is supposed to be given only in yes or no, it is called as the leading questions. Leading questions can be asked only during cross-examination. Please keep in mind. Okay, now see here, very very famous movie, Damini movie. Okay, she is Miss Damini. She was the main eyewitness in the rape case. He was Mr. Shekhar, he was Mr. Chadda. Shekhar has invited the Damini. Okay, so like Shekhar will be called as what? See, he will be called as the public prosecutor. Mr. Chadda will be called as what? Defense lawyer. Now you tell me who will start the case. Who will start the case? Mr. Shekhar. He will do direct examination or chief examination. Who will do the cross examination? Mr. Chadda. Mr. Chadda, है ना? सी देखो वो क्या होता है ना, ये फिल्मों में होता है कि जज साहब फाड़ दीजिए कानून की किताबों को. अरे जज है वो, तुम्हें फाड़ के रख देगा, वो जुबान से पोछे लगवाएगा वो, राइट? फिल्मों में होता है ये सब, है? रिमेंबर हियर, ठीक है ना? सो रिमेंबर हियर. सो लाइक okay, now you tell me who will do re-examination? Mr. Shekhar. Now you tell me, out of Mr. Chadda and Mr. Shekhar, who can ask leading questions? Can you answer me? Who can ask leading questions? Leading questions can be asked during cross-examination by Mr. Chadda. Mr. Chadda. Remember here, leading questions are allowed in the, see, during the cross-examination, hostile witness and dying deposition. Remember all these points. See the consent here. One is called as implied consent. If any patient is coming to my OPD, this is implied he did not come for tea or coffee. Okay, so I can do the examination, but important is, see, the expressed and written informed. Written informed is best. Suppose if a patient is going to get operated tomorrow, okay, right? Okay, for gallbladder surgery. So I should explain about the complications of surgery to my patient. Okay, that as you know, tomorrow, your surgery will be there, some kind of complications will be there, but we will always be ready to, tackle any kind of problem during surgery. Are you ready for surgery? Are you giving the consent? Yes. So see here, written informed consent is best. So like, see, the patient will put the signature and doctor will put the signature. Blanket consent at the time of admission of the patient. This is a rule. Okay, this is a rule. That, see, the blanket consent will be taken that we can do any kind of examination. Patient got admitted because of diabetes, hypertension. After 7 days, if you have to do surgical procedure, do you think so this consent will be enough? No, you have to take new consent. So blanket consent is legally zero consent. Now, see, the professional secrecy means what? If you get any patient, you have to maintain the secrecy. But in some special cases, you can speak about the patient. You can speak about the patient condition. It is called the privileged communication. Like suppose, like in a case of, like suppose if there is a driver. Okay. Suppose if we get any driver for medical fitness, but he cannot differentiate between red and green color. Dangerous. We have to inform the authority this person came for medical fitness test. He is having the color blindness. Okay. Suppose if a waiter is there who is having TB, we should inform the, like a restaurant like owner, okay, don't allow your waiter to meet any of the customers. Okay. So like if there was a case, a 25-year-old young man who was about to get married after 1 month. Okay. He is found to be HIV positive. Yes, you should inform his fiancée. Right? Because see, whenever there will be risk to other people, okay, there will be risk of infection to other people. Yes, we should inform, we should speak about, we have the privilege to speak about, to establish a good communication about the patient and his disease. That is called as privileged communication. In the court, yes, you can speak about psychiatric cases. Yes, you can speak about. Very easy to understand. Right. Chalo, we have completed almost each and everything in the forensic. I'm telling you how much we have learned here. Now, please revise it at least for 2 times. You see, minimum number of questions will be 10 questions. Okay, I'm sure minimum 9 you can solve. Aram se. Okay, so now 1 month left. 1 month left. Okay, do well, revise well. Thank you so much. I think ये miss हो गया कुछ ना, like infamous conduct. हाँ, I think इसमें कैसे नहीं आया, infamous conduct कैसे नहीं आया इसमें. Okay, चलो लिख लो जरा. Infamous conduct, I don't know इसमें क्यों नहीं आया मेरे इसमें. See, infamous conduct means what? Infamous conduct means what? Any immodest, any conduct. See, remember here, any conduct by a doctor which is considered to be, like not the modest, right? Like, like if a doctor is going to practice under the effect of alcohol, he is doing over promotion, and if he is doing a dichotomy, fee sharing, dichotomy, right? No, so dichotomy, right? So because of this, fee sharing, you have to get that test only from this, like only from this lab, only from that lab. You are writing unnecessary investigation. You are going to, like suppose if you are hiring a non-medico, you are going to covering, right? So all the over promotion, if a doctor is working under the effect of, like any kind of drug, all these are called as what? Infamous conduct. One is a res ipsa locutor. See, the medical and negligent of doctor is this much obvious, like he can leave a syringe, he can leave seizures inside the abdomen, right? So 100% doctor will be in jail. That is called as res ipsa locutor. Res ipsa locutor. Doctor, you will be in jail. Okay? And novus actus interveniens. Novus actus interveniens. Novus means new, actus means action, intervenient means to come in between. To come in between. Suppose if a stab injury case got admitted in your hospital, a stab injury. Severe laceration was there, severe laceration, right? No? And during surgery, he died on OT table. No problem, doctor, you will be in safe zone. But after this surgery, what happened? You forgot one sponge or instrument inside the stomach. It will be considered now new action. Now, doctor, murderer will be in jail. You will also be in jail. New action came in between. Vicarious liability. Senior has to answer for the mistake of junior, or hospital owner has to answer for the mistake of employees. Res judicata. The things which are already decided. Suppose if a doctor did a mistake in a hospital. Okay, patient died. Family member, they filed a complaint against the hospital. Hospital had to pay 15 lakhs rupees as compensation. After 1 month, again they are thinking, doctor was he was the main culprit. No, now they want to file a complaint against doctor. Now remember here. See here, now this case will not be taken into consideration again. One case only for one time. Res judicata. The case is already heard. Res indicata. Filing of complaint against the doctor. It should be within 2 years. If I did any mistake, patient can file a complaint against me within 2 years only. When doctor and patient both are doing mistake, then it will be called as, this will be known as the contributory negligence. This will be considered as known as the contributory negligence. Referral fees, yes, this is infamous conduct. Dichotomy is infamous conduct. Yes, it is wrong. You are getting extra commission, it is wrong. For this, first of all, you will get a warning notice from State Medical Council. After that, temporary suspension. Then there can be permanent suspension also. Permanent suspension is called as penal erasure. Please write down. Dichotomy is very, very important. Very, very important. Okay? Chalo, fine. So, I hope everything is covered now. So, thank you so much. I wish you all the best. Do well. And we will keep on meeting through social media. Chalo, all the best. Thank you so much. Bye-bye. Okay, good night also. All right. Chalo, bye-bye then. Thank you.